much along today. It is truly an honor to stand before you as on an insightful journey to the realms of innovation and transformation in public systems. I'm Aparmita, and it is my pleasure to welcome each one of you to this significant event organized by the Center for Innovations in Public Systems in association with Government Innovation Lab, Meghalaya. Cips, an autonomous center under the Administrative Staff College of India, was created to catalyze innovative changes in governance. Today, it stands as a champion of innovations across sectors like education, health, good governance, rural development, IT, and urban governance. With a rich legacy, CIPS has identified 500 innovations nationwide, implementing impactful replication activities in healthcare and education. Today's panel discussions on health, information technology, education, and environment and rural development provide a platform to exchange ideas, a visionary leader who has been instrumental in steering the course of innovation at the CIPS, Dr. Valli Manickam. Director, Center for Innovations in Public Systems, has PhD in Environment and a master's in both computer applications and sciences, with over 27 years of research and teaching experience in the field of environmental science and technology. She's also the Dean of Research and Management Studies, ASCI. Before joining ASCI, she has worked at Center for Atmospheric Sciences and Weather Modification and at Center for Environment's JNTU, Hyderabad. She has executed a DST Women Scientist project for lake remediation technologies. Dr. Manickam has developed software for the automation of the water and wastewater management systems and has also designed and developed a database for storage of the data during cloud seeding operations. She has worked on several environment projects and activities, which include an environmental impact assessment study for taking up industrial or tourism activity, the study of lakes in and around Hyderabad, study of pollution in surface and groundwaters, review of environmental statements, risk assessment, common effluent treatment plants, air pollution assessment studies, weather modification operations. Please join me in welcoming Dr. Manickam to the podium for the welcome address.
A very good morning to all the honors gathering here. Very good morning to Shri V. Srinivas ji, who has joined online. First of all, before I formally welcome all of you, I would like to thank Srinivas ji for joining online to this event where we are celebrating the innovators, where we are trying to look at the various innovations that have happened in four verticals. Hearty congratulations to all the award winners who are here today. It's indeed a pleasure to see you in person. We have been interacting over the various medias, but it's indeed thank you, sir, for for having actually made this event a reality here. Um, I both welcome and thank Dr. P.V. Ramesh, sir. Without his inspiration, this day would not have been true. Uh, it's been a year-long journey for us. All of you all are aware. We started this journey in 2022, end of 2022, and all of you all had submitted your nominations, and then the entire journey was guided by Dr. P.V. Ramesh ji, heading the committee. And sir, we are indeed grateful to you for the efforts that you have put in guiding the entire Cips team for us to be here today. A very warm welcome to all of you all once again. And we hope that today the panel discussions and concluding award ceremony would enlighten all of us with new thoughts, new ideas that can be innovative and move on to the replication to meet the end users in public systems. Thank you very much.
Thank you, Dr. Manickam, for your warm and cordial welcome. And now we are set for the day. So, ladies and gentlemen, today we have the privilege of hosting a distinguished individual whose career reflects excellence, leadership, and unwavering dedication to public service. Shri V. Srinivas, a senior administrator, esteemed academician, and an exemplary institution builder. Currently serves as Secretary for the Department of Administrative Reforms and Public Grievances, as well as Department of Pension and Pensioners' Welfare in the Government of India. With a master's degree in chemical engineering from Osmania University, Srinivas has left an indelible mark on various ministries of the Government of India, showcasing his versatility and commitment. His service extends globally, having advised the executive director in the International Monetary Fund in Washington, D.C., and representing India on the International Cotton Advisory Committee. Not only has Srinivas earned accolades for his administrative talents, but his literary achievements are equally commendable. His authored works, including India's relations with International Monetary Fund, 1991-2016, G20 at 2023, the roadmap to Indian presidency, and the March to New India, Governance Transformed, 2014-2019, have received prestigious recognition, including the Indian Council of World Affairs Fellowship Award. Recognizing his outstanding contributions, he has been honored with numerous awards, such as the Digital India Award, the Kaya Kalp Award, the AIMS Leadership Excellence Award, and the National Productivity Council Award. It is with great honor and pleasure that I introduce you to our guest of honor for this event. Please join me in extending a warm welcome to Shri V. Srinivas for the inaugural address. Sir, the stage is virtually yours.
Can you hear me? Can you hear me?
Sir, yes, we can hear you. Are we audible to you as well?
Yes, I can hear you now. I can hear you now. Can you hear me?
Yes, sir, we can hear you.
Have you invited me to speak or?
Yes, sir. We have already introduced you to our guests and they're waiting to hear you speak.
Okay, okay. Sorry, I lost audio for the brief introduction. Thank you very much. It's always a great privilege to be part of the Center for Innovations in Public Systems. And one of the great institutions of public administration in India, the Administrative Staff College, has played a leadership role in ensuring that the Center for Innovations in Public Systems operates within the broad ambit of public policy in India and compiles and collates innovations on a pan India basis. In my numerous visits to the Center for Innovations in Public Systems, as also to ASCII, I was amazed by the rich institutional culture that ASCII had, and also the tremendous volume of work and institutional memory that the institutions possessed. I'm grateful to the chairman and of the Court of Governors of ASCII, Sri Padmanabhe Garu, a very esteemed civil servant of the 1961 batch of the Indian Administrative Service, and all the deans of ASCII, Professor Nirmal Bagchi, Professor Valli Manikyam, and all other colleagues who are present. And the Cips innovations for the Northeast and for Union territories and hill states has been played out under the leadership of Dr. P.V. Ramesh, a good friend and a colleague from the Indian Administrative Service. And my congratulations to CIPS for undertaking this initiative. I was part of the restructuring of CIPS that was taken up under the leadership of former Finance Secretary, Sri Sumit Bose. And it was seen that CIPS would come up with a series of new activities, new workshops, new conferences and symposia, as also come in with a new work culture. And one of the initiatives that the Sumit Bose Committee had recommended was the setting up of an award for CIPS innovation, and this was to be taken up in the first phase in northeastern states, union territories, and hill states. So we've had all the union territories, all the northeast states, and hill states participating in this initiative, and more than 100 nominations have been received. I also noticed that the sectoral composition and breakup of the nominations in education, environment, health, information technology, and rural development broadly meets the priority sector programs that the Government of India has mandated. The draft evaluation process envisaged a multi-stage process with stage 1, stage 2, stage 3. There were also spot studies that were undertaken, and thereafter the consolidated scores have been formulated. It has been a very, very comprehensive procedure in which the CIPS has identified innovations, as also selected and shortlisted the award winners. My congratulations to all officials who have participated in the CIPS Innovation Awards for 2024, and also the award winners who would be speaking on this occasion in a day-long workshop. In fact, when I received the invitation from Dr. Valli Manikam to visit Shillong, I would have been very delighted to join each of you in Shillong in person. Only last week was I in Guwahati for the regional conference on e-governance and had the opportunity to listen to several of the presentations and meet several of the speakers who would be participating in today's deliberations. And but Dr. Wali was kind enough to extend an invitation to me to join by the online platform through Zoom. So I'm happy to share with you. Let me also give you a broader perspective of how the award schemes, as also this workshop, can motivate each one of us to take governance models of India forward. Let me give you the broad mantra in which the Honorable Prime Minister had mentioned in the Civil Services Day. And he had said that the Civil Services Day should become an opportunity to infuse new energy within us to make new resolutions. We should handhold the new officers with new enthusiasm. We should infuse them with enthusiasm to be a part of this system. We should take our colleagues forward while living our life to the fullest. The tremendous spillover effects of an award scheme and identification and documentation of innovations has been tremendous. I have been part of witnessing how transformative a workshop of this nature can be. In fact, a few years ago, I was in the National E-Governance Awards at Katra in Jammu and Kashmir. At that point of time, Jammu and Kashmir had about 225 services as e-services. The spillover effects of a conference, of a national workshop and a national conference were so tremendous that today the massive expansion in terms of e-services has witnessed J&K having more than 1150 e-services. I do recall visiting Shillong for the National E-Governance Conference in 2019. And thereafter, when we visited in 2024 for the regional conference on e-governance at Guwahati, what struck me was the tremendous adoption of technology across states and governments. And what was seen was in terms of the e-office implementation in Assam, the e-office implementation in Manipur, the e-office implementation in Sikkim, Arunachal Pradesh, as also the strengthening of statistics through the adoption of the District Good Governance Index, creation of strong digital platforms like the Seva Setu platform of Assam. Each of these had grown in stature. Similarly, the implementation of the CP Grams portal had also witnessed significant scaling up. One of the big changes in the new paradigms for governance in 2024 has been the adoption of technology. And technology has immense potential to bring government and citizens closer. Today, technology has become a powerful tool to empower citizens as well as a medium to optimize transparency and accountability in day-to-day functioning. Through various policy interventions, we're strongly moving ahead towards the digital empowerment of citizens and digital transformation of institutions. The message that I would like to give to each one of you is please pursue technology adoption in governance as you move forward, because many of the innovations that you can bring about can be possible through adoption of next generation administrative reforms using technology, be it use of artificial intelligence, machine learning, emerging technologies, Internet of Things. Each one of these is possible through an all-pervasive push towards adoption of technology. Let me also brief you that during my long years in DRPG, I have been part of 6 Prime Minister's Awards for Excellence in Public Administration. The nominations that I have witnessed from the northeastern states have been very significant. One of the first nominations that I recall was the implementation of the aspirational district program in Golpara, Assam. And that had witnessed tremendous replication and also tremendous amount of mention in a series of documents that the UNDP had published. Last year, in 2024, we had witnessed a series of success stories of Northeastern innovations under the Prime Minister's Awards for Excellence in Public Administration. These included the implementation of priority sector programs like the Har Ghar Jal program in Serchip in Mizoram, the Samagra Siksha program in Jammu and Kashmir, the aspirational district program in Baksa, the New Age Learning Program, New Age Learning Center that was identified as a district level innovation in Changlang district of Arunachal Pradesh. What we have also witnessed is that several of the government of India's programs under innovation have also been adopted in northeastern states. These included several of the innovation center programs like the National COVID-19 vaccination program that has been adopted at with great vigor and passion across all northeastern states, as also the implementation of priority sector programs, be it under health, education, and water supply, as also for the priority sector programs under the aspirational districts program. We have witnessed under each of these categories several award winners from northeastern states. I was particularly struck when I read the citation booklet for Serchip of Mizoram, and one of the biggest challenges was water shortage, and it faced acute water shortages, very high despite receiving high annual rainfall. And one of the biggest challenges in implementation of the Har Ghar Jal scheme in Serchip was to ensure that materials are sourced and pipes had to be brought from outside areas. Further, over a period of time, Serchip could convert itself from a water scarcity district to a district which supplied adequate supply of drinking water, and by enhancing supply from 7 liters per day to 55 liters per day through interdepartmental convergence. And not only was this increase in water supply per day possible, but it was also seen that the water quality was extremely good. This was possible because of interdepartmental coordination and administrative leadership that was provided by the district collector of Serchip. Another district that I would like to cite here is the aspirational district program of Baksa. And I had already spoken to you that Golpara was one of the trendsetters in terms of implementation of the aspirational districts program in the initial years of the program implementation. Last year, the implementation of the aspirational district program in Baksa had also witnessed a massive surge in terms of the number of indicators in which high levels of performance were witnessed, be it in education sector, agriculture sector, infrastructure sector, or financial inclusion. The district of Baksa had shown tremendous improvement. I would also like to mention the performance of Changlang as a center for innovation and in bringing together a new age learning center which used artificial intelligence and audiovisual facilities. And the impact of establishing an NALC was that children who were hesitant to even speak their name but were seen debating confidently and expressing themselves. It is important that each one of you stays focused on innovations, pursues innovations by adoption of technology, and focuses on bringing innovation into priority sector programs. And that is possible through interdepartmental convergence, a leadership role that is committed, determined, and disciplined, and dedicated to the nation first, citizen first approach that the government has been advocating. The other policy maxim that we have been circulating has been the maximum governance, minimum government. The maximum governance, minimum government policy is best manifest in a digitally empowered citizen and a digitally transformed institution. Now, these are possible with an all-pervasive push for technology adoption. And I would wish the Center for Innovations in Public Systems all success in their challenging policy endeavors. My congratulations to Dr. P.V. Ramesh and his team, Professor Valli Manikam for this seminal initiative, and my congratulations to all the award winners on this occasion. I hope that the Cips would initiate efforts for documenting all the success stories and ensuring that The success stories are widely disseminated across the nation. Once again, my gratitude to the CIPS leadership team and my congratulations to each one of the award winners. Thank you very much.
Thank you, Shri V. Srinivas, for your overview on the benefits of this workshop and at the same time highlighting the importance of technology. Also, thanks to technology that we could witness your address and have had the benefits of your wisdom and perspective. And I hope we can implement your advice in today's event, in today's discussion, and in life in general. Again, a big round of applause for Sir Srinivas. Ladies and gentlemen, now we are privileged to have with us a distinguished personality whose leadership has been pivotal in shaping the innovative landscape that Cips thrives in. Please join me in welcoming Dr. Nirmalya Bagchi. Dr. Nirmalya Bagchi is the Director of Administrative Staff College India and Chairman Steering Committee Cips. He holds the position of Director, PGDM, and Director, Center for Management Studies at ASCI. He has a PhD in Business Management and Master's in Business Management. At ASCI, Dr. Bagchi has worked on important assignments sponsored by the Department of Science and Technology, Bill and Melinda Gates Foundation, Defense Research and Development Organization, European Commission, UNICEF, Department of Administrative Reforms and Public Grievances, Reserve Bank of India, Sardar Vallabhbhai Patel National Police Academy, Ministry of Steel, Ministry of Skill Development and Entrepreneurship, Department of Scientific and Industrial Research, Department of Electronics and Information Technology, Commonwealth Secretariat, Department of Biotechnology, DOPT, TIFAC, ICFRE, CIPS, FMC, and INAE. Dr. Bagchi, I invite you to the podium to address the gathering.
Thank you very much. I think we have to do something about reducing that introduction. Good morning, everybody. It gives me great pleasure to be here, and you can't even imagine the pride that I'm feeling standing before you, because this, ladies and gentlemen, has been a long cherished dream of ASCII and CIPS. It's been in the making for quite a few years, and I'm very happy with all your support and the support of three key individuals that we are holding this event today. So first and foremost, I must thank our chairman, former Home Secretary Shri K. Padmanabhaiah, without whose steadfast support, guidance, and leadership, we would not be able to hold this event, this entire business of CIPS Award that we have conducted. The second most important person is Dr. P.V. Ramesh here, sir. Thank you very much for supporting us, guiding us, and also, telling us the right things to do, connecting us with the right people. Thank you very much. Without his support, we would not have been able to do this. The third is Shri Anjali Hajarika, who is, I think, here with us. She has been a part of CIPS for the last 10 years, and she has been from time to time telling us that we should be conducting this award because there are many things which needs to be documented. So these three individuals, of course, we have had great support from Dr. V. Srinivas, who is part of the advisory board of CIPS. And we thank you, sir, for being steadfastly with us in this journey. My sincere thanks to Sri Sampath Kumar and the Government Innovation Lab of Meghalaya for partnering with us. Thank you very much. Heartfelt thanks. That we are able to do it in Northeast because we are maybe 1800 kilometers from the Northeast, but we wanted this to happen in the Northeast. And this could not have happened without the generous support of the government of Meghalaya. We are thankful. And last but not the least, all the award winners and all the state governments who have partnered with us in this. We are very, very thankful. This is not a one-off initiative, and we will be conducting deep work with all of you, and we remain committed to working in this field. Srinivas Garu mentioned a lot about the workings of Cips and the workings of ASCII, so I'd not like to go into it. First of all, my thanks to him for elaborating it in such nice way, the work that both ASCII and Cips does. But I recall in 2007 when I was conducting the Prime Minister's Award for Excellence in Civil Services, one very senior person told me that government innovation, isn't that an oxymoron? And then we ourselves got together and thought through that, well, government is supposed to have a process and it's supposed to execute that process without fear or favor. And where is the question of innovation? And then we came to the conclusion that the space available to the civil servants is the white space between those two lines. We all operate within rules, those are lines, and the space between those two lines is what is available to all of us, where the structured thing has not been set. And those of us who want to do really good work, that is an infinite space that is available. And I'm so glad that in the last 15, 20 years, really solid work has happened, either be it in implementation of technology-led innovation or in process reengineering, bringing new legislations, transforming the lives of people by convergence actions. Many, many, many such things have happened. And as we, as the country aspires to go on a different growth path, I think these innovations should be encouraged. These innovations should be taken a notch up in scale. And that is where this award really comes into play. Mr. Srinivas mentioned that Cips had a review committee, and the review committee mentioned that we should go for an award. But we realized that while there are many, many awards for the rest of the country, very few awards and recognition schemes are there for people who are working in difficult geography, where working itself is a challenge. And that's how we zoomed in on the Northeast, the hilly states, and the Union Territories. And I must thank Dr. Ramesh for actually pointing it out to us in the very first meeting. We realized that working in the Northeast, hilly states, and Union Territories has its unique challenges. And those of you who are working in spite of those challenges need to be recognized. Their innovations need to be documented and replicated all across the other hilly states, other northeastern states. And that's why we chose this particular geography as the playground for the award schemes. And I'm very thankful that it received good response. We would have liked more people to have applied for the awards, but for the first iteration, about 110 people, I think 10 nominations came, of which 18 awards are being given today. We are very happy that we didn't restrict it to a particular number. In many verticals, we are giving 5 awards. In many verticals, we are giving 4 awards. Had there been more interesting nominations in many verticals, we would have given 20 awards. There was no restriction as such. And my thanks to my colleagues for not keeping that kind of restriction. We wanted to recognize the people who are doing good work. That's it. As we progress as a nation and we build fancy infrastructure and nice, shiny stuff all across the country, somehow we are losing focus of some of the fundamental principles which guided us as a nation when we became independent. And one of those fundamental guiding principles was Antodaya, which Mahatma Gandhi kept on hammering, that think about the last person, think about the last person in the queue, and what your work, how that is going to impact that last person. Shiny trains, fantastic infrastructure is nice, but I think we need to also focus on the basic things which will create the new nation that we all aspire for. And those things are health, education, and livelihood. And I'm very happy that these are the three major areas in which the awards are being given today. And of course, technology, which is an enabler for doing things, because it's a great leveler. Technology can level the field. So I'm very happy that the verticals have been chosen with a lot of thought in it. I'm absolutely sure that this is going to be only the beginning of a more deeper engagement between ASCII, Cips, and all the northeastern states with the government of Meghalaya and the other northeastern states and hilly states. We would like to do deeper work with all of you. And I am not here, to make a pitch or anything. We don't really, we are here, we'll find the funding sources from somewhere else. Let me assure you that. But I think there is a need for doing deeper work in this geography. And we are here to partner with all of you. At ASCII, we do several kinds of research. We do policy research, we do action research, we do impact evaluation, structuring, government advisory, transaction advisory, strategy consulting, capacity building, and many, many other things. But one thing which we love doing is partnering with different governments in formulating schemes which end up benefiting the large masses of people. Many of these schemes are not very remunerative for us. We are a self-financed organization started by the government of India, but we don't take any grants from anywhere, neither from any state government, nor from the central government, nor from anywhere else. So we are in that sense a unique institution which runs on its own merits. And let me assure you, we are a professional body. So the work speaks for itself. The awards that are being given here have been very thoroughly judged. There has been a procedure which has been without bias. And Mr. Srinivas mentioned that procedure, so I would not like to go into it. But my congratulations to all the award winners today. It's a great occasion for all of you, as it's a great occasion for all of us, because it's a great moment of pride for us, because we have been thinking of having this ceremony for as long as Cips has been in existence. And finally, we have been able to do it. But now that we have started it, it's going to be a yearly affair. We are here and we are going to do it every year. And my congratulations to Dr. Valli and her team, the Dean of Long-Term Program, Dr. Subodh, to all the award winners, to all the support people who are there from Hyderabad, even helping us beaming this program. Thank you very much, and God bless you.
Thank you, Dr. Bagchi, for your address. And talking about introduction, sometimes it becomes quite difficult to keep the introduction short when it comes to personalities like yourself who adorn many hats. So again, a big round of applause for you, Dr. Bagchi. Now we move to the heart of the event, the engaging panel discussions. Our first panel discussion will delve into the crucial realm of health. To guide us through this insightful conversation, we are privileged to have Dr. Subodh Kandamuthan, the director of Dr. Kakarla Subbarao Center for Healthcare Management at ASCII, as our esteemed moderator. Currently serving as the director and professor of the Center for Healthcare Management at ASCII Hyderabad, Dr. Subodh is at the helm of the postgraduate diploma in hospital management program at ASCII. Armed with PhD in health economics, Dr. Subodh has traversed a remarkable academic journey. His expertise extends beyond the classroom, having served as faculty in health economics at prestigious institutions like the Institute of Economic Growth, New Delhi, and the Institute of Health Systems, Hyderabad. Additionally, he contributed significantly as technical consultant for DFID, offering valuable insights into finance and procurement for the health department of the government of Andhra Pradesh. Dr. Subodh's commitment to advancing healthcare goes beyond academia. He has led impactful projects, including GIZ-sponsored capacity building program on Ayushman Bharat Pradhan Mantri Jan Arogya Yojana for the states and union territories of India. His extensive work encompasses economic costing and evaluation of healthcare programs, public-private partnerships, and replication of award-winning projects for various esteemed clients. Recognized for his exceptional contributions, Dr. Subodh Kandamuthan has received prestigious awards such as the Social Science Research Award from IDRC and the Australia-India Council Research Fellowship Award. His influence extends globally, as evidenced by his role as a technical committee member of the Mobile Health Technical Advisory Group of the WHO and his representation of India at the World Think Tank Summit in Yokohama, Japan in 2017. A prolific author, Dr. Subodh has published numerous papers in national and international journals and co-authored 3 books. It is an honor to have Dr. Subodh Kandamuthan with us today. Plus, please join me in extending a warm welcome to a distinguished academic and health visionary. Sir, the panel is yours.
Thank you. Before I start, I think I would like to invite the other panelists also to the dais. So that Sri Sambat Kumarji, the Principal Secretary to Government of Meghalaya, Dr. Funjok Nobo, Mission Director, ABDM Ladakh, and Dr. Arun Prince Milton, Scientist, ICAR. Dr. Arun, are you here? Yes. Sri Ram Kumar, unfortunately, is on travel, so we'll cover up because Sri Sambat Kumarji is already here. You have a mic? Yeah. Okay, friends, good morning and welcome to this panel on the very important subject of healthcare. I would say we are actually traversing through a very exciting phase in healthcare ever since the 2018 Ayushman Bharat programs, and also once COVID has happened, everybody knows how important healthcare has been. What I'm going to do in this panel is to just start with a couple of points for the benefit of everybody and on where we are in terms of healthcare. And I leave it to our panelists to talk a little bit about their achievements as part of the awards they've got, and then come back to the audience and have a discussion. So I have actually around an hour or maybe 45 minutes, 50 minutes today for this. The first point, I think, in terms of healthcare, you all should know that is the importance of health system strengthening. So everybody have realized the states which had a very good healthcare system, whether it's a primary care, tertiary care, or the health system resilience, as we say, have actually contributed and have actually successful been able to withstand the COVID crisis. So health system strengthening have become very important. The difference between the primary care, tertiary care, and as a health economist, I always know where is that funds going. Is it still on the primary care? Is it going to the tertiary care? How are we allocating our funds? How are we utilizing the funds? I think it's not always about the budgets we have, but also how do you use it? What sort of underspending is happening? What sort of absorptive capacity we have? That is another point actually, which actually has happened. And a third very important point, which has actually come in and very, very important, and you will see this in this awards, so many of them got, is about the community engagement. Health no longer is now going to be a particular department. The collaborations between women and child, the collaborations with water supply, the collaborations with rural development has become very, very important. What is the role of the self-help groups? What is the role of the youth clubs? The national-wide lot of innovations have shown tremendous, importance in these actors. What about awareness? What is behavioral change communication? And across the country, different models have actually emerged, and the importance of community engagement, whether it's a rural health, whether it's urban health. I'll give you a lot of examples. I think we have been documenting at ASCII, as at Cips, we have been documenting. People still, I think we are now in 2021, when we are actually going in the field, in remote Andhra Pradesh, remote Telangana, people have not taken vaccination because they said, no, it will affect my child in the future. We will not do breastfeeding because there are certain, this type of things are actually there. And you all know that nutrition and thanks to the SDGs, I think they brought nutrition and health together. I think in MDGs it was not there. And actually, now we know that. And a state like Telangana, although we are very good in health indicators, 50% of our women are malnourished. So what sort of how things between community engagement can be done is very, very important. And everybody talked about the technology and as an enabler, and definitely digital health has played a role. We have a panelist who will be talking about the ABDM and the importance and e-services. At the same time, I don't like the use of word telemedicine. It's actually it's all about telehealth now. Telepathology, teleradiology, tele-emergencies. I think we have traveled, and now you don't see, I don't know, in many states, you don't have those registers. Now you have all those tablets and gadgets helping people to ensure that we have data available. There are states which have actually got into health apps now, and I'm sure from Meghalaya, we're going to hear a lot of these good initiatives which are actually coming up. I also want to highlight just two major, very important issues. I think I still feel we still have a lacuna in the manpower issue. We can have, I think there are states which have gone on to have a medical college in every district. I know Meghalaya is still looking at having one or two good medical colleges in the future, and they will do it. But I think the model is actually better there, because it's better to have a good medical college with good infrastructure and a good manpower rather than having 20 medical colleges with no manpower, which is going to create a bigger problem. So manpower, and when it comes to manpower, what sort of incentives are you going to give stay in the rural areas? What sort of ways do you really require a doctor at the rural areas? Can we look at nurse practitioners? Those type of thought process are actually, India is actually now looking at. I also want to sort of before I move on to the panelists, talk a little bit about the supply chain. I think procurement is still considered a very important issue, and that's why we have actually a initiative, the drone technology, which is actually being used in Meghalaya, which has been awarded today. Diagnostic tests. There is a lot of hub and spoke. Now at a PHC level, you can actually get 30, 40 tests actually done free of cost. India has traveled quite a bit in these matters. The last couple of points I would end before I just move to the panelists is about the AMR, the antimicrobial resistance, the continuous quality improvement programs. And very important, ultimately, where are we going? We want a right to health. We want a universal health coverage. Everybody should be covered. It should be affordable to all of us. And last but not the least is we have got tremendous lot of innovations which are there. And I personally, to be honest, only after the awards, because I come from the southern part of the country, we always felt that, the South is actually doing well. Let me tell you, friends, there are innovations all over the country, and it's always good to replicate. There's no point reinventing wheel. It's so important to document, and I want to compliment Cips for that, because Cips is actually in the forefront of replicating some of this. I'll give you a small example, then you'll understand. Even at the state of Kerala, we have 2 tribal districts. And let me tell you, the way it's been handled is not that great as where in Northeast, where you have a lot of tribal population and you have done much better. I've seen where a lot of health insurance programs are there. When one state comes to another state, there is definitely a learning. So learning from each other, not reinventing the wheel again, is the way forward. And I would like to really hear from all these, which will be really beneficial for all of you. So I'm going to stop here with my initial comments, and I'll get back once all the speakers have spoken. And with these words, I would like to invite Sri Sambat Kumarji and a very interesting presentation on, I like the word because health always people talk about sort of a negative. I think his model is about positive healthcare management and for Meghalaya. Over to you, sir.
So should I sit and speak? Okay, thank you. I can actually speak. I think maybe it's better so that I can see all of you. So good morning to all of you. And first of all, I would like to thank Cips team. That's I hope it's not some sound is coming. It's not mine, right? Okay. So it's mine. This is God. Sorry. So there is a first of all, I thank Dr. Wali and Dr. Bakshi from Cips. Cips is actually a very important organization. We got to know that this was set up at the behest of the 13th Finance Commission to really identify and also promote the innovations within the government. So I really, we're very fortunate to have this kind of a collaboration with the Cips. And I also would like to thank Dr. P.V. Ramesh, sir. In fact, before joining the IAS, I worked for 2 years in the state civil service in erstwhile Andhra Pradesh. So he was my first boss. So he's a great officer, and in fact, he worked over 11 years in the UN, and and he was the principal secretary, health, finance, and the erstwhile AP. So we're very fortunate to have him also here. And we also heard from Mr. Srinivas, and great, to have all of you here, and also all the, in fact, the awardees who have come here from different states of Northeast and Union territories, and also the hill states. So we extend warm welcome to you, and all the the participants who are here to really to listen and also to share your perspectives. So Meghalaya, coming to the positive healthcare, that what actually we have been trying to promote. What actually we really trying to do, or we have been doing, is that we taken the health as a seriously as a state subject, because health is a health. Actually, if you look at it, health is a state subject. We have uh, different subjects are there. This, the subjects which are dealt by the center, which subjects are concurrently dealt by the center and the state, and subjects which are exclusively, and in fact, they have to be taken care of by the state. That is, health is a state subject. So why I'm saying this one, when we have started looking at that one, then we started looking at, what is the purpose then? If the state responsibility is to provide good healthcare, then the entire purpose would change. We are not just here to implement programs which are designed, at nationally. We are also here to achieve the purpose, that is to provide a better healthcare to the people of the state. So taking that, in fact, as a goal, we started actually doing, taking this, especially the COVID. So especially in the government, I was listening to Dr. Bakchi's statement, like, how the government can do innovations, so because I like that. So because government is a very, as you said, dotted lines, there is no, so how government can do innovation. So, but government can do innovations when I see actually, you have to see the moments of opportunity. So at least in Meghalaya, we have seen those moments of opportunity. Whenever we get a moments of opportunity, we really seize those opportunities. One of the examples I'll just tell you, not related to health, but way back in 2005, and so when we have this lot of unrest, agitations used to happen, bunds used to happen, we found, okay, why that was there. We wanted to fix the source of the problem. We found like people were not getting involved in the developmental process. So when we came out with the idea of village employment councils, we found like complete, change in the way actually that things can happen. So you need to see the opportunity. Similarly, for health, we found the greatest opportunity we found during the COVID. COVID was a crisis, but also it was an opportunity. So because there we could see, we can see the, we can convene people, we can able to make people to think deeply, so that process helped us. Then when we started looking at the data, I wanted to tell you how actually this entire innovation has happened. During the COVID, we used to have, a weekly reviews to see that like whether how the COVID is impacting the maternal and child deaths. Essentially, so when we started looking at, like, because that's a priority for us, because COVID fear should not actually create problems for the, the pregnant mothers to come to the health facilities. The COVID fear should not actually, create a problem for the children, because they are very small. They can't actually, ask for help. So we started having every week. In fact, my MD is not here, Mr. Ram Kumar. He used to have a review on Saturday. How many deaths occurred across the districts? We have this, we used to take a count line and why they died. So we started actually having this data. On Monday, we have this review with me, with all the, deputy commissioners and all the other sector departments. So why I'm saying this is, when we started looking at this data, the shocking thing is that every every week we used to have about 4 to 5 mothers used to die, and almost like the children, quite a large number, 30, 40, like that. So so that was actually, then when we started looking at that data, so why the mother has died, then we started looking at, there are so many, if you earlier we used to see that Meghalaya has one of the highest maternal mortality rates in the country, like Assam and Meghalaya. Some of the states have highest MMRs. We used to think that, we always, our general explanation was that it was we don't have the medical specialists because we specialist shortage. Maybe that is the reason. But when we started looking at it, there are so many other reasons, like why actually, when we go deeper, we found like a deeper issues, like which can be. So we started, like, for example, we found of all our discussions, like weekly meetings, continuously for about 6-7 months, we found that like one of the main reasons like why mothers are really dying was that there was no spacing between one child to another. So this is something like, again, it's a kind of a, then one of our directors of health services, they started saying that, like, see, we are a matrilineal society, but but basically whether, this particular, the lack of birth spacing can cause so much problem for the women. So women is not taking care of their own health, how actually to really promote that one. So then from there, we came out with this lot of ideas, like, how to actually prevent these, the deaths, how actually we can prevent these deaths. So how actually we can really mobilize people, where actually what needs to be done. So we made a lot of efforts, but some of the things I would like to tell you. First thing that what we did was, we actually at a state level, we drafted a state health policy, which has been talking about not just curative health, not that, like, we have now a state health policy which talks about 3 dimensions of healthcare. One, it's a preventive healthcare. 2, curative healthcare. 3rd is enabling healthcare. So I would like to tell you what is the preventive health. That's where actually, in fact, we have been presenting about positive healthcare. Preventive healthcare is that, we need to know, like, where, where is the problem coming up. For example, of the maternal deaths, we found a large number, quite large number, means a quite significant number, not large number, I would say, are teenage pregnant mothers. So why the teenage pregnant mothers are happening? So you need to bring some systemic reforms to really ensure that teenage pregnancy is reduced. So we started working on, like, on that particular idea, like how to ensure that, because a lot of dropout rate is there, and the dropout rate is leading to, so teenage pregnancy, because children are out of school. So so we need to fix that problem. Unless, why the dropout rate is there, again, we need to really go deeper into that one. So a lot of systemic reforms the state started actually implementing, like by introducing like programs, like we have a program now, Meghalaya multi-sectoral program for adolescent well-being, empowerment, and resilience, where the idea is that, how to actually engage the young people and see that, like, they are very effectively, nurtured. So second thing that we also started doing, that a lot of focus is given on this entire, the preventive health, as I said. So for that, like, one experiment what we did with using the technology, that's where actually this entire innovation award also at the Meghalaya is receiving. We have started, working very proactively with research and academic institutions. This is something that's a very important part for innovation. So you need to be very, so where we started working, and we have tied up with the UC Berkeley, and along with them, we brought some very interesting ideas, how to actually, ensure that every resident of Meghalaya can be screened, universal screening. That's the goal is that you can screen upfront and see that, like, you identify the problem at the earliest, and then using a behavioral change communication, using the network of community institutions, self-help groups, and, making sure that, like, they work on those problems to resolve the problems. So, for example, like I would like to say, like when we started doing this universal screening in a pilot area, Bhoirimbong block, we found a lot of participation from the women and especially from the children, and we could able to see that they could able to see the problems at the earliest, so that they can actually get, in fact there is a, I would like to say one more important thing. Even HIV/AIDS, if you screen early, almost like 80% recovery is there. So the idea of then we started talking about it, like screening is so important. So in Meghalaya, this entire this project, the way actually we started taking the proactive screening, proactive work, has led to more and more people actually started coming forward. In fact, every month we started actually identifying about 100 new HIV patients in the state, and it's a good thing because all of them are getting treated. So and then so we will actually solve the problem very quickly. So similarly, we started actually having the cancer screening now. Like we know Meghalaya now working with the World Economic Forum, we actually started a massive screening for cancer now. So we wanted to screen everyone in the state to see that they're not having any, whether they have any cancer symptoms. If they have, if you can screen early, so actually we can really immediately treat them, and we can immediately take all those steps. For example, one example of I'll tell you HPV screening that we have initiated now, HPV screening for cervical cancer, where if you screen early, the person actually can be treated without they getting into the cervical cancer. So some of these entire ideas actually we are trying to roll out through positive, healthcare project, the idea. So basically we're leveraging the existing programs of the Government of India, but also we're also adding some things which are very important from the state side. So that, for example, I told you, for reducing the maternal deaths, we have come out with a project called Chief Minister's Safe Motherhood Scheme, where actually we are providing, we are putting up one special app we created, developed. In fact, Mr. Ram Kumar is not here. We developed an app called Mother App, where we have the data of all the high-risk pregnant mothers. And this data is available with not only with the medical officers, but also with the block development officers, with the CDPOs and, ANMs. So with this particular data, we could able to identify the high-risk pregnant mothers and bring them to the institution for delivery. Our institution delivery has increased significantly, which used to be about 50%. Now the institution delivery has increased to over 70 to 74%. And we also actually started making, the purpose is important. Institution delivery is not more, it's not only important, but it also safe delivery is important. So we started actually sending our healthcare workers to the villages to help the pregnant mothers in the safe delivery practices. So with all this, actually we could see in the last 3 years, I think maybe you can see in this particular standee, so there is a 50% reduction in the maternal deaths in the state. So that's again one of a positive healthcare. It's not that we allow things happen, but we need to really take steps in such a way that you design new policy innovations, and the policy innovations actually, and also to build the policy innovations, you require a good political supportability. So we also have been actually basically work on that, cultivating that political supportability, and building that political supportability to bring those policies that are required to improve the healthcare. Today, this is not only this, and in the process, we could be able to take health as a priority of the state. And today, I want to tell you, Meghalaya stands #1 state in the health budgetary expenditure in the country. It's about between 8 to 9% of the state budget is spent on healthcare in Meghalaya. So it's almost like we doubled the healthcare budgets in the last 3-4 years. So that with that, actually, in fact, what I would like to share some of the things is that we also have been taking a lot of partnership with different states. Tamil Nadu is a state with which actually we are collaborating. Today, our doctors are getting trained in Tamil Nadu. on especially so they can come back and they can do anesthesia, they can do ultrasound, they can they can actually for emergency issues they can actually even do cesarean operation. So our MBBS doctors are being trained for a 6 months trainings over there already. There's a second batch going on. So like that, there is a lot of in this entire health system strengthening. What you said is that we also trying to actually how actually you can build the human resources, how actually we can in fact, we also set up a recruitment board for the Meghalaya Medical Recruitment Board. It's again a very unique thing. We through that recruitment board we have recruited 50% of the sanctioned posts in 2 months a period in 2022. So what I would like to say is that that's again when you some of these reforms and are really important for bringing that change that actually we wanted to see. So I think I'm taking a little more. I have taken more time, I suppose. I think I'm sorry. So I'll give it to you, Dr.
Thank you. Thank you, Sambhaji. I think that was quite this, and I think he's covered most of the points. Very, very important initiatives coming from Meghalaya. I'll now go to Dr. Funjak Nobo, who is the mission director of ABDM. Again, coming from a very difficult terrain, a fantastic initiative of integration ABDM into the e-hospitals. And our team had actually visited Ladakh, and I think we were very, very impressed. So would request Dr. Funjak Nobo to talk about it.
Sit and talk. It's okay. Okay. Hello. At the outset, I would like to thank CIPS for inviting us here all the way away from Ladakh, and also the people of Meghalaya for the hospitality. Regarding implementation of ABDM in UT Ladakh, actually, ABDM used to be called National Digital Health Mission when it was started in 2020. So Ladakh was one of the UTs where it was started on pilot basis before it was started in Pan India in 21 September, I think. So as you, I think most of you maybe not knowing about Ladakh. Ladakh was actually only two districts of as-well state of Jammu and Kashmir. So when it was separated from Jammu and Kashmir, we were only two districts. There was hardly any infrastructure or anything. We only have the district hospital. We still don't have any medical colleges. There is no tertiary system in Ladakh health care system. So when ABDM was started in Ladakh, actually we started registering the. I would like to introduce ABDM also. ABDM basically has a few building blocks. That is, you call it ABA, where you have a unique identification for everyone, every citizen of India. Then you have a health registry. Then you have a professional ID registry. So this HPR and HFR and ABA, it forms the main building blocks of ABDM. So coming to Ladakh, where we started implementation of this ABDM, since Ladakh is a very remote area, and when we started, I think less than 50% of the area was covered with mobile network. So we had faced many challenges. But over these 3 years, the network area is improved significantly now. Now I think 60-70% of our area is covered with mobile network. So in coming days, I think with the passage of days from the start of implementation of ABDM, we found things easier and easier. So when we started registering our facilities and our professional people in the registry, we faced a lot of problems because of network issues. The main cities has, the cities of Leh and Kargil had good mobile connection. So we didn't face any problems. But going into remote areas, Ladakh is area-wise, it is quite big. It is almost 2/3 of the state of J&K. So now we are only 2 districts because we are area was bigger than J&K. So the first phase was pretty, okay with us. Registering was okay, but when we start moving into remote areas, then we face real difficulties. So we, especially in case of ABA, because we can't move, a lot of people from remote areas to the areas where we have this mobile data network. So we requested ABDM to allow us to do the ABA generation offline. So they had given us a module through which we can do offline ABA registration also. But it doesn't end there. Initially, when this ABDM was started in Ladakh, we were able to generate ABA through mobile phone only, mobile numbers. But since people used to make health ID today, tomorrow they will make another health ID. So that way we had we faced a lot of problems because these people were registering with this ABA into our system. Like we used e-hospital in our facilities for registering. People had so many ABAs. One people were having 2, 3 ABAs. So the importance of having ABA was not it was not solving the purpose. So in the meantime, NHA also I think recognized that issue. So they made this other mandatory for generation of ABA. So that this duplication is avoided. So then we started registering our professionals. That was relatively easy because people moving professional to the areas where we had network was easier because we had only around 200 doctors. It has increased to 250 now, and only 250 nurses are there. So that was easy, and registering the facilities was also relatively easy because we used to move the facility manager to area where we had this network so that they can be registered. Now, in Ladakh, we have 32 PSCs, 7 CSCs, and 2 district hospitals, all and 288 sub-centers. All those facilities are now registered with the ABDM on the ABDM platform. And we are using e-hospital HIMS in up to the level of PSCs. And beyond that, we are using e-Sanjeevani, that is teleconsultation platform by CDEC. So almost every center is now covered through digital means. In the main district hospitals, we have been using this e-hospital. Now it has been shifted to next gen. People are now carrying their health IDs in physical form. Mostly in Ladakh, it is physical form because Ladakh, people are not that tech savvy. Only few people see, they can carry their these smartphones and register themselves through scan and share. The most of the people are, in Ladakh, they prefer to use their health IDs. They carry their health IDs to the centers. There we have a scanner in place, which is, integrated with the e-hospital system. You just scan the health ID, then your details are shared with the HIMS system. That way we have been registering our people. And government of India was also, in a way, very encouraging in giving us financial help because we were, new UTs. That way they were, quite helpful. Through that system, we were able to, procure this desktop for almost every center now. Every center has desktop. I think 70–80% of them have this data connection also. And at the up to the level of PSCs, we have even lease line data connection, so that it becomes easier because you can't depend on data connection. Mobile sometimes comes, sometimes it goes. But if you have a lease line internet connection, that way it is quite, it has helped us very, in a big way, I think, in registering those people. Now, the ABDM doesn't stop there. If while after getting registered into the system, it has to be attended by the doctors through HMS only. That we have been doing, from the start only in the district hospital. Now, even at PSC level, our doctors are, attending patient through HMS only, so that the digital records, that is remain there in the system. Then we have been using scan and share. Yes, I think most of people know about scan and share also, but it is our methods are mostly scan and pull method. I think which is much easier for, even in places like in Northeast. I would recommend to use scan and pull system. It is much easier, for registering people. NHA, of course, recommends scan and share because it is there. Actually, scan and share was first started by us only in UT Ladakh. Then we showcased that, system of registering in one of the platform. Then NHA then adopted that scan and share. What else I can say? Up to the level of PSCs, we have a doctor in place. So there is no doctor like in sub-centers. As I told you, we are connected with e-Sanjeevani, that is telemedicine. We have a hub in the main city of Leh, where normally a CHO is placed at sub-center level. Those CHOs can consult a doctor, which is placed at hub in NHM office Leh. That is it, sir. Thank you.
Thank you, Dr. Funjak Nobo. Sorry if I pronounced it right. Thank you. I think very, very important how he overcame those challenges to make it 100% digital, because I always see people saying, there's no network connectivity in states. So I think this is one example how we can do. And now go to Dr. Arun Prince Milton, scientist, ICAR, Meghalaya. Very, very, very innovative initiative. It's what makes an innovation really good is when it is very rapid and also is very cost effective. So usually some innovations are very costly, so which makes replication very difficult. So this is one innovation which is actually rapid and cost effective. Visual diagnostic kit for African swine fever, right? I think a lot of studies, I think he has already done the replication. And over to you, Dr. Prince, to share your experience. Maybe you can use your podium.
I better take podium. I have grabbed this writing material. Hope this works. So, very good morning to everyone. So, very first, I would like to record my heartfelt thanks to Cips for giving me the opportunity and also encouraging us with an award. And I'm immensely pleased amongst you, because I can see a lot of administrators and bureaucrats, because we often have a chance to meet fellow scientists, researchers. We are not in the implementing side. We are just doing research, and many a times we discuss amongst ourselves, then we will say, okay, the problem is with implementation. So at least today I can see many people who are there in the steering position, so that a lot of discussions, deliberations can translate into actions. So I am Dr. Milton. I come from a state called Tamil Nadu, but I work in Meghalaya since 2017. And we work in animal health aspect. I work as a scientist in ICAR Research Complex, that is for Northeastern Hill region. We have a dedicated and a passionate team of scientists. I have one senior colleague with me, Dr. Samir Das, who is also working with us. So this innovation is regarding a disease called African swine fever. Like COVID, we all know that is an exotic disease which we never had before. such a disease in pig is African swine fever we received through Northeast. It, due to the porous international borders, we call it as a transboundary disease. It is African swine fever. It's a very highly fatal, 100% mortality. So we lost a lot of pigs. So we did that. We controlled the outbreaks with a diagnostic kit, and rest is a success. But the outbreak is going on. We have been giving technological backstopping to the government of Meghalaya, and we have been testing the samples, and we are supporting them. So first of all, I would like to emphasize upon, because we have two panelists, Dr. Kumar and Dr. Norbo from health side. And what is animal health and how it is related to human health? So now globally, a concept called One Health is gaining momentum. So we all know what is One Health. Not only with diseases, infections, animal health is so important for public health. So we have got a lot many seniors here. So earlier we used to have diseases, malnutrition diseases like kwashiorkor, marasmus. So I have seen in textbooks, not really, but many might have seen that pot-bellied children. So there were huge malnutrition problems. So now we hardly see any pot-bellied kids, children. So somehow we have achieved that, and many innovations and advancements happened in animal sector, especially in dairy sector, poultry sector, and pigs, goats. So these animal proteins. So now we are leading in milk production. So now we suppose in Meghalaya, in every household we can see backyard poultry. So at least 2 to 5 chicken. Children are getting eggs. So they are consuming at least 2 to 3 eggs in a week. So these all happened due to the innovations that has taken place in livestock sector. And people like us, the government sectors, we have preserved animal health, and that is how we have achieved this. And as Dr. Bakchi said, innovations in government sector. So we do feel sometimes because I'll tell you analogy. It is like there is a swimming pool, there is some swimming race. So being in a government, I'm a scientist, I should speak my mind. Yes. So it is like donning your blazer, shoes, coat, everything, and swimming. But in private and corporates, they come with a swimsuit. But we know that we have to operate within this. But we all, I look forward. No, we are looking towards the institute like Cips and ASCII, that lot of policy reforms, some recommendations should go. Things are getting better. It is getting better, but some real reforms are required. So having said that, like the innovations, because I have already regarded some innovations that has taken place in livestock sector, in dairy, poultry. It is all due to the government sectors. So we have done a lot of, suppose in poultry, rigorous selections. Now we have chicken which can give 200 eggs, 250 eggs. We have dual purpose poultry which we can rear for eggs also and meat also. So these are all innovations which has started from government settings. Now the private setups has taken, and they are taking forward. And northeastern India in livestock sector, the sector is not very advanced, because here the people are having smallholder livestock system, very few, not big farms. And the type of farming is like low input, low output type of farming, subsistent type of farming. And there is a huge demand for meat, because the meat eating habit here is more. comparing to mainland. So a lot of demand is there, and we depend on interstate transports. We receive pigs, poultry from other states, and we have very mixed kind of very lagged farming system. But that system is very important for providing nutritional security, livelihood security, and now the farmers are into entrepreneurial activity also. So this smallholder livestock setting, one of the primary constraint here is diseases, the mortality, animal losses. See, in intensive kind of system, in large holder system, there may be a different kind of problem, like feed cost. Feed cost is a problem in a large scale farming. Suppose in a Hyderabad, there is a poultry farm which has got 2 lakh birds, 3 lakh birds. Suppose a bird has taken 50 paisa feed more a day, 2.5 lakh loss. So there, the problems are different. The feed cost, some other management aspects. But here, the diseases are important because the diseases cause mortalities, animal loss, financial loss, nutritional security will be stake. So the diseases are the important constraint which we have to focus, either it is a poultry or pig or cattle. And another aspect we need to emphasize or we need to focus more on animal health is zoonosis, the zoonotic diseases. At least 75% of the diseases which are coming to human is from zoonotic origin. So many examples, recent incursions of COVID, Nipah, many monkeypox, many diseases have their origin in animals. So zoonosis is another challenge we have. And particular to Northeast India, we have a biggest challenge, that is transboundary animal diseases. We share boundaries with at least 4 to 5 nations. There are a lot of porous boundaries which are not under surveillance. So many diseases. We had PRRS in 2014-15, very dreadful disease, which has taken toll of many animals. Now we have African swine fever. We have LSD, lumpy skin disease. So these are all the challenges in animal health sectors, which are intricately connected to human health and public health also. So the solutions are, the proposed solution is, one is surveillance, continuous surveillance, and early diagnosis. As Sampal has said, early diagnosis, HIV patient. Here in public health, it is unit. Every individual is important. But in animal, we call it as a population. Because early, if you diagnose the disease early, we can stop the spread. It will not spread further. Like the transboundary diseases entering into Northeast, if we can diagnose in the boundaries itself, or at least we can cordon and we can restrict the movement, we can restrict the spread of the disease, and we can restrict the loss. So the surveillance and early diagnosis is important. So where our innovation, so we in African swine fever, the initial challenge we had was we did not have a proper diagnostic kit. And the rest of the India was not knowing what is African swine fever. We were facing that in 2020. So we were trying to do some real-time PCRs. Then that was, very costly, and we don't have much support from the because it is not a it is a problem arised immediately. We had to face that. So we developed a kit. So it helped in early diagnosing the African swine fever, and we could control the further spread. And another important thing where the government should invest is field laboratories. We should strengthen our field laboratories. We should have some laboratories in border areas, in the interstate borders, because we receive animal from various states, and we receive, there are a lot of clandestine movement of animals in the porous boundaries. So we should strengthen our field laboratories. And another important, because I have said, like I've been working in Meghalaya from 2017. So the state like Meghalaya and other northeastern states should, because we are not in the implementing side, they are, veterinary care is actually given by the government of Meghalaya. The government of Meghalaya and other northeastern states should reconsider their the type of veterinary care they are giving. It is a humble submission before, because see, the condition is very unique. Here, hilly terrain, and you must have seen in our mainland or some in plain areas, people taking their cattle to hospitals, taking their animal. But here, droving a pig in a hilly terrain to hospital is next to impossible. But we are having stationary veterinary hospitals. A doctor is having a, sitting in a building, and I do not know what is happening. We see doctors only in preventive care, but they come for vaccinations. Otherwise, they are sitting in hospitals and public is there, and over the phone they are asking some medicines, and without seeing the animal they are prescribing medicines. So instead of heavily relying on stationary veterinary hospitals, these states should invest in ambulatory care. So we should have many number of veterinary or animal health ambulance, so that we can reach to the farmer's household and we can diagnose the disease and we can restrict the spread and we can avoid the animal loss. So that is one thing. And another thing, compensatory policy. So we do not have a proper compensatory policy. Sometimes we also feel, okay, so we are having a kit and we go to a farmer and we test their animal and we find some diseases there. Suppose a brucella. So if some doctors are there, brucella is a serious zoonotic disease. So which comes from animal to human beings. So where we get abortions and a lot of diseases. So suppose I am telling a farmer, your animal is brucella infected. So what this farmer will do, he will sell that animal immediately. So this brucella affected animal will go to a new village or new town or a market. And again, a new niche area or a new area will develop. There again, the animal will spread to the nearest animal, nearest, the human also will get the disease. So we don't have any proper compensatory policy. So I should tell, okay, your animal is positive, so you can slaughter or kill and bury this animal, this much compensation is. So I can recommend to the government. So such compensatory policy is not there. Otherwise, achieving the goal of One Health, it is very difficult for us. So rest is another two important issues I'll discuss that I'll rest. So one is, as sir said, that is AMR is coming up, so antimicrobial resistance, because now during COVID also, the secondary bacterial infections are more important. Many bacterial infections are very normal infections because it will not affect hale and healthy adults or like you, very young ones and elderly people. So their very immune status is not very sound. So they'll succumb to such infections. Normal urinary tract infections or pneumonia, it will convert to difficult to treat infection and no antibiotic will work. And finally, the mortality will be there. So AMR is important where the animal, because this under One Health, although we speak One Health, but we are all governed by different departments. Health is by health and veterinary, environment, wildlife. So we are fragmented in our administration, but that is why that stewardship in antibiotic use, if we bring in single umbrella, so we can control the use of antibiotic, we can deploy the stewardship. And the other problem is food safety. So as animal health is important, the sound animal health will ensure quality animal products, milk and meat products. So the products is also important. It is also intricately connected to animal health. Also, I do agree, some processing and transport there also, any hazard can enter. For example, suppose nowadays fish markets, they are selling formalin issues are there. So when I was a kid, I used to go to fish market. I used to see a lot of house flies. So now if I go to fish market, there is no house fly. So fishes are very, glossy and shiny, because a lot of chemical, they are transporting from Andhra to Meghalaya due to demands and all. So we have to invest in food safety also to achieve animal health, public health, and eventually One Health for our hale and healthy life. Thank you. Thank you. Thank you for the question.
Thank you, Dr. Arun. We are running okay on time, but I still want the audience to ask a couple of questions. If you have any questions, maybe you can take maybe 2-3 questions. Yes, sir. I think somebody can give a mic or I can just hand it over. Yeah, I think it's there in the left. You could just introduce yourself and tell to whom the question is.
Sure, sir. I'm Rajiv Sarkar. I'm from the Indian Institute of Public Health in Shillong, Meghalaya. I'd like to congratulate the panelists for the awards that they've gotten and really insightful thoughts. So this is a question to you, sir, Sisa Sambat Kumar, sir. You did mention about about the use of data in decision making. And I know working with you and the health department during COVID, Meghalaya has really used the data for that. But Meghalaya has also done a lot in terms of community engagement in health, in terms of engaging the community village health councils, for example. I'd really love to hear your thoughts, and if you could just elaborate a bit on that. Thank you.
Thank you. In fact, this is be the innovations actually what Meghalaya has been done. We will maybe when you have time, just look at that the basic 5 pillars that what we have used. It's a kind of a government innovation framework, you can say. We started it as a state capability enhancement project, but it's a kind of a homegrown initiative for last 5-6 years. We have been doing this. One of the important component we found is that effective use of data and research. That's one important pillar. The second important pillar for government innovation, basically government innovation means what? So not doing the way usually we do. We should do it differently. We should do it well. We should see that like the government is not just bureaucratic, or some red tape or, or something that. So to do that, basically to really transform the development work, we come out with a 5-pillar framework. After this, what Dr. Rajiv, what you said, actually, we tried this one. In fact, I wanted to tell you in COVID, during the COVID management, one of the things that what we felt was that, yes, from the medical expert side, we definitely require a lot of knowledge, and also the data, like, what are the trends and, how to really handle this entire COVID management, whether it is, how to actually, especially the calibrated containment strategies and everything that we followed. But at the same time, how to really communicate with the people, how actually communities can take ownership. So what we did, we initiated during the COVID time, we asked all the communities, please form a community COVID management committees, headed by the local headmen. Within 2 weeks, we got community COVID management teams across the state. And then when we start, the idea is not just like thing. The idea is that when you give the work to the people, it's a very important thing, giving work back to the people. That's a kind of, it's concept of adaptive leadership. See, if there is a problem which is faced by the people, and the people who are closer to the problem are in a better position to handle the problem. So this is a very important concept. The people who are closer to the problem can better handle the problem. So this is what actually, in fact, we tried doing this one, and then in the process we found they ran the quarantine centers. They actually handled, in fact, I would say they means this community COVID management teams have been tremendously effective. So taking that clue, what we did, we actually come out with a policy how to actually make it as an institutional mechanism. So the state government has brought village health councils is an elected body. I think some of you have come from the health departments. We have this village health and sanitation committees would be there, but they're all nominated bodies. But here what we did, we came out with a kind of a local body, an elected body for healthcare, where from the village, the people elect the health council members, and they are entrusted the responsibility of engaging with the departments, not only health department, but also social welfare department, but also with the community and rural development department. So in fact, what we did, the innovation here is that the community innovation, the traditional headman is the chairperson. So traditional headmen in some places of Meghalaya are elected headmen. In some places, they are hereditary headmen. And then the vice chairman comes from the self-help group network. So the co-chair is the self-help group. Vivo president is automatically chair. And the other members, for every 10 households, there is an executive member elected. So that way we created a very systematic pipeline to reach the last mile. So basically so that's where the entire mobilization has become very, very smooth. And they also, one thing, the health is something that I would like to again highlight why the village health councils are important. Our community participation is important, because this is something that is it's most important for the every individual. Health cannot be just delegated to one agency. In fact, a lot of responsibility should be taken. That's why it's the village health councils are going to play a very important role, and we have been seeing the way actually they have coming up in Meghalaya. So, but coming back to the question of the data, this is again, and research is also we found like it's a kind of a we collect the data, but how effectively are we using the data? So I think a lot of emphasis is being given how actually to use the data. So that's again a lot of work is also happening on that. How to help the administrators, how to help the field level functionaries, especially the BDOs and CDPOs, how to strengthen them with the data. So like giving that data, and we also have in Meghalaya we also have one more concept called social audit. Social audit also comes from a community data. So how actually use the data for effective decision making. Thank you.
Thank you, Sambhaji. Anybody else? Yes, I think we are on time. I think I will just take 1 minute to formally close the panel. I would like to thank the panelists, all three of them. A round of applause to this. I just want to just highlight, I think, based on the discussion, I think very, very important about the collaboration. I think not just across departments, but also across research institutes, self-help groups, youth clubs, going to play a very, very important role. And what Dr. Arun rightly talked about, the One Health approach. I think that's going to be the next big thing. I think AMR is going to be there, food safety. I think important issues being raised about the compensatory policy. I think these are things which we need to sort of take care. And from ABDM, the lesson I'm getting is, I think he said there's no dearth of funds. I think that's exactly true when it comes to budget. I am actually seeing no state government who's saying there is a lack of funds. Funds are available. How you actually use it is the way forward, and you can actually do innovations with that. Thank you very much, all the panelists. I'll formally close the panel. Thank you.
Thank you to all the panelists for this insightful discussion on health, especially for someone who works in parasitology lab. I totally enjoyed this session. And now I'd like to invite Dr. Bakchi on the dais once again to felicitate Dr. Subodh with memento. Round of applause. All right, so with this, we'll felicitate. So with this, we have come to the end of the first session. And since it was a discussion on health and how important health is, it is also important to grab a cup of tea so that we can rejuvenate our energy and come back for the second session. However, I'd like to mention that the tea break is going to be just for 10 minutes. So it's exactly 10 minutes to 10 minutes to 12. So we'll again gather here sharp at 12 p.m. Thank you. Hello, check. I request everyone to kindly settle down. We will begin with the second session. If you still haven't finished your tea, you can come in with your cups. I repeat, I'd like to invite everyone inside the hall. We'll commence the program now. So welcome back to the ones present here right now. It's warmer inside, so I'd invite everyone to come in. And we'll begin the second session, which is the panel discussion on information technology. And the moderator for this session is Dr. P.V. Ramesh, IAS retired, Chairperson, Awards Committee, Cips, Member of Steering Committee, Cips, and Member of COG, ASCII. Dr. P.V. Ramesh boasts a distinguished four-decade career as a senior IS bureaucrat, complemented by an impressive academic journey. A first-grade MBBS graduate from Christian Medical College, Vellore, and a Master of Surgery from Guntur Medical College, his professional trajectory includes serving the government of India in various key roles. Notable positions held by Sir Dr. Ramesh include Director General at the National Archives of India, Chairman and Managing Director of the Rural Electrification Corporation Limited in New Delhi, and roles as Special Chief Secretary, Development Commissioner, Principal Finance Secretary, and Principal Secretary of the Department of Health and Family Welfare for the Government of Andhra Pradesh. Furthermore, Dr. Ramesh dedicated 13 years of his career to international organizations such as the International Fund for Agricultural Development, United Nations Office for Project Service in Asia Pacific, Arab states, Africa, Europe, and the United Nations Population Fund. His global contributions have left an indelible mark on various fronts. Sir Dr. P.V. Ramesh, I invite you on the dais to lead the panel discussion.
Friends, very good morning. I think we are running late. I've been given 1.5 hours, this panel, and we are now left with 1 hour. So we will, first of all, I want to thank Madam Wali for inviting me, and Mr. Bagchi is the Director General of ASCI for having me here, and more importantly, Mr. Sampath Kumar and Government of Meghalaya for hosting us here first. And congratulations to all those who've been awarded innovations in public service. And it's been very important journey because I recognize and we recognize together that Northeast and hill districts of this country face innumerable challenges and also opportunities. And each one of you are struggling in different parts of the country, many a time on your own, without much of a support. And so it's important to recognize, it is important to recognize those important innovations which have made a difference to the lives of people, to the lives of citizens of where you work. And the unfortunate reality, what I have realized myself over nearly 40 years in the journey in the civil services, is that civil servants, those who work hard, innovate, transform, when they leave and everything falls apart. And we hardly ever recognize that we are part of a long chain. And long chain, there are many links before us and there would be many links after us. And the chain is as strong as every link. And we many a time forget that we are the universe. And so that's one of the reasons why the country takes one step forwards and two steps backwards and yet another step sideways. And so we are not really progressing at the pace at which we have an opportunity and the potential. So with those words, I mean, I just briefly, we're talking, this panel is on information technology. And when I joined service in 85, we didn't know anything about so-called digital transformation or information technology. Our academy in the Mussoorie had 2 computers, and which we got an opportunity to see, touch, and feel, and hardly anything else. And DOS operating systems was still. It was 10 years later, 95, that first the World Wide Web had come. Then, of course, I mean, it transformed the world as we've known. And in fact, I've been witness to the journey before. Many of you may not have known what the world was like before the digital universe intervened. And I have been a strong support advocate and coordinator and lead for various digitization initiatives. And they have had phenomenal impact in terms of productivity, in terms of transparency, in terms of the citizen-friendly, citizen-centric outcomes. On the other hand, I've also seen how the digital divide can be a disaster for the citizens, for the poor, for the deprived, for those marginalized, those who are elderly. It could be an absolute disaster. I have any number of examples from my own experience. And sometimes now, 10 years later, I look back and regret. And with a great enthusiasm, I had driven driven both Aadhaar enrollment in Andhra Pradesh and also the direct benefit transfer piloting in Andhra Pradesh. And I also see the downside of it. NREGS now has excluded almost 38% of people who are the poorest, who are the elderly, who are Adivasis, Dalits. And so this has a potential both ways. I've also seen, as a finance secretary, we had digitized the entire financial operations. And I thought it is transformational. It eliminates any semblance of discretion and interference, and it brings greater transparency. Today, I noticed that the entire treasury is managed by one person, and which is the chief minister. So, with all respects, I mean, it has both sides, but I appreciate and I congratulate the winners, and then I request the gentlemen and ladies to come on stage, those who've done outstanding work and share their experiences. First, may I take the liberty to invite Pallav Gopal Jha from Assam, and Mr. Anil Semwal from Himachal Pradesh. He is representing Mr. Mukesh Rapaswal. Welcome, sir. And Mr. Manavendra Goswami from Assam, and who is representing Shantanu Kotmare. Mr. Isaac Sotapyu, welcome. From Mizoram, and Mr. Krishna Kumar from Manipur. Mr. Krishna Kumar from Manipur. So, welcome, friends. And may I first call upon Mr. Manibendra Goswami to start his presentation on what he has done in terms of web-based water supply connection registry. No. Online pension sanction and payment tracking system. Please.
Thank you, sir. Good afternoon, esteemed members of the panel, distinguished guests, and ladies and gentlemen. I, on behalf of Government of Assam, is presenting you about the online pension sanction and tracking system. So I am from the Government of India. I am from National Informatics Center, but we have designed, developed, and hosted an application on behalf of the Government of Assam. Basically, Kitaggata is a term that is used as a sense of gratitude to the government servant who have rendered service for more than 30, 35 years and all that. So Government of Assam, earlier they were using all the manual system, and basically the retirees were facing problem. While tracking the data, while tracking their pension sanction, they were not aware about the facts. When a bunch of papers were actually returned to them, to correct it, and then it takes around 2 to 3 years of time to get a pension. So we have shown Government of Assam, Honorable Chief Minister, and he has then told us yes, national application should be rolled out in terms of the Assam Pension Rule 1969. That is the rule engine that you need to incorporate into the system, and then you have to build a online mechanism to track the pension and to sanction the pension. So Kitaggata basically role-based system, role-based application system, where actually retiree can register themselves, and the stakeholders are retiree, the head of office, who is the custodian of the service book, and the pension issuing authorities, that is the Accountant General and the Director of Pension. In Assam, there are two pension issuing authorities. One is the Director of Pension and another is the Accountant General. The provincialized post of the school teachers are dealt by the Director of Pension. And the government servants are dealt by the Accountant General. Apart from that, there are college teachers whose cases are also dealt by the Accountant General. So there are two channels actually. When a pensioner applies into the portal, his pension proposals are coming to the head of office, who basically see the all application forms, photographs, everything that is uploaded into the system, so including service book. And then it process through the head of office. Head of offices are processing the pension cases based on the rules that is available in the, one need not to go by the rules even. The system himself give you the actual calculation that is required for your, to get the pension, in time. So, and then once the calculation and all the pension proposals are approved by the head of office, that is basically sanctioned by the head of office, it goes to the pension issuing authority directly online. Once the online proposals are submitted to the pension issuing authorities, so pension issuing authorities goes through the entire system, and then if everything's are okay, all right, and it does not require any kind of correction and all that, so they approved it in the same day and it gets transferred to the treasury. We have integrated the treasury, state treasury, AG office, and the Assam Kritagata portal together, so that the data flows to the treasury directly, and treasury officer, once he get the pension payment order, can approve the pension. Basically, this is the complete workflow. Apart from this workflow, we have also, Honorable Chief Minister in 22nd July 2022, 22, he actually told us that there are service books are there which are actually in a very bad shape of the school teachers. This service book, if they send by post, once it reaches, it gets destroyed somewhere. And then you are not able to find a good signature, good photograph, good all these things in the service book. So at the field level itself, this service book need to be scanned and uploaded. Then the pension issuing authority should get it on their own system. So we have designed pension seva kendros. Pension seva kendros are basically a cyber cafe kind of a thing for the retiree. Retiree can go see their all the transaction details, status, and everything there in the system by giving their PAN number. So to identify a pension, it requires only the PAN number, and the retiree can get his pension in time. So if a retiree applies, say, 3 months before the date of retirement, it's 100% sure that the retiree is going to get his pension payment order before the date of retirement. That is the achievement for us. And for the last 2 years, initially, we have only captured the Kamrup Metropolitan District. Later on, we have rolled out to all the government departments. And out of 20,400 and something figures, 19,500 PPOs have been issued till then. That is, our achievement is 92.5%. In this way, I have come to know from different retirees. Actually, retirees used to call me, but they have got my number, somehow my mobile number. And some of them told that this is, something happened. We did not even thought of it. ऐसे भी हो सकता है क्या? Like that. Yeah, it's happened. So they have received their pension in time. They thought that, okay, we have applied, we may get a provisional pension, provisional DCRG, something like that. And then we'll go over there. But yeah, they are getting their full pension in time before the date of requirement. And they can approach. And now we have added to this innovation. Actually, we have seen that there are family pensioners, The basic rule here is that when a pensioner is getting his PPA order, he need to appear himself before the treasury. First pension, to get the first pension in Assam, one has to appear before the treasury. And then once it is verified, then the pension, online pension is been issued to the pensioner. But see, if a pension is sanctioned and by the time the pensioner goes to treasury, if something unfortunate something happens, then what will happen? Then the entire pension will convert it into the family pension, and the spouse needs to appear before the treasury, and he or she needs to verify himself, and that takes another 1 year process. So we have seen that if we can add a rider clause, we have gone through the details about the rule, and then we have seen that if the online generation of pension PPA orders can have the rider clause separately, in the event of death of the spouse, once the family pensioner appears before the treasury and shows, and his or her name is mentioned in the PPO book, then the treasury officer should immediately release the pension, the arrear pension that is due to his or her husband, spouse, should immediately given to the pensioner. That is a very good, initiative, and Honorable Chief Minister have accepted it. And all the pension seva kendras, they are also giving the support. Even in some cases, the head of offices do not have the idea to fix the pay. In that case, online generation of pay fixation is also available. If it is tallied, then pay fixation need not to be seen or checked by the pension issuing authority. That is so much about the Kitagata. Thank you, sir.
Thank you. Congratulations. And that's a very good initiative. People serve 30, 40 years in the government, and then they have to struggle to get their pension. And so many papers and so many complexities. And I think it's very important to, number one, when people retire, to acknowledge and thank them for the service to the public, because public service is an honorable occasion. And when they retire, they must be entitled to get whatever is the token of continuity of connection with the government. In fact, in Andhra, we have done away with the need for anyone to appear. It's done biometrically. And I myself is a pensioner of the United Nations system, and we do it digitally. I mean, it's just an app, and it's once a year. It's you just renew, and then it gets paid. So I think the digital innovation can be transformational for the people. They must be able to see how much is being paid, what is the deductions. I think these real-time innovations can, particularly for people who retire and give pension on the day, all the benefits on the day of retirement. I think that's a matter of great satisfaction. So may I now request Mr. Mukesh, Anil Semwal. He's Joint Director in IT in Himachal, and their Mukhyamantri Seva Sankalp, which is an innovation in the citizen grievance redressal.
Thank you very much, sir. Thank you, panel. At the outset, first of all, I would like to thank the Center for Innovation in Public Service, CIPS, and the award committee to select the project from Himachal Pradesh, which is the Mukhyamantri Seva Sankalp Helpline for award. Thank you very much. So about the project, I would very briefly, try to introduce you to my our project. So on behalf of Himachal Pradesh, I would like to tell you that this all started with the project called, the Prashasan Janta Ke Dwar. When the officer used to go to the lowest level at the panchayat level to listen to the grievances of the people, to listen to their complaint, listen to the issues which people are used to face. So this continued till 2018, when there was a change in the government, and then new project called Jan Manch started, where apart from the officers, the political people also, ministers also started going to each constituency, and in each constituency there was a panchayat selected, and then the grievance used to come. But then there was the issue that issue of coverage. You can listen to only few people. You can get engaged to only few people uh, through these programs. So then there was idea of developing a portal. In fact, there was already a portal. But then even through the portal, what I think is what state government also thought is that we need to have the system which is all inclusive, which is not only for the rich people, to the urban people, young people, literate people. It should be, available, accessible to even the rural people. In Himachal, we have 90% of population residing in rural areas. So it should be accessible to rural people, poor people, illiterate, old people. So, so there was a thought of starting a helpline. And then The officers were sent to various states, big brother states like Madhya Pradesh, Andhra Pradesh, Rajasthan, all these states, to understand the kind of grievance redressal system which they had. So I was also part of that study team. So we went to various states, and then finally we had a system where a helpline was developed, which is and a number was given, which was 1100. So this number was publicized to the citizens, where people were able to call through this number and register their complaints and grievances. So, and this was one second. So this this made the input system very easy to the every citizen of the state. It made more accessible, because people are very friendly by just calling a number rather than inputting in some portal, or or registering somewhere else. This was first. Second was, we had a bottom top approach rather than top bottom approach. So this was a second innovation. So what happened is that usually in a government process, the complaints come at the top level. People come to either the chief minister or the HOD level. They give right to these people only, and then that complaints goes down to the operational level. So it takes a lot of time while complaint is actually redressed. So we had a bottom top approach where we had 4 levels for handling a complaint: L1, L2, L3, L4. L1 is typically at the block level, L2 is at the district level, and then L3 is at the department directorate level, and L4 is the secretary level. So these are the 4 levels through which the complaint is escalated. So the complaint, when it comes to the helpline, it goes directly to the L1 level, where it is actually is to be resolved. For example, in case of water or the electricity, it goes to the concerned JE, so that he is able to resolve it. So the resolution time is drastically reduced. So this is one innovation, bottom top approach. Secondly, we had, in each department, we had attribute system. So we categorized the complaints. For example, in case of electricity, we had non-supply of electricity, one category, and then second category would be, the low voltage or non-availability of electricity connection. So these are the categories. So we categorized each complaint. We call them attributes in each department. And then in each department, we have a turnaround time for complaint to resolve. Typically, it is 7 days. So each complaint is to be resolved in 7 days. Of course, in the case of electricity, it is to be done in much more faster. But mostly it is 7 days. So whenever a complaint is received at the helpline level, it goes directly to the L1. SMS is generated. SMS goes to the concerned officer, L1 officer. He receives the mobile number of the complainant. He can directly get in touch with him. Even the complainant gets the contact number of the person to whom the complaint has been allocated. So it is both ways. So communication can take place directly. In case the complaint is not resolved within the turnaround time, which is normally 7 days, so it goes to the L2, next level, higher level. So and again the escalation follows, so it goes up to L4 level. Second thing is, the most important is the citizen satisfaction. The complaints gets closed only if the citizen is satisfied with the resolution. So every time a complaint is closed by the L1, L2, L3, L4 officer, it is called as a partial closure. It closes only partially. So a call goes back from the helpline to the citizen to know the satisfaction. And then only if he is satisfied, the citizen says, "Ke, bhai, mera kaam ho gaya, I'm satisfied with the resolution," then only it gets closed. So in Himachal, we have 71% satisfaction level. 71% people have got satisfied with the resolution. Till now, we have got 6,40,000 around these complaints. And out of them, around 4.45 lakh complaints have been satisfactorily closed. So remaining complaints are such where, the citizen says, satisfied नहीं, and you can't, satisfy each and every person. So then it escalates, and then at the L3 or L4 level, which is normally director or secretary, they can close it. Then we call it as a, which then it gets forcefully closed. We call it special closure. So this is the overall system where, the complaints are escalated. So, and the result is that, because it is the bottom top approach, about 64% of the complaints are getting closed at the L1 level itself. So it started with about 50% satisfaction level initially, but now it is at the 71%. We had, we had fixed the threshold value of 70%, but now it is 70%, but it is now 71%, which is the highest in the country. The other states like Madhya Pradesh and Rajasthan, they are also having the similar kind of interventions there, but they are around 66%, but we are at the 71%. So this is all about our project. Till now, it is working perfectly fine. In fact, there was a government change last year. So the chief minister personally visited after taking the oath, and then he continued with the system when he saw the utility of the system. Actually, it is very popular, 1100 in Himachal Pradesh. So it's very successfully running. Thank you. Thank you.
Thank you. Thank you very much, Mr. Simwal, for illuminating us with the grievance management system in Himachal, which is a very important thing. May I now call upon Mr. Krishna Kumar, Deputy Commissioner from Manipur, to talk about the e-portal, e-district portal, right?
Good afternoon to all the sirs and ma'am. First of all, I would like to extend my gratitude to Cips for giving us an opportunity to have an interaction with all the senior officers, officials, and experts from the different fields and sectors. So, as we know that for the success of any program, plan, and project and schemes, our interest, motivation, and attitude, it matters a lot. So before I come to about the initiative e-district portal, for which we are going to receive today an award, from where I drew my inspiration, my interest. So a few years back, I had an opportunity to work in DPIIT, Department for Promotion of Industry and Internal Trade, which is under Ministry of Commerce and Industry, Government of India. The work which was assigned to me that time, it was IT intervention for ease of doing business. And I was lucky enough to work under the then secretary and honorable MOS and with different senior officials. So in one meeting, when there was a discussion, and they had mentioned that suppose if some businessman wants to set up a factory, what would be prerequisites? First, we have to identify the land. Second, to know the status of land, whether the particular land belongs to the concerned seller. Is there any loan taken on that land or not? Thereafter, it comes to the registration of land. Then again, partition and mutation of land. The next step was, after doing all formalities to construct a building for the particular business or factory, we need to have an approval for building plan approval for factory, for which also we required some clearances from Forest Department, environmental clearance are required. We need to have some NOC from the Fire Department. some connection, whether it's electricity or water, different prerequisites. The main objective, how we are going to make it easy and accessible for each and every businessman if someone was willing to start their business. How to bring all these things at one platform. Because for up to registration and mutation of land, we have to visit in different offices. To get NOC, again, we have to visit in different offices. Next, I would mention about the two incidents. First, about my first posting as a district collector and deputy commissioner and magistrate in the Bishnupur district, where after a few days after my joining a group from the third gender, they visited to my offices. And while having an interaction with them, they seems to be very angry and frustrated. They mentioned that just to get a single certificate related to their identity, from last many days, they are visiting to our office, but still they couldn't get. They also complain about the subordinate staffs. That time I had two options, in fact, I would say. First, to call the staffs and give them nice scolding, yeah, preaching and something else. And next, how to silently work and try to understand the problem and get the possibility to how to avoid this kind of inconvenience for the visitors, those who visit to our office. Then we had a first meeting with our IT department under the guidance of IT directorate from our state of Manipur and also from the ministry. We send our two staffs to get to know about the process, how to generate and issue certificate under Transgender Persons Protection of Right Act 2019 and Rule 2020. It all happened within 1 week. And after 1 week, their certificate was issued. Though they were not required to pay visit to our office, but I received a call from their side and they said, sir, from last many days, we are getting troubled and bothered to get just one certificate. And also from their group, only few of them initially they had started to come and receive this certificate. So they requested, sir, of course, it can be issued by your digital signature, but we want to pay visit and get your seal and signature in manual form. I said, no, it is now not anymore required. From anywhere, in fact, from your phone, you can just log in and get your certificate. They said, no, sir, just to pay our gratitude, we want to visit you. So that's about all motivation which we get. Because every day in our offices, number of visitors, they pay visit. Some of them, they may go back with happy faces. Some of them, they may not feel happy because their work was still pending. But if at the end of the day, someone come and pay visit to you to share their pleasure experiences, that really make you happy and motivated. The next incident which I would mention, for which today we are going to receive this award, it is about our Ukhrul district. I don't know how many of are aware and read about this Ukhrul district and what is the importance of this district. It's a district which shares its porous boundary with Myanmar. It also knows about its a difficult terrain, tough terrain, hardships, lack of public transportations, number of constraints. So after joining district, one day I was visiting to one remote and bordering village. And while on the way to that particular village, we could see one vehicle. It was a Shaktiman truck, which was earlier used by the armed forces, Later on, it was condemned, declared condemned and auctioned. So in every village, you can find these vehicles because of this feasibility in that particular terrain. So we stopped the vehicle, and during interaction, since most of them were young boys and girls with their parents, and they were rushing towards the headquarters to get the certificates, whether it's a caste certificate, domicile certificate, or PRC, or income certificate. So we asked them, what is the need for you all to visit to the SDO offices or district headquarters, and how much are you going to spend just to get one certificate? While having this interaction, some of them, they had mentioned, sir, to visit headquarters and to get this certificate, first we have to spend that much money for this transportation. Second, some of our parents, those who are daily wage earners, they have to also lose their daily wages. It was the crucial moment for us also to rethink about our responsibility, our duty, for what purpose we are there, how we are going to ensure seamless service delivery up to the last mile. So immediately we had a meeting first with our IT department. With me today, my informatics officer, Mr. Ramson, he is also here. With IT department, with all the sub-divisional magistrates and their subordinate staffs. The question was how we are going to sensitize them, how we are going to train them, because there was a lack of trained persons, staffs who can handle this work. Immediately training was started for everyone. It was 3 rounds of training. Second question was about the common service centers and sensitization, and to make aware all the public so that they can apply from any common service centers or from their phone also, because in this 21st century of digital era, each and everyone, they are having mobile and access to internet. So of course, there was a common service centers for each village, but most of them, they were non-functional, except few, those were and specifically for the public, now they don't need to pay visit to any offices. from their home also, they can get this all certificates. Nobody needs to lose their wages. Nobody needs to unnecessary pay transportation cost. Our intervention, it was not only restricted up to the e-services, it has extended up to the e-scholarship, e-procurement, e-tender, and e-hospital also, where we could start telemedicine. Last but not the least, I would say ki for us, we do like a number of works, whether it's related to law and order, land management, conduct of election, road work, safety, security, health, and all. But if we have a zeal and we have interest in a particular area, definitely we could get the success in the area which we want. And I would also mention vision of our government of India. I think most of us must have heard about the Mission Karmi Yogi, which is an endeavor to prepare public servants for the future by making them more creative, constructive, innovative, energetic, proactive, professional, energetic, and enabling. But also we do know ki from where it gets its inspiration. It gets its inspiration from the motto of civil services, which is Yoga Karmasu Kausalam. The excellence in action is yoga. So I do hope it was a small journey which I have shared today. And now since I have been moved out to another district, now I'm also working on the land management, how to digitize all the documents and ensure getting of all the certificate through online only. So once again, thank you each and everyone and Cips to giving us this time to sharing our thoughts and experiences. Thank you.
Thank you. Thank you, Mr. Krishna. Thank you. Congratulations. And may I now request Mr. Isaac Zutampia to present yours innovation in RTI online.
Senior officials from various state, esteemed guests, panels, and my dear friends. Good afternoon, everyone. First of all, I would like to thank Cips for giving me an opportunity to share my experience in implementing this online right to information. First of all, let me, since time is running out, I won't take much of the time. Let me start with a brief introduction about our organization. Mizoram State E-Governance Society is a society under Government of Mizoram. We are the implementing agency for various e-governance projects in the state of Mizoram. But unlike other states, we have a very limited budget of information technology. It's hardly about 450 lakhs per year, which is hardly sufficient for the salaries of the employees. In such situation, it is very difficult to excellence in the field of IT. However, we didn't lose hope. We tried our level best. Actually, I'm leading about 30 to 35 technical manpower for implementing various e-governance project, and we had implemented a lot of projects for the state of Mizoram already. I think we have proposed this online RTI for the award because of its huge impact rather than its simplicity. We don't, we don't apply much complex algorithm. The simplicity is just as simply providing a platform for submitting online RTI queries to the government and empowering the citizens
to submit, track, and receive the RTI queries through online. See, so, like other state in Mizoram also, we are the RTI process in Mizoram is done using a manual process which require time and effort, a lot of times and effort. Also, the citizens are not much aware about this online RTI. Once they submit the on RTI online application, they are not aware that if if the queries are not responded within 30 days, they have the right to submit their complaint to the Department Appellate Authority, and that can be further taken to the Chief Information Commission. So there are lots of RTI queries which doesn't get responded and no action taken. So first, the most important thing is to aware the citizens that if at certain level, if their RTI queries are not answered, they have the right to complain or submit their grievances and to the higher appellate authority. So this awareness is done by making a simple video, YouTube video, and disseminate it to the citizens from the website itself. And I think you can, everyone can see the portal. It's rti.mizoram.gov.in, where we have, kept all those videos, all the FAQs and others important documents that are required for the citizens. So since this online RTI cannot be implemented by single department because it involves certain certain department like the CIC, it needs the active involvement of Chief Information Commission, whether action is taken against RTI, queries submitted by the citizen. So if action is not taken, if the answer is not provided to the citizens, the CIC should have, he should have a strict vigilance on why that CIC is not, that RTI queries are not answered. Likewise, it requires the involvement for the success of this online RTI. It requires the involvement of various individuals, officials. Also, the one of the difficulties we face is the transfer and posting. See, in each department, there should be one DAA, Department Appellate Authority, one SPIO, State Public Information Officer, and ASPIO. So after certain times, those people got transferred to another department. So it creates a problem. So we provide a solution by giving a simple ways to update their profile, so that if once get transferred, the person who is taking over the charge will update his profile by updating his phone number and email, so that he can continue using that account. That means, in short, we are providing a very simple and simple process to update their profile in case when there is transfer and posting. So as I said before, it has a very huge impact in bringing in transparency to the government. See, during the manual times when RTI was submitted manually, the number of RTI queries submitted was 1,327 only.
that is during between, we take the data during the 2021 and 22. After the implementations of online RTI, that is in July 2022, the data submitted, the RTI submitted was rises to 5,241. That I think that is a huge transaction comparing to the manual process. If RTI queries are submitted are submitted in this have an impact on government. It provides transparency to the government. So this is the beauty. So I would like to encourage other states also to, if you can implement this online RTI, that this will have a huge impact in your state also. And it's very easy and simple. We are always there to help you if you would like to replicate this system. That's all what I can say. Thank you.
Thank you very much, Mr. Isaac. So friends, any comments, questions, clarifications anyone would like to seek? This is an important subject. Anyone? None whatsoever. So I think it's time for lunch. You want to ask? I want to say something. Yeah. No, first of all, congratulations. Each of you have created a model, a pilot, which can be replicated, which can be scaled up by others. Technology, obviously, application in governance is a transformational potential. It brings transparency, as you've all said. It makes ease of doing work, conducting business. It happens in real time. It shortens the delays. It eliminates corruption. A whole host of benefits that accrues. But many a time we seem to think that technology is a substitute for the man or a woman. And that's many a time we, particularly bureaucrats, tend to think, because it helps us reduce our own work burden and also, push it into the ether, the digital space, which we cannot see. So I think we need to be very, very, very sensitive. I'm increasingly coming to the realization that huge opportunity, huge potential for transformation, but at the same time, it can also create a huge disaster unless we are sensitive that we are not doing this for the sake because of the excitement of technology, but because of the citizen benefit. So if you keep the citizen at the center, not really the administrative work, and then very, very clear standard operating procedures, very clear key performance indicators, very clear transparency in terms of communicating. Otherwise, it just gets lost. I've seen what we can do. We've implemented in a state of Andhra Pradesh e-office. Everything is a paperless office. We celebrated. I was at the forefront of that. Now I notice that we don't have a record of what comes, what goes. And, technically there is supposed to be a digital record, and there's manipulation. There is all types of things that are possible and then it can eliminate access to people who most deserve. If I don't know English, I don't have a smartphone. Only less than 45% of Indians have a smartphone, though we think it is all over the place. I mean, the reality is such that 55% of people don't have access. And even those who have access, it's not necessary that they are digitally illiterate. And language is a barrier, and it's complex. And I myself, when I want to go on some of these applications to apply for something, the program crashes, the website doesn't respond. It takes an enormously long time. This is with a good high-speed internet. So friends, I mean, we need, in our country, I think we need to strike a balance. We need to understand what works and how these, at the end of it, we keep the citizen at the center of any innovation. And I wish you all the best. And I wish you, I think it's time for your announcement, madam. Thank you.
Thank you to all the panelists for this insightful talk on information technology. And now I'd like to invite Dr. Nirmala Bagchi on the dais to felicitate our moderator.
Thank you, sir.
Thank you. All right, so Dr. Ramesh sir has already declared. So we are going to break for lunch now, and it's going to be for 25 minutes. Actually, it's half an hour, but I'm cutting down to 5 minutes so that you come back. 1 hour? Okay. Congratulations. It's 1 hour lunch, and we'll gather here at exactly 2:15. All right. Thank you.
Iya, bilang. Nanti Hah? Hah? Nah, Caca, wifi ya? Boleh ya? Caca. Hah? So, isi toilet. Kuat. Ada mana? Boleh. Salih sipit dah ibu mah. Kalau ayat kurang. Tadi beri rumpun mandum. Kalau tidak bisa. Berat, berat, berat. Duit nih, hitam ya. Mana? Mana? Abi anak singgah sudah. Lucu sudah. Lihat, ya, ini mah. Namanya aja. Tentang itu tuh bu yuk change lah. Tapi kalau
request everyone to settle inside. We'll begin with the third session. Good afternoon, everyone. Welcome back. I hope you have had a great lunch. Conferences across the globe, like the International Association for the Study of Dreams, International Association of Process-Oriented Psychology, Switzerland, and the World Congress of the International Federation of Training and Development Organizations, to name a few. Actively involved with research-based advocacy on women's leadership issues at workplaces, she offers workshops that develop new skills and strategies for change. She co-founded the Forum for Women in Public Sector, set up under the aegis of the Standing Conference of Public Enterprises, New Delhi, and has been its president. An executive coach in private practice and on the panel of Center for Creative Leadership. She's a member of Advisory Council and Steering Committee of Cips and has been associated with Cips since its inception. Dr. Hazarika, I'd like to invite you on the dais to lead the panel.
Good afternoon, friends. Welcome to this exciting panel on education. I'm very inspired by your presence and your contributions to innovative practices in the various states from where you come from. Education, as you know, is the foundation stone of a person's development. They say there are 3 power centers in one's life: mother and father, teachers, and gurus. Now, the informal education starts at home, but the formal education takes place in schools and colleges and even in preschool age. If you pay attention to the word education, it comes from, the root word comes from Latin or Greek. It's called educare, which means to bring forth, to draw forth, or to train. So the question I'd like to ask ourselves, especially all those who are working in education sector, and also to them, is, are we creating enough conditions in a way that children's abilities or the unique gifts that they are born with, they get a chance to sprout? Are we creating a hospitable environment where these abilities come forth? If this has happened, you have done your bit towards education. Because as you will know, when you transform the education system, you transform the future generation. The contribution is going to go a long way. And have you heard anecdotes from very many people who have achieved success in life, where you ask them to reflect on their journey, and they always come back to that point of remembering a certain teacher who made a difference to their lives. And how old were they when they remember when that difference was made? 5, 6, 7, 8, 10, or whatever it is. We only remember those teachers who have made impact on our minds. And some of the things that they have talked about, we carry with us all our lives. Isn't it so? So I'm so glad to report to you that in this exciting panel, you would see a range of innovations, which is as diverse as the innovators, the locations the innovators come from. We have an innovator from Jammu and Kashmir who has achieved taking education to the doorstep and provided basic literacy. We have an innovator from Himachal Pradesh. Based learning opportunities are provided. We have one from Chandigarh, where joyful opportunities to learn has been created. And then there is an integrated approach to learning through the Potion Club, where children are nurtured as ambassadors so that they take this message home and they involve the entire community in the development. So all these are very impressive contributions. And therefore, I'd like to invite the panelists on the stage. We have Sri Shambir, Deputy Commissioner Ganderban from Union Territory of Jammu and Kashmir. Welcome. Please come. Sri Devraj Dhiman, Principal, Hamirpur, Himachal Pradesh. Aye. Srimati Varnali Deka, District Commissioner, Nalbari, Assam. Welcome, Varnali. And Srimati Ravinder Kaur, Deputy Director, School Education, UT Chandigarh. Welcome, Ravinderji. Now, for the sake of convenience, I would just like to share with you that, the session plan, and tell me if it works, that I would request you to introduce yourself, then give a little brief about the innovation that you have presented, which has been an award winner. Take about 5 to 7 minutes to do that. Once this round is finished, I would ask certain open-ended questions in terms of what has been your journey so far, what has been the challenges, how have you overcome them, etc., etc. And then we would throw the session open for the open house, because I can see that there is a great deal of wisdom sitting here. And they can also ask questions which will make us think and go forward. So is that okay with you? Yeah. And then we have to hard stop at about, it's about 2:30 now, about 3:15 or 3:30. Who is going to tell me that? So I'm not going in any particular order, but may I request Sri Shambir to talk about Mashale Gash, the initiative that you have taken, implemented in Jammu and Kashmir. You want to speak?
Good afternoon, everyone. My name is Shamvir. I am IAS 2018 batch, MP cadre, and born and brought up in MP only. But I worked on one project which is called Mashale Gash. So Mashal means beacon and Gash is knowledge in Kashmiri. So beacon of knowledge, that's what our project. And we targeted, because in 2011, our census was 58% literacy rate. So we targeted to increase it so that the next census, when it comes, it will improve. So what we did, we framed 3 pillars basically. One is education for all, basically adult education, all at once. That means we will go one time and we will cover each and every one. And third is for the people and by the people. So education for the people, and it will be taught by the people. So this is the basic pillars that we envisaged. And in this, what we did first, we identified the beneficiaries through survey through Anganwadi workers. And in that, we took like the people who haven't studied till 6th. All those people, we line listed them, and then we had a figure of my district population is 351,000 as of now. And then I got about 72,236 people. So it is the exact number which we got. Like these are the people who need to be given foundational literacy, critical literacy. Critical literacy means the skills to maneuver around this literate world. So critical literacy is one part of it. So we planned a curriculum. We made it in-house itself. We planned a curriculum of 4 or 5 subjects. And then we mapped each person to each individual who will teach them. So initially what we did, we identified school-going children or college-going children in their own homes. So that was done. And we also invited volunteers. So many people from our degree colleges, from our ITIs, they also volunteered. And they took initiative for 4 or 5 people. So that way, each one was mapped. And then we created a monitoring system at the village level, then at the block level, then at the subdivision, then at the district level. So we created a monitoring mechanism so that we can assess it. And after the completion of this program, which took us about 4, 5, 6 months, then we did a third-party survey. And it works in Jammu and Kashmir. And we found that 89% was our current literacy rate as per the survey estimates. So this a success. And then what we did after 3 or 4 months, we are again going also. So we are again going to them and we are again monitoring whether the parameters that we have given to them, whether the population is following it or not. So this is from my side. Thank you so much.
While you're still on the uh, when you initiate anything new, it is very important to monitor it from time to time. So can you tell us something about the monitoring system that you had implemented?
Yes, in at village level, we identified one teacher from our government school because education is prime responsibility of the education department, that we understood. So we identified one teacher at the village level. He used to send us report of the village people. Like suppose in a village they have 100 people, so we will make a format, and in 100 people daily he will write and he will give us format whether they have studied or not. Then we do for 1 to 3 days. We did it on daily basis. Then we switched to bi-weekly basis so that they get time and they also get enough space to maneuver. Then at the village level, at panchayat level, we had panchayat nodal officer, which was primarily from different department, so as to keep the transparency in it. And then after the panchayat nodal officer is there, then we have the zonal education officer, ZDO, which is the block education officer in some of the states. ZDO was there. After the ZDO, then we have the district level monitoring committee. So these are the structures. And in the survey also, we did one thing that we randomly selected, like at the tehsil level, 20% of the random sampling was done by the tehsil team also. At the district level, 5% check was done by the district team also, so that we can make sure that the data that we are getting, on which we are building the whole program, it should be very clear. So 70,236, it is a very realistic and very exact data. After that, the monitoring mechanism, different levels were there, so that to ensure whether the volunteer who is assigned, he is going or not, whether the kid who is assigned, he is teaching or not. And there are many beautiful stories because kid love teaching their parents. So these are many beautiful stories. Thank you.
You must have noted that when we initiate a new practice, if the innovator is gone on transfer to some other location, it is very important for him or her to see that the spark that he had ignited remains lit, right? And therefore, I thought I would comment on this monitoring system, which will ensure, even if the principal initiator is gone from there, that it continues. And it gives you a lot of joy when you come back and reflect on it to see that what I started several years ago is still aligned, right? This is the experience all of you must have had. So thank you for telling us this and congratulations. Now, may I invite Shri Devraj Bhiman, who have initiated inquiry-based learning for holistic development in Pradesh.
Good afternoon, all of you, to present in here. I am very much thankful to Director Cips, Dr. Bali Malikam, and the staff members of Cips, panel moderator, Dr. Anjali Hajarika, who select me for this innovation award. Except me, all other awardees belong to administrative bureaucrats field, but myself only lucky to directly linked with the student learning education department of Himachal Pradesh as a principal in school cadre. Really, I am feel proud today among all great dignitaries present in this hall. Education is only one of the most powerful weapon which make a good citizen for the development of the nation and world. थोड़ा मैं हिंदी का भी बीच में प्रयोग करूंगा, तो काइंडली बताओ मी। तो मेरी जो फर्स्ट इनोवेशन है वो है पर्सनालिटी डेवलपमेंट ऑफ ईच एंड एवरी स्टूडेंट। तो पर्सनालिटी डेवलपमेंट के लिए जो मैंने काम किया, जो स्टार्ट मैंने की, थोड़े से रूरल बैकग्राउंड के थे, उनके जो पेरेंट्स वो थोड़े से लेबर क्लास के, तो ज़्यादातर बच्चों में कॉन्फिडेंस नहीं था। इवन जब टीचर ने कोई क्वेश्चन पूछना, वो शर्मा के थोड़ा बैठ जाते थे, वो आंसर नहीं दे पाते थे, उसका हेजिटेट करते थे थोड़ा सा। तो थोड़ा सा इसके ऊपर होमवर्क करना हमने शुरू किया और बच्चों को एक एक्टिव students are only, they are listener and teacher teach the subject, English, Hindi. जो मेन टाइटल है उसको लेके और उसके जो सब टाइटल है उसमें एक डिजाइन करके क्यों ना बच्चा आके आगे प्रेजेंट करे वंस इन ए वीक। एवरी सैटरडे हम उसको हाफ डे के तौर पर उसको करते हैं अरेंज, जिसमें बच्चा अपना टॉपिक को प्रेजेंट करता है। टीचर और अदर स्टूडेंट दे लिसन बट द स्टूडेंट प्रेजेंट देयर लेक्चर। वो बेस्ड होता है कभी साइंस के ऊपर, इंग्लिश और इसके ऊपर। तो धीरे धीरे बच्चों में वो कॉन्फिडेंस आता गया, स्टेज के ऊपर आते गए और वो अपना लेक्चर डिलीवर करते। वो 6th क्लास से मैंने स्टार्ट किया था और आज 12th क्लास के बच्चे लगभग 50 जो लेक्चर है वो डिलीवर कर चुके हैं ऑन द बेसिस ऑफ माइंड मैप। उसका जो मेन कंसेप्ट था टोनी मुजान के जो मैंने पढ़ा कि हमारे ब्रेन के 2 पार्ट होते हैं, एक लेफ्ट और एक राइट। और ये जो लेफ्ट पार्ट है और राइट पार्ट है इसका कनेक्शन आपस में नहीं हो पाता। बच्चे क्लासरूम में बैठे हैं लेकिन उनका जो दिमाग है वो कहीं बाहर घूम रहा होता है। वो किताबों में, हम किताब पढ़ा रहे हैं, बच्चे का सब्जेक्ट मैटर की बात कर रहे हैं, बच्चा कहीं आर्ट का काम कर रहा होता है, बीच में बैठा कुछ लिख रहा है, वो मेरी बात नहीं सुन रहा है। तो इसके ऊपर थोड़ा सा कनेक्टिविटी बढ़ाने के लिए थोड़ा सा काम स्टार्ट किया गया कि बच्चों को क्यों ना वो टेक्स्ट बुक दी जाए, उसको इंडिविजुअली वो रीड करे, उसके कंटेंट को वो समझे और उसके बाद उसमें से कुछ वो डिजाइन करे कि उसमें से जो उसका जो मेन टॉपिक है वो क्या है, उसमें से सब टाइटल क्या है उनको वो आइडेंटिफाई करे, जो हार्ड स्पॉट है उनको आइडेंटिफाई करे और उसके ऊपर टीचर उनके बीच में अवेलेबल रहेगा ताकि वो बच्चों में एक पैसिवनेस नहीं है क्लासरूम के अंदर, उनको एक्टिव उनकी पार्टिसिपेशन हो ड्यूरिंग दी टीचिंग लर्निंग प्रोसेस। तो उसके ऊपर धीरे धीरे बच्चों ने काफी वो अपने लेक्चर डिलीवर किए। उसका वीडियो के छोटा सा मेरे पास यहाँ मौजूद है, 1 minute and 41 seconds। उसके बाद जो दूसरी जो इनोवेशन थी वो दैट इज प्रैक्टिकल बेस्ड, लिंकेज ऑफ थ्योरी विद प्रैक्टिस। तो मोस्टली हमने देखा कि जो लैब्स हमारी बनी है वो 10th क्लास में बच्चे को जाकर मौका मिलता है लैब्स में जाने का और 12th में, उसके बाद कॉलेज लेवल पे। तो मैंने जो कंसेप्ट देखा कि हमारी एनसीईआरटी की किट साइंस के ऊपर बेस्ड है, तो वहां से मैं लेके गया और उसको 6th क्लास से स्टार्ट कर दिया और 15 प्रैक्टिकल में स्वयं उसके साइंस से रिलेटेड बच्चे के डिफरेंट टॉपिक उससे जो डायरेक्ट उनकी कंटेंट में है, उनकी बुक में है एनसीईआरटी में, तो 15 बच्चे उसको करके भी देखेंगे और जो लिंकेज है थ्योरी की वो प्रैक्टिस के साथ बच्चे की जुड़ के उसका अंडरस्टैंडिंग लेवल बढ़ेगा, ना कि वो उसको क्रैम करेगा। दूसरा जो था मैथमेटिक्स लैब, वो मैथमेटिक्स लैब मैंने भी वो 6th क्लास से और वो 10th वो स्टार्ट कर दी, उसके भी 15 प्रैक्टिकल, ताकि बच्चे वो मैथमेटिक्स से ज्यादा डर लगता है बच्चों को, हमें भी लगता था जब हम पढ़ते थे। तो बच्चे जो प्रैक्टिकल लैब में गए तो उनका कॉन्फिडेंस बिल्ड हो गया, नहीं मैथमेटिक्स तो कुछ नहीं है, इसका फार्मूला कैसे बना, उसको रूट तक वो बच्चा उस वजह से गया और धीरे धीरे कंसेप्शन था आज वो मैथमेटिक्स में बच्चे परफेक्ट बनते जा रहे हैं। वो अपना वो पढ़ाई बीच में कई बच्चे मैथ की वजह से छोड़ देते हैं क्योंकि उनको समझ नहीं आता, ऊपर से लेवल से वो निकलता है। तो लिंकेज ऑफ थ्योरी विद प्रैक्टिस ये स्टार्ट किया और काफी फ्रूटफुल इसके रिजल्ट रहे। नेक्स्ट जो इनोवेशन है वो है एक रोट मेथड से हट के थोड़ा बच्चे की अंडरस्टैंडिंग के ऊपर काम किया। मोस्टली क्या होता था कि बच्चे को कुछ क्वेश्चन के आंसर वो डायरेक्टली एमबीडी से उठा लेता है, जो गाइड है उनमें से, ये बड़ा ट्रेंड है गाइड का, रेडीमेड मटेरियल बच्चे को मिल रहा है और कंटेंट मैटर जो टेक्स्ट बुक है हमारी वो एक साइड में रह जाती है और वो डायरेक्ट क्वेश्चन और आंसर के लिए तैयार करता है बच्चा कि मैंने बोर्ड की परीक्षा पास करनी, बोर्ड में वो वहीं से क्वेश्चन आते हैं और वहीं से बच्चा वो उसको लिख पाता है। वो क्रैमिंग की तरफ बच्चे ज्यादा जा रहे थे, तो वहां पर थोड़ा सा काम किया, क्यों ना उससे हटके थोड़ा सी बच्चे की अंडरस्टैंडिंग के ऊपर काम किया जाए। तो एक ओपन टेक्स्ट बुक जो एग्जामिनेशन शुरू किया स्कूल में। ओपन टेक्स्ट बुक का मतलब क्या है कि हमने जैसे चैप्टर बच्चे को पढ़ा दिया, पूरा कंटेंट मैटर उसको पढ़ा दिया, बच्चे इंडिविजुअली ग्रुप में कंटेंट मैटर को इंडिविजुअली रीड करेंगे, उसके बाद उनको टीचर अपने क्वेश्चन फ्रेम करेगा, उसमें से वो एक्सरसाइज से नहीं उठाएगा, बीच में से क्वेश्चन फ्रेम करेगा और बच्चों को वो क्वेश्चन सर्कुलेट कर दिए जाएंगे और वो इंडिविजुअली उसको रीड करेंगे कंटेंट को 1-2 बार, उसके बाद उनके क्वेश्चन के आंसर बुक में से ही वो ढूंढेंगे और उनको लिखेंगे, उसकी डायग्राम को भी बनाएंगे, उसको लेबल भी करेंगे, उसके ऊपर उसकी इवेल्यूशन होगी। और इवेल्यूशन के बाद बच्चे की जो एक क्रैमिंग सिस्टम है वो अंडरस्टैंडिंग में नेचुरली बदलेगा। जब वो किसी कंटेंट को 2-3 बार पढ़ेगा वो अंडरस्टैंडिंग उसकी हो जाएगी, डायग्राम को बनाएगा, उसको लेबल करेगा, टाइम लगेगा, बच्चे की कंसंट्रेशन उसमें काफी बढ़ेगी। और वो बच्चे का जो लिंकेज है लेफ्ट पार्ट का और राइट का वो एक जुड़ता जाएगा। जो एक कंसेप्ट है हमारा कि लेफ्ट साइड में जो सब्जेक्ट मैटर हम एक कंसीव करते हैं, और दूसरा जो हमारा राइट है वो आर्ट म्यूजिक और उससे रिलेटेड होता है, जो पार्ट है हमारे ब्रेन का। तो इनकी जो कनेक्टिविटी है उसको लिंक करने के लिए थोड़ी थोड़ी एक्सरसाइजेस स्कूल में शुरू की, और बच्चों की कंसंट्रेशन क्लासरूम के अंदर जो एक पैसिवनेस थी क्लासरूम में वो एक्टिवनेस में वो बदलती गई। इसके बाद जो नेक्स्ट जो इनोवेशन थी जो स्कूल लेवल पे की गई वो है कोरिलेट दी सब्जेक्ट मैटर विद सराउंडिंग। ये एनसीएफ में और एनईपी के जो मेन जो प्रिंसिपल है उनका काम यही था, जो मैंने मेन पढ़े जो 5 प्रिंसिपल थे उसके ऊपर मैंने काम किया। उसमें क्या था कि हम थ्योरी तो बच्चे को पढ़ा रहे हैं क्लासरूम के अंदर, लेकिन जो कंटेंट मैटर है वो तो कहीं बाहर हमारे एनवायरनमेंट में मौजूद है जो हम उठा के वहाँ बुक्स में लाए। तो धीरे धीरे हमने कोशिश की कि जो बच्चा चैप्टर वाइज पढ़ रहा है, जैसे फॉर एग्जाम्पल एक पंचायती राज है, उसमें पंचायत में क्या क्या कार्य होते हैं और पंचायत में कौन कौन होता है, उसके इलेक्शन कैसे होते हैं। तो बच्चों को बाहर पंचायत में हम ले जाके फील्ड विजिट करवा के प्रधान के साथ वो बात करवा के, वहाँ वार्ड मेंबर भी होते हैं, उस दिन लोग भी आए होते हैं सारे, वो पंचायत का कोरम होता है, तो बच्चे को वहां बिठाया जाता है और वो पूरा अंडरस्टैंड करता है पूरा दिन उनको उसमें क्या क्या हो रहा है पंचायत में, कैसे कैसे लोग अपनी शिकायतें लेके आ रहे हैं, क्या क्या डेवलपमेंट पे कार्य हो रहे हैं, और वो बच्चा उसको अपना एक रिपोर्ट लिख के वो स्कूल में सबमिट करते हैं। तो ये कार्य जैसे जैसे हमने शुरू किया तो वो एक जो बच्चे का सब्जेक्ट मैटर था वो लिंकेज उसकी इन्वायरमेंट के साथ होनी शुरू हुई। कभी बैंक में बच्चे को ले जाएगा, वहां एक फॉर्म भरने को नहीं आता बच्चे को, लास्ट में वो दूसरे से भरवाता है, तो कैसे कैसे प्रणाली, कैसे वो लोन मिलते हैं, कैसे इंटरेस्ट लगता है, बच्चे के मैथमेटिक्स जो कंसेप्ट है वो भी क्लियर होते हैं। तीसरा ग्रोसरी शॉप पे ले जाना, कभी हर हफ्ते हमने एक प्लान की होती है कि वो हाफ टाइम के बाद बच्चे को एक फील्ड विजिट करवाई जाती है, ताकि ये जो लिंकेज है एक थ्योरी की वो एक सराउंडिंग एनवायरनमेंट के साथ उनके जो सब्जेक्ट कैसे वो लिंक होगा। तो जैसे ग्रोसरी शॉप पे ले गए, वो कितनी उसने दाल खरीदनी, कितने चावल खरीदने हैं, उसका रेट क्या है, अगर वो 5 किलो खरीदना, 5.5 किलो खरीदना तो मल्टीप्लाई करके कितना आएगा, उसको टोटल करना तो ऐड करके कितना आएगा, उसके ऊपर जीएसटी लगेगा, सीजीएसटी लगेगा, परसेंटेज निकलेगी। तो सारे जो बेसिक ऑपरेशन है मैथमेटिक्स के, दैट इज एडिशन, सब्ट्रैक्शन, मल्टीप्लिकेशन एंड डिवीजन, वो सारे बच्चे के क्लियर हो जाते हैं बेसिक कंसेप्ट। जब बच्चा वो फील्ड में निकलता है, बाहर देख रहा है कि मेरे को जो क्लास में पढ़ाया जा रहा है वो कहीं ना कहीं बाहर कहाँ मौजूद है। कभी बच्चे को एसडीएम ऑफिस में ले जाता, कभी तहसीलदार ऑफिस में लेके जाते हैं, कभी उसको उनको हर्बल गार्डन में, कभी एग्रीकल्चर डिपार्टमेंट में, ताकि बच्चे का एक टोटल जो उनकी बुक्स में है वो थोड़ा सा इन्वायरमेंट के साथ कैसे कोरिलेट हो रहा है। जैसे क्रॉप्स की बात आती है, खरीफ क्रॉप्स, रबी, तो बच्चों को फील्ड विजिट में ले जाके वहां देखो अपने इन्वायरमेंट के अनुसार हमारे हिमाचल प्रदेश में क्या क्या आपके सराउंडिंग में हो रहा है इस सीजन में, और खरीफ का सीजन कब से कब होता है, रबी का सीजन कब से कब होता है, उसके बाद थर्ड क्रॉप्स आ रहा है, जेड क्रॉप्स वो क्या होती हैं, वो बच्चे को नॉलेज नहीं होता क्योंकि किताब में उसका है ही नहीं कंसेप्ट। तो बच्चे को ये सारी चीजें वो जब फील्ड में ले जाते हैं वो अपनी लोकल भाषा में देखता है कि हमारे नजदीक है, तो उसके वो कोरिलेट करके अपने जो अंडरस्टैंडिंग है उनकी वो क्रैमिंग की बजाय कहीं ना कहीं अंडरस्टैंडिंग बच्चे की डेवलप होती है। नेक्स्ट जो मेरा इनोवेशन थी वो थी रेमेडियल टीचिंग। मोस्टली क्या देखा कि बच्चे एक स्लो लर्नर हर क्लास में होते हैं, मीडियोकर होते हैं और एक्स्ट्राऑर्डिनरी भी होते हैं, 3 टाइप के बच्चे होते हैं जब हम क्लास में जाते हैं। तो ज्यादातर जो स्लो लर्नर है उनके ऊपर ज्यादा फोकस नहीं किया जाता। टीचर क्या करता है कि मैंने इनको सब्जेक्ट जो कंटेंट जो मैटर है वो मैंने उनको डिलीवर करना है, उनका काम ये होता है। एक्चुअली बच्चे को उस कंटेंट और उससे सिलेबस से कोई लेना देना नहीं है। जिस बच्चे को अभी एडिशन नहीं आ रही है, जिसको सब्ट्रैक्शन नहीं आ रही है, बच्चा वो 9th में पहुंच गया है, वो कहीं 7th में पहुंच गया, कहीं वो 10th में पहुंच गया। अभी ऐसे बच्चे मेरे पास मौजूद हैं जो 9th में है, जिनको अभी रीडिंग अच्छे तरीके से नहीं आती, वो बुक को नहीं रीड कर सकते, उनको कंटेंट मैटर से कुछ लेना ही नहीं, उनको कैसे मर्जी क्वेश्चन दे दो वो कर ही नहीं पाएंगे। तो उनके ऊपर मैंने पहले आइडेंटिफाई किया, उनको उनको ऊपर टूल मैंने डिजाइन किए। उन बच्चों को किन को रीडिंग हिंदी में नहीं आती है, किन को इंग्लिश में नहीं आती है, किन को मैथमेटिक्स की जो बेसिक कंसेप्ट है वो नहीं आते हैं, उसके ऊपर आइडेंटिफाई करके उनकी एक रेमेडियल क्लासेज लग डेली, उनको मेन स्ट्रीमिंग करने से पहले, क्लास में भेजने से पहले वो एक जो कंसेप्ट थे हमने डिजाइन किए टूल, उसके ऊपर काम करना शुरू किया। आज भी मेरे पास 6 बच्चे ऐसे हैं जो मेरे पास डेली बैठते हैं, अभी उनको मैं मेन स्ट्रीमिंग नहीं कर पाया हूँ, पर जल्दी ही विद इन 10 और 15 डेज वो भी मेन स्ट्रीम हो जाएंगे, क्योंकि काफी हद तक वो बच्चे पूरा दिन मेरे पास बैठते हैं, वहाँ वो उसके ऊपर काम करते हैं। और सबसे बड़ी बात है कि उन बच्चों में जो सिटिंग पावर है वो बहुत ज्यादा है, बैठे रहते जैसे मैंने बोला मेरे पास बैठे, क्योंकि उनके सीखने का कहीं वो उनको कहीं वो रोक ये किया नहीं गया, आगे आगे बढ़ते गए वो सिलेबस के अनुसार, वो बच्चे पिछड़ते गए और आगे आगे उनके ऊपर एक पहाड़ जैसा वो सिलेबस बन गया। लेकिन जो बेसिक कंसेप्ट बच्चों को अगर कहीं वो बीच में उनको बेसिक कंसेप्ट के ऊपर काम किया होता तो वो पहले बच्चे चेक होकर अपनी बुक्स के साथ वो जुड़ गए। तो ऐसे रिमोडल टीचिंग के ऊपर मैंने जो इनोवेशन की वो मेरी 5th उसके ऊपर मैंने काम किया। उसके बाद 1-2 और हैं, जैसे बर्मी कंपोजिट यूनिट मैंने स्कूल में लगाई, जिसमें बच्चे को 3R जो सिस्टम है, रिड्यूस, रीयूज और रिसाइकल, वो वहीं से कि कागज और जो लोहा वगैरह स्कूल में कहीं पड़ा, बोतल पड़ी है, वो भी इसमें डालनी है। अगर आपका मिड डे मील का खाना बन रहा है तो आपने इसमें डालना है, तो वहाँ बर्मी कंपोजिट जो आपकी जो खाद है केंचुआ, वो वहीं तैयार हो जाएगी। बच्चे वो भी कंसेप्ट को समझ रहे हैं, क्लीनिंगनेस वो स्कूल में डेवलप किया। उसके बाद एक्टिविटी कॉर्नर हर क्लासरूम के अंदर, ताकि टीचर को कहीं बाहर से वो ऑपरेटर्स लाने नहीं पड़े कि मैंने प्रैक्टिकल करवाना तो कहीं लैब से लाने पड़े, वो अंदर ही एक्टिविटी कॉर्नर बने, वहीं से उस लॉक को खोला जाएगा। जो टॉपिक पढ़ाना है, चार्ट, पेंसिल, जो भी स्केच पेन है, सारे मौजूद बीच में, ज्योमेट्री बॉक्स वगैरह, तो वहीं से निकाल के बच्चे भी यूज करते हैं और टीचर भी वो अपना जो कंसेप्ट है वो एक थ्योरी की लिंकेज जो प्रैक्टिकल के साथ, वो वहीं पर सारा मटेरियल वहाँ मौजूद। तो ऐसे करके वो वहीं पर अपने एक्टिविटी कॉर्नर को यूज करते हैं उसमें। उसके बाद हर्बल गार्डन, ये मैंने थर्ड स्कूल में वो इम्प्लीमेंट किया। वो हमारा मेन मकसद था हर्बल गार्डन का कि बच्चे को आयुर्वेदिक जो एक औषधि है उनका ज्ञान हो जाए कि कौन सी औषधि हमारे हर्बल गार्डन में है और उसका हमारी इसके लिए कौन सी बीमारी के लिए कौन सा हम मेडिसिन यूज कर सकते हैं। तो 40 जो टाइप्स के प्लांट हमने लगाए। एक कनाल जो भूमि बंजर पड़ी थी मेरे पहले स्कूल में, तो उसको हमने पूरा उखाड़ के वो उसको झाड़ियाँ जुड़ियाँ उखाड़ के, क्योंकि लोग जाते थे नहीं कि सांप है वहां पर, तो जैसे मैं स्कूल में गया वो सबसे पहले कि वो सांप को निकाल देते हैं, वहां से रास्ता निकाला, वो टॉयलेट वहां पर बनाया एक कोने पे, और वो सारे का सारा एक हर्बल गार्डन आज वहां से तेज पत्ता अलग क्विंटलों के हिसाब से निकल रहा है और उसको सेल भी कर रहे हैं। वो काली मिर्च वगैरह सारे बच्चे को क्या किया गया है। तो ये थोड़ा सा बच्चे अंडरस्टैंड करें किसी चीज को, क्राइम जो सिस्टम है उसको, इसके ऊपर थोड़ी सी इनोवेशन की थी 5, और काफी सक्सेस हुए हैं बच्चों के अंडरस्टैंडिंग लेवल में। सबसे मेन बात है कि बच्चों में कॉन्फिडेंस आ गया कि मैंने लेक्चर डिलीवर करना है। 6ठी के बच्चे डिलीवर करते हैं, 7वीं के करते हैं, और कोई भी टॉपिक दे सकते हैं उनको। वहां वो डिजाइन करना पड़ेगा, ग्रुप में बच्चे बैठेंगे, अपना चार्ट बनाएंगे, चार्ट के ऊपर से वो डिस्प्ले करेंगे सारा वो अपना, तो वो टीचर की जगह अपना रोल वो अदा कर लें। तो
सर, मैं आपसे कहना चाह रही थी कि एक्चुअली दिस इज द एक्सलेंट रोल मॉडल of teaching learning by doing. Children are learning, and by doing they are understanding it better, and that they're not going to forget ever. So one thing is that, and you touched a very important point, that most of our educational systems up to graduate and postgraduate levels also are becoming very left brain centered. You know, we develop certain capacity for analytical thinking, mathematical thinking, and all of that. But in the process, we seem to forget that we are also gifted with the right brain, which is responsible for understanding art, music. It is also responsible for creativity, and somewhere we lose touch with it. So the fact that you're giving importance to this at such a young age is going to go a long way in their life. So I think congratulations for that. And very briefly, because we still have two esteemed panelists to share, मैं आपसे ये पूछना चाह रही थी कि ये होलिस्टिक डेवलपमेंट की आइडिया या इंस्पिरेशन आपको कहाँ से आई? Because this requires a huge deal of commitment. This requires a great deal of enthusiasm. And sometimes you could also experience resistance by the teachers, because they have to be also trained in a certain way, right? They're not doing the business as usual kind of training. So this requires a great deal of commitment on the initiator, which is you. So can you very briefly tell us Where did the inspiration come from? And how did you go about it? But not the entire thing, just very briefly.
मैम सबसे पहले 2006 में मैं एक फिजिक्स जो सब्जेक्ट है उसका लेक्चर अपने स्कूल कैडर में था हिमाचल प्रदेश में। तो लगभग 14-15 वर्ष मैंने फिजिक्स के ऊपर काम किया। उसके बाद मेरे को मौका मिला सर्व शिक्षा अभियान में आने का। तो उस वक्त हमारे जो SPD होते थे, स्टेट प्रोजेक्ट डायरेक्टर, आजकल वो एजुकेशन के सेक्रेटरी हैं हिमाचल प्रदेश के, डॉक्टर राकेश कंवर जी। तो उनके साथ थोड़ा सा मौका मिला काम करने का। तो उनकी अध्यक्षता में हमें एक बार तमिलनाडु में भेजा गया विजिट पे, एक्सपोजर। तो वहाँ पर ALM के ऊपर काम हो रहा था। तो काफ़ी उस वक्त उसकी सराहना भी हुई थी, एक्टिव लर्निंग मेथोडोलॉजी के ऊपर। उस कंसेप्ट को मैंने थोड़ा सा समझा और एक मैं ही सिंगल पर्सन था जिन जिन उसके ऊपर काम करना शुरू किया। तो वहाँ से मेरे को एक कंसेप्ट आया कि बच्चे को उसको मॉडिफाई करके वो एक कंसेप्ट कुछ दिमाग में आया कि जो ग्रेट फिलोसफर हमारे हुए हैं एरिस्टोटल, अरस्तु, क्योंकि उनके फॉलोअर बने टोनी बुजान जी। तो उनकी बुक मेरे को पढ़ने का मौका मिला। और टोनी बुजान तो पेशे से एक हेड बुक हेड थे, लेकिन वो सारे सब्जेक्ट के ज्ञाता थे, चाहे केमिस्ट्री हो, फिजिक्स हो, सोशल साइंस हो, इंग्लिश हो, जो भी। तो उनकी जब मैंने हिस्ट्री पढ़ी तो मैंने सोचा मैं फिजिक्स ही क्यों करूं, मैं तो इंग्लिश भी कर सकता हूँ, मैं सोशल साइंस भी पढ़ा सकता हूँ, मैं सारे। तो आज मैं कॉन्फिडेंस के साथ यहाँ इस स्टेज से ये बोलना चाहूँ कि आज मेरे को कोई भी कंसेप्ट दे दो बच्चे का, मैं उसका लेक्चर बच्चों से ही डिलीवर करवा सकता हूँ। चाहे इंग्लिश हो, इंग्लिश चाहे मेरे को आती है नहीं आती है, लेकिन बच्चे मेरे बेटर वो डिलीवर करेंगे उस टॉपिक को। सोशल साइंस के ऊपर हो, चाहे वो कोई भी सब्जेक्ट हो। ये माइंड मैप ऐसी टेक्निक है कि जिसके ऊपर बच्चा वो जो अपना चैप्टर लेके उसमें से वो ब्रीफिंग करके वो डिजाइन करके टाइटल, सब टाइटल, उसके बाद उसकी जो रिलेटेड इन्फॉर्मेशन है वो सारे का सारा बच्चा क्रैमिंग की बजाय अंडरस्टैंड करके एक चार्ट के ऊपर पूरा चैप्टर डिस्प्ले करके बच्चा उसको लेक्चर डिलीवर कर सकता है। तो मैंने वो छठी से स्टार्ट किया, आज वो धीरे धीरे मैं ऊपर से नहीं आया, वो नीचे से मैं बढ़ता गया कि छठी का बच्चा मेरा कर सकता है तो 7th का क्यों नहीं कर सकता, 8th का क्यों नहीं कर सकता। अगर मैं +2 से स्टार्ट करता तो नीचे आना मुश्किल होता, लेकिन बॉटम से स्टार्ट किया कि जब छठी के कर रहे हैं 7th वालों को मोटिवेशन मेरी, मैं बड़ा हूँ इनसे, मैं क्यों नहीं कर सकता हूँ। तो मोटिवेशन से आज वो बच्चे काफी आगे बढ़ रहे हैं। और प्रैक्टिकल का कंसेप्ट तो मेरा शुरू से ही रहा है कि कोई भी सब्जेक्ट है वो थ्योरेटिकली नहीं होना चाहिए, प्रैक्टिकल का नॉलेज होना चाहिए, क्योंकि हर बुक में एक थ्योरी लिखी होती है और एक डायग्राम बनी होती है। तो टीचर जो वो थ्योरेटिकल पार्ट के ऊपर ज्यादा फोकस करता है, वो डायग्राम को छोड़ता जाता है हमेशा। तो डायग्राम मीन वो रिलेटेड टू प्रैक्टिकल, और बच्चे ने वो डिजाइन बनाना होता है, एक आर्ट बनानी होती है, उसको वो लेबल करना होता है। बायोलॉजी में तो टोटली वही कंसेप्ट है। तो उसके ऊपर धीरे धीरे जो उनकी मैंने टोनी बुजान जी के द्वारा जो लेफ्ट और राइट पार्ट के ऊपर, तो प्रैक्टिकल का जो कंसेप्ट है वो मेरे को वहीं से बढ़ता गया कि क्यों ना एक नेगेटिव और पॉजिटिव को जोड़ा जाए तो बल्ब जलता है। तो बच्चे का ब्रेन क्यों नहीं जल सकता है, वो जल सकता है। वो बच्चे का फ्यूज क्यों है, बच्चे स्लो लर्नर कैसे हैं, वो क्यों नहीं एक्टिव हो सकते हैं। तो वो पार्ट को जोड़ना शुरू किया डिफरेंट इनोवेशन के द्वारा कि लेफ्ट पार्ट ऑफ द ब्रेन टू कनेक्ट विद द राइट पार्ट ऑफ द ब्रेन, जो कि एक पार्ट हमारा सब्जेक्ट से रिलेटेड है, दूसरा जो आर्ट, म्यूजिक और इन चीजों से जुड़ा है। बच्चे को क्लास में पढ़ा रहे हैं म्यूजिक, वो बाहर का डीजे सुन रहा है, तो क्लास का वो कंटेंट मैटर बच्चे के लिए वो मेरा था माइंड। तो क्यों ना बच्चे को विद इन क्लासरूम ही उस एक्टिविटी में लगा दिया जाए, बाहर कुछ डोल बजते रहे, चाहे वो डांस होता रहे, बच्चा अपने में मगन हो जाए, उनको ऐसी टास्क में डाला जाए। तो इस कंसेप्ट के ऊपर काम किया गया। तो थैंक यू वेरी मच।
To talk about early childhood care and education as per new education policy. Good afternoon, everyone. First of all, I want to thank as well as congratulate CIPS for choosing education as an area for awarding innovation awards. Because education normally is not that much preferred. It is a humble area, although most important. जितने panel discussions आज होंगी, जितने भी areas पे होंगी, basically all come from education. So it is the most important. And secondly, education comes mostly start कहाँ से होती है, from our pre-primary classes, means preschool classes. So if the base is strong, then the upper building is automatically strong.
And our NEP 2020 also emphasizes on it that pre-primary education, preschool education should be taken as very seriously, sincerely, and we should do work on it. Before I start talking something about our projects, which have been, we applied for 2 projects and we got awarded for 1. Both were for, one is for pre-primary, other was for primary. We have been awarded for the pre-primary, early school, early child care and education. It is also implementation of NEP. And before starting this, I just want to congratulate and share my views with principal sir as well. He said that all others are from the administrative side and he is only from the school, sir. I am also from the school side. In UT Chandigarh, there is a promotion concept. I was first of all lecturer in physics, and then I was principal for 7 years, and then I was DO, and then now I am deputy director. So I have seen. First, I just want to say one line for him. हम जितने भी पॉलिसीज बनाए, गवर्नमेंट कितनी भी पॉलिसीज बनाए, हम कोई भी प्रोजेक्ट बनाए, जब तक स्कूल का प्रिंसिपल मोटिवेटेड नहीं है एंड वो इम्प्लीमेंट नहीं करता है स्कूल में, तो इट विल गो वेस्ट. सो एजुकेशन में जो सबसे इम्पोर्टेंट पार्ट है, चेन है, जहाँ लिंकेज है, दैट इज द प्रिंसिपल ऑफ द स्कूल टू इम्प्लीमेंट द थिंग्स. That I think, and I have experience personally also. I will be telling briefly about our project. In early childhood care and education project, we had done two things. First is the re-engineering of the classrooms for pre-primary classes. As per NEP, you all know now there are 3 years for pre-primary: pre-primary 1, pre-primary 2, and pre-primary 3, which is also known as Bal Batika. Chandigarh has implemented this in all the schools. It is a small UT. We have only 112 government schools and around 150 private schools. So as per infrastructure, touchwood, we have not much problems. लेकिन जब अच्छा होता है तो फिर expectations भी ज़्यादा होती हैं. So that is why when it is good, we want to make it more better. So the thinking was, बहुत सारे बच्चे जो हैं, we all know it is all over India, I think. They go to private schools. Their parents send them to private schools for pre-primary classes. जैसे जैसे बच्चा बड़ी क्लास में होता है, they try to shift it to government schools. Secondly, the pre-primary in government schools, in many schools, it was not that much taken seriously. And as we all know that most of the development of the brain of the child is up to the years of 5 or 6. All cognitive skills and all communicative skills, they develop in this age. So taking this into account, it was thought that we should change the classroom setting of the child so that the way he learns, it should be play-based, it should be activity-based, and it should be inquiry-based. And to implement that, it was with the help of an NGO. It was done in one school as a model. In one school, we made which we called as ECCE lab. The classroom was like this. It has 3 areas. One was the entering area, one was the classroom area, and one was the outside area. So in the first, I explained classroom area. In the inside the classroom, it was not like a normal classroom setup. Means there is no setting of benches and students sitting on it and the teacher teaching and students listening. There are corners in the classroom, activity corners. Like one corner is story corner. There we develop like we make paintings of some tree and put some things which gives some idea of a storytelling of a story. We have a hygiene area where the students are told about the hygiene, personal hygiene, other things. And then music area where we place toys relating to music instruments and various things related to this. So all the corners of the classroom, they were of this type. And also the setting was, it was maybe on the mattress, maybe on some like small mudas and maybe some chairs of different colors. And so different type of settings. So the child doesn't have the feeling of कि class में जाके उसको सीधे बैठना है and बोलना नहीं है and जो teacher कहेगा उसको सिर्फ सुनना है. So he can play, he can listen the stories, he can tell the stories, and he can do all the activities. This is inside the classroom. जो entrance area है, many students, many children rather, I would say small children, in pre-primary, they are from the age 3 to 6 years. Many children, they come home whose parents are laborers. कई बार ऐसे होता है कि घर में there is not a good atmosphere, they are not in a good mood, and also वो home environment से school environment में shift हो रहे हैं. So entrance area पे it was a area which will be switching over the child from the home environment or from some other thinking से आ रहा है to the school environment. Like there are big drums like tunnels. बच्चा आएगा तो उसके अंदर से होके जाएगा, या there is some hanging strings जिसके ऊपर बच्चा झूलता हो जाएगा, so that he comes in a play mood before entering the class. And third area is the outside area in some garden or some lawn nearby the classroom. And वहाँ पे some reading area, and there are some like hanging like jhulas and some sitting area for reading. So that is the outside play area, ताकि जब मौसम ठीक हो तो बच्चा बाहर जाके भी खेल सके and वहाँ बैठ के चाहे वो पढ़ सके चाहे वो खेल ले. So that is what was about the engineering of the classroom. So this was one of the one such classroom we set up as a model lab. And then all the pre-primary teachers from all the schools, they were called there, they were shown the classroom, and then they were explained the concept. Similarly, all CRCs under Samagra Shiksha, all URCs under Samagra Shiksha, and everyone related to all principals and heads, all were called there and given a like type of the physical training. They were shown the things, and so that they can implement it in their schools. One thing I must mention in this setup, it was always cost effective. Means teachers, they tried to use things from the waste. Because normally ऐसे होता है कि अगर हम महंगी चीजें खरीद लेते हैं expensive, and फिर हमें उनको बचाने की लगी रहती है कि कहीं टूट ना जाए, कहीं खो ना जाए, गुम ना जाए. And अगर हमने waste से बनाया है तो फिर वो वाली tension नहीं रहती. So most of the things from the waste, like waste cardboards and waste wood material, things were made from that. All the toys, they are from made from cardboard. All things, means 99% it is from waste. Only one thing, that the walls of the classroom, they are also colored painting, and that has to be done. And uske liye, this model we took up to the PAB of Samagra Shiksha as an innovation, and then we got the grant for all the schools. And now it has been implemented in all the schools of UT Chandigarh. And pre-primary 1, pre-primary 2, and Balvatika, each school is having 3 such rooms. For each class, it is separate. It is not that we make only one room and we take the students there. And it's because it was implemented 21-22. So we have seen there is a rise in the enrollment of students. Their parents, they are coming to, they are taking their students to the government schools. That is one impact we are seeing. Although, you know, education is such a thing which shows impact after a long time. It is not immediate effect. आज हमने कुछ किया and कल कुछ हो जाएगा. It is always a long-term impact. So that is why it will show its impact, and it is showing its impact. Second thing was our part in this project is twinning of the Anganwadis with the schools. This is also mentioned in NEP that we must relocate our Anganwadis into the schools. But it is not possible because of the space in the schools. We cannot bring all the Anganwadi centers to the schools for the education purpose. So there was a idea of mapping the Anganwadis. We have around 400 Anganwadis in Chandigarh. It is in the periphery areas, not in the central sectors. And so all the Anganwadis, they were mapped to the nearest schools. Mapping means that teachers from the school, they will be visiting the Anganwadis frequently, once or twice in a week. And students from the Anganwadis, this is restricted to only the group age 3 to 6 years, means same as pre-primary age. So the students from the Anganwadis, they are brought to the schools to visit the classrooms we have prepared in the rooms. And also all Anganwadi workers, because Anganwadi mein, they take care of many things like health, and they take care of the mothers as well. So only the education part, regarding the education part, all Anganwadi workers, they are trained by the department, by SCRT and by the education department under Samagra Shiksha as well, so that they know जो बच्चे स्कूल में पढ़ रहे हैं, the idea was कि जो बच्चे स्कूल में पढ़ रहे हैं 3 to 6 years, and जो बच्चे आंगनवाड़ी में हैं 3 to 6 years, once 6 साल का होने के बाद जो आंगनवाड़ी का बच्चा है वो भी स्कूल में आएगा. But if the curriculum syllabus आप कह सकते हैं, whatever is taught to them, या whatever they have learned, if it is not same, then there will be a gap. जो स्कूल के बच्चे होंगे, they will be at a different level, and जो आंगनवाड़ी से आएंगे, they will be at a different level. So our idea was कि जब आंगनवाड़ी के बच्चे 6 years के होने के बाद when they shift to the school for class 1, they should be at par with the schools, with the children who are in the schools. So what this, the Anganwadi workers, they were trained, they were given the curriculum, they were given the worksheets so that they bring the child to the same level. And in this pure process mein, what I think is 2 things are important. One thing is the mindset of the parents. आप सभी जानते हैं हमारे ज्यादा पेरेंट्स स्पेशली जो रूरल एरिया से या रिमोट एरिया से बिलोंग करते हैं, स्पेशली छोटे बच्चों के पेरेंट्स जो लिटरेट तो होते हैं बट दे आर नॉट दैट लिटरेट, वो क्या करते हैं, वो बच्चे की कॉपी देखते हैं घर जाके कि टीचर ने आज उसकी कॉपी में कुछ लिखवाया या नहीं लिखवाया, एंड जो नहीं लिखवाया तो इट मीन्स टीचर ने कुछ नहीं पढ़ाया. तो जो प्ले वे मेथड था, इट इज वेरी, दैट वाज वन ऑफ द चैलेंज, पेरेंट्स को कन्विंस करना कि अगर हम बच्चे को एक्टिविटी करा रहे हैं, सिर्फ उसको ड्राइंग ही करवा रहे हैं या उसको खिला रहे हैं, तो इवन देन ही इज लर्निंग. सो दैट चेंज इन माइंडसेट इज इम्पॉर्टेंट. अदरवाइज हम ये क्लासरूम बनाते हैं लेकिन फिर भी पेरेंट्स प्रिंसिपल्स के पास आ जाते हैं कि जी टीचर तो बच्चे को कुछ करा ही नहीं रहा, कॉपी में तो कुछ लिखा ही नहीं, कॉपी तो खाली पड़ी है. तो दैट वाज वन थिंग. एंड सेकेंडली, ट्रेनिंग ऑफ टीचर्स. जो टीचर्स अभी प्री प्राइमरी को पढ़ा रहे हैं, जिनको अभी नए सिस्टम में बच्चों को पढ़ाना है, या जैसे हम लोग भी हैं, हम लोग उस सिस्टम से पढ़े नहीं हैं, हम पुराने सिस्टम से पढ़े हैं. तो जब हम नए सिस्टम में पढ़ाएंगे तो उसके लिए फर्स्ट वी नीड अ ट्रेनिंग, ओनली देन वी कैन टीच इन द न्यू सिस्टम बाय द न्यू मेथड. सो द ट्रेनिंग इज वेरी वेरी इंपॉर्टेंट, एंड सो वी लाइक इंश्योर कि जो टीचर्स हैं दे ऑलवेज गेट द ट्रेनिंग दैट हाउ टू टीच. they will have to relearn. First they, जो उसने पहले सीखा है, unlearn, and then they will have to relearn कि अब वो नए सिस्टम में, एक्टिविटी बेस्ड में, and play based में, and inquiry based में, how they will teach. So I hope this will be affecting all our students who are in the very very young age, and they will become good learners, good communicators, according to the development goals of our Nippon Bharat Mission as well. And as our education secretary ma'am, although she is not today here, we are having a physical PAB at Delhi today. So she has the target of making Chandigarh all students Nippon ready by 2026. So we are going towards that. Thank you so much.
आइए, इनके numbers are very impressive. The beneficiaries are 32,460. It's mind-boggling. So many pre-primary teachers, Anganwadi teachers are all, all gathered together. And this gap that you talked about, which would create a cultural sort of a conflict when Anganwadi students come to school, is invisible, but it's very important. You know, so the seamless transition from Anganwadi to school can happen. Thank you very much for this work. We are very proud. So it's my pleasure to invite Varnali Deka, who has also done great deal of work under the aegis of Poshan Club, where they are nurturing children as change agents who can go back to the community and help in community developments. So let's hear it from her own words. Welcome.
Thank you so much, ma'am. A very good afternoon to all. And before I begin, I would like to thank Cips for this opportunity, Bakchi sir and Yashashwini and the entire team. And while I was sitting in this session, generally we, our conversation is from a practitioner's point of view or from an administrator's point of view. So to listen to two educators who have gone into so much of details in the education sector, it has actually been eye-opening, even though a short lecture, but very eye-opening for me personally. I am Varnali Deka. I am an IS officer of the 2009 batch. Currently, I am the District Commissioner of Nalbari District of Assam. And fortunately or unfortunately, I have always been, serving in some of the most backward districts of the state. Northeast or Assam is even otherwise supposed to be backward. And for me, somehow in the last 10 to 12 years, I have always been in most of the backward parts of the state, and two of them have been aspirational districts. So the initiatives that I would talk about very briefly, since I don't think we have too much time, these belong to the two districts that I was posted in the last 5 years. I was DC Gwalpara in 2018 to 2021, and then DC Kokrajhar from 21 to 23. Uh, to start off with the Gwalpara initiative, in fact, the Poshan Clubs initiative is started in the district Gwalpara of Assam. Gwalpara is one of the 112 aspirational districts of the country. District lags in most of the human development indicators. It has formidable issues of access and reach due to the difficult terrain and topography. We have undulated landscape, we have forest areas, we have the braided Brahmaputra creating various kinds of riverine source. So formidable issues of access and reach, also a very heterogeneous population mix. We have minorities, we have tribal groups, we have, groups of various ethnicities, varied in terms of ethnicity, religion, language, culture, way of life, which makes a one-size-fits-all approach impossible for a district like Gwalpara. At the same time, district is disaster prone, insurgency prone, so, a number of issues in the district and a very volatile population mix. So when I first joined the district in 2018, I realized that at that time ADP had just started, and those of us who are aware of the ADP framework, you would know that aspirational district program has about 49 KPIs and 81 data points, which Niti Aayog very religiously, very meticulously, they keep monitoring and they always sit on our heads. So when I first joined the district, every week, I would get a call from Niti Aayog that, your indicator, this indicator is not, there is no progress in the indicator. So then I thought, ki aise to nahi chalega. I have to sit and do something about it. So I started reviewing all the various KPIs individually. And what I realized is that when I reviewed the education sector, I saw that in most of these groups, in most of these government schools, we have 1,698 government schools in the district, in Gwalpara at that point in time. There are no, most of these children don't have role models. What madam was just talking about, कि घर गए, घर में father या mother ने देखा कि कितने पन्ने लिखवाए हैं, how many pages have they written. So lack of role model at home, lack of quality educators in the school, and also at the community level, there was an apathy towards various community targets. So what we thought is that why do we not bring these children as role model, children as key leaders of behavioral change, attitudinal change? Why do we not develop our children as the role model? Because when the child talks, previous speakers have also spoken about this, when the child talks, the entire family listens. So with this goal in mind, what we thought is that let us launch Poshan clubs in all of the schools. And in the Northeast, we do have a club culture. So why do we not harness this club culture into something very positive? So we launched Poshan clubs in all the 1,698 schools of Gwalpara. And within a few months, the results were phenomenal. We had about 15,000 plus members in just 2 to 3 months. And in terms of the various KPIs of Niti Aayog, we saw a marked change because these children started doing Vidyaharam programs. So whenever a child drops out of school, the Poshan Club members would go visit the child and convince the child and the parents to bring him back to school. So in that year, our transition rate, which was maybe in the 70s or the 80s, reached 100%, both from lower primary to upper primary and upper primary to secondary. At the same time, these children started, we educated these children on good eating habits, and these children started becoming brand ambassadors for Swachhata, brand ambassadors for nutrition. So we also started seeing a reduction in the malnutrition cases. Also, as I think Dhimanji was talking about, lack of role models. So another point was the cumulative build-up of, that is what Dhimanji was talking about, कि बच्चे जैसे जैसे next year में जाते हैं, whatever are the gaps in understanding, that continues, that aggravates, and this ultimately leads to dropout. Because the child in 3rd standard, he would have certain gaps, 4th standard it increases, and so on. Now, in these tribal communities, there was a lack of quality educators, and there was also a lack of receptivity to outsiders. So we thought, why do we not make the community take ownership of the reading habits of the child? So generally in the minority communities, in the tribal communities in Assam, in Gwalpara, standard children, and we started the community learning program or the accelerated learning program with support from UNICEF, and they took up ownership of the younger children's learning. And we saw that while the child from a teacher of another community, he may not be that receptive, but within their own community, for hire a student of 11 12 standard or a college going child, this younger children would pick up from them. So this was the other initiative that these portion clubs did. Yet another initiative was hanging libraries. We did not have infrastructure for cupboards in all the schools, so we just set up strings, ropes like that, and we would hang up the books on the ropes to build up the reading habits of the child. Some other initiatives that are in conjunction with the Portion initiative, I would like to talk about very briefly. So the literacy rate for Gwalpara, the female literacy rate is only 63%, which, in this day and age is actually a disgrace. We did not have very many resources. So what we did is that we asked the headmasters of the schools to take ownership of this process, and they readily agreed. I think a lot of my friends here are from the Northeast. I myself belong to Assam. So generally in the Northeast, what we often see is that when you can convince the community that this is an initiative that is worth taking into, the kind of public support is massive, it is enormous. So we requested the headmasters, we don't have any money, we cannot give you anything, but can you help us in this? So the headmasters did a survey of all. We have 8 blocks in Gwalpara. We could not take up all the blocks. We took up 1 block. We took up the Rongjuli block, which is entirely a tribal block of Rava population. And they did a survey of all the 23,000 households of the block for identification of illiterate women. And they could identify 6892 numbers of illiterate women. Now, we followed, since Sakshar Bharat Abhiyan, which some of us may have seen on TV when we were kids, since then there has not really been too much of work being done on adult women literacy. But we took up the Sakshar Bharat guidelines. We again selected youth of that community, and we gave them a very nominal, remuneration, hardly 2,000-3,000 per month. We gave them a detailed orientation for a week. And these youth trained these women for about 3 to 4 months. They gave them training. They would sit with these women. And even after the initiative, they still go home and they do that house-to-house teaching. So in groups of 10, these women were taught. And on International Literacy Day, we had a test for literacy under the Sakshar Bharat guidelines. And all of these 6892 women, this was Mission Vidya Shakti. We had named this initiative Mission Vidya Shakti. All of these 6892 women were made literate. Just another 2 more initiatives I'll talk about. One is, STEM learning, all of us must be knowing. So STEM learning in a district like Gwalpara, because Gwalpara, 20% of the population lives in riverine source. So STEM learning you cannot even think about. But what we did is that we went to Donair Ministry and we requested them. So with funds from Donair, we started setting up smart classrooms. We also did solarization of the schools. And through these smart classrooms, we could create, so much of interest. So these STEM classes, these smart classes that we call, the content was so good. The children really enjoyed this so much that within a very short period, if we had taken up STEM in a particular school, the enrollment in the next 2-3 years, we found doubled. And the entire cluster, first that STEM class, that smart class was supposed to be for only one class or one school, but the entire cluster started coming. So one single smart class was, in a time-shared manner covering 5,000 children. And the last initiative I would talk about is Model Anganwadi. Today, we have Model Anganwadis in various parts of the state or the country. But in 2018-19, the Anganwadis were in a very bad state. I don't have a PPT here, but I could show you some of the photos. If you look at the Anganwadi, it is all broken, and the mothers would come, in their 90s just to feed the child and take the child back. So there again, through community sourcing, through crowdfunding, a little bit of CSR support, we could ramp up the Anganwadi and, just some basic touches here and there, a model kitchen, a nutri kitchen, some kind of Bala learning activities and so on. And there again, the results were phenomenal. The first Anganwadi we had developed only at a cost of 5.5 lakhs. And when we then interviewed the children and the teachers that what aspects of this Anganwadi do you like? And then they said that it is the bright paint and the Bala. So 3-4 aspects they told us, and that costing only came to about 50,000. So it reduced our cost again. We realized what are the aspects that are important to the child, what are the aspects that because of which the guardians were motivated to bring the child back to the Anganwadi. So we started developing a few more Anganwadis only at a cost of 55,000, just bright painting, a few floor mats and some Bala drawings, like, the fable of the crow with the stones or the lion and so on. So these were some of the initiatives that we had taken up in Gwalpara district. Some of these are also from Kokrajhar district, where I was recently district commissioner. And we found that what Honorable Prime Minister talks about Jan Bhagidari, Jan Andolan, in a place like Northeast, where there is a lot of community feeling. If that community feeling is harnessed, even with very limited resources, we can achieve great results. Thank you so much.
Stay there, stay there. I'm just going to ask you one question. First of all, thank you for this inspiring work. There are 2 or 3 points which I thought are very critical and very important. One is this harnessing community involvement in what you do. It can give you benefits much longer. So I could see through the presentation, you have developed synergy between public-private kind of a partnership, if I can use the word, and which enhance the community development. So the involvement is very, very important here. Secondly, I also noted the fact that several government departments like administration, education, social forestry, sports and development, all this you got on a common platform. So one is the group of recipients, which is in the community. One is the group of service providers. If you get all of them on the same page, then the support that you get for doing anything is phenomenal, right? So I thought this is also very important. And look at the phenomenal results that are achieved in dropping the rate of malnutrition and yes, and child marriages. That's a great work, which has, the results speak about the work. So congratulations and thank you, all of you, for the inspiring presentations. We are going to hard stop at 3:30, but considering that, as I mentioned, there is a number of years of experience sitting here, if you have just 1 or 2 questions which are burning, you can ask the panelists, otherwise we'll happily let them go. Is there anyone wanting to ask any question? Where? Quickly, ma'am.
धीमान जी, मुझे आपसे एक क्वेश्चन था कि मेघालय में आई हैव बीन डूइंग अ लॉट ऑफ फील्ड वर्क मेघालय में एजुकेशन सेटअप में, तो मेरे से एक क्वेश्चन था कि आपने टीचर मोटिवेशन कैसे आपने इन्फ्यूज किया टीचर्स में, एंड एक पॉइंट होता है कि प्रिंसिपल को भी बहुत तो रेमेडियल क्लासेस है हमारे यहाँ पे भी, तो उसके हिसाब से भी वी आर नॉट एबल जो आपने अचीव किया है, तो आपने उस पॉइंट तक कैसे अचीव किया? और डेका मैम, आई हैव वन मोर क्वेश्चन, हाउ डिड यू tribal community development, because we see a lot of tribal population in all of these northeastern states. तो आपने हर एक के साथ कैसे inter tribal community development approach रखा है? बस
मैम, सबसे पहले तो क्लास में 2 टाइप का शोर होता है। एक शोर होता है कि टीचर पढ़ा रहा होता है और बच्चे वो एंजॉय कर रहे होते हैं, दूसरी साइड में सुनते नहीं है, वो अपनी बातों में व्यस्त रहते हैं, किसी पीठ के ऊपर लिख रहा है किसी के, वो दूसरे हंस रहे हैं, और वो जो एक इम्पोर्टेंट पार्ट होता है हमारा कंटेंट मैटर का, वो कहीं दूर चला जाता है। तो जब मैंने नोटिस किया कि क्लासरूम में मैं गया तो वो ये बात मिस थी। बच्चे शोर कर रहे थे। शोर दो टाइप का होता है, एक होता है क्रिएटिव, जहाँ बच्चे काम कर रहे होते हैं, वो शोर भी होता है और उससे लर्निंग भी होती है। तो जब मैंने देखा ये तो पैसिवनेस है बच्चों में और वो कहीं दूसरी दिशा में जा रहा है, तो धीरे धीरे टीचर से बात करके इसको कैसे बदला जाए। हालांकि कंसेप्ट मेरे माइंड में तो था, मैं इसके ऊपर काम कर चुका था और सक्सेसिव रेट भी बहुत था। और धीरे धीरे मैंने टीचर से बात की कि इसको शोर करो, जरूर बच्चे शोर करें, लेकिन वो अपना कंटेंट मैटर के ऊपर करें, क्वेश्चन करें। जितने ज्यादा बच्चे क्लासरूम में क्वेश्चन करेंगे इसका मतलब वो लर्निंग हो रही है। लेकिन होता क्या है, बच्चे क्वेश्चन पूछते नहीं है, टीचर ही क्वेश्चन पूछते जाता है और बच्चे उसका आंसर देने में असमर्थ होते हैं। तो मैक्सिमम शोर इस बात का हो कि बच्चे मैक्सिमम क्वेश्चन टीचर से पूछें, ताकि टीचर भी घर से पढ़ के जाए, कोई कंटेंट मैटर के ऊपर वो काम करे, उसको गूगल में सर्च करना पड़े कुछ, ताकि बच्चे की इफेक्टिव लर्निंग हो। तो धीरे धीरे अलग अलग क्लासरूम में मैं जाता गया, टीचर को ऐसे मोटिवेट करता गया, थोड़ा थोड़ा अपना कंसेप्ट भी वहाँ बच्चों के समक्ष और टीचर के समक्ष रखता गया। धीरे धीरे टीचर वो मेथोडोलॉजी जो कि पैसिव लर्निंग मेथोडोलॉजी थी, वो एक्टिव लर्निंग मेथोडोलॉजी में बदलनी शुरू हुई। लेकिन इसके लिए जर्नी बहुत लंबी है। ये मैंने 2006 से स्टार्ट किया था और 2023 तक, आज भी मैं परफेक्ट कहूँ कि 100% तो वहां तक नहीं अचीव कर पाया। सभी टीचर को समझाना तो मुश्किल है, लेकिन फिर भी 80% टीचर जो है इसके ऊपर काम करना उन्होंने शुरू कर दिया। दूसरा मैम ने बात की, आपने उनकी जो ट्राइबल और दूसरे वो थोड़ा सा।
Thank you. That is actually a very interesting question, especially for a district like Gwalpara, because we have Rabhas, we have a significant Garo population as well, about 9% Garos, and Bodo population Hajong. So various tribal groups, and as you know, all are very different. I mean, for somebody outside, they may think ki common hai, but very different kind of a. So the first thing is that we did not, go into it like a bull in a china shop. So our initial initiatives were community focused. कि राभा community के लिए कुछ किया. For Garos, the interventions were more on the medical side, because we saw that they had this thing not to indulge in too many wordy IC messages. So there we had done a caricature called Pehi. So initially it was all community focused, but over a period of time, as we build up trust, certain things we talk to them about. That you put your differences on hold. This is a new climate. This is a new period of development. So put your differences on hold. And we used to give them super goals that, our district, our block wise, maybe GP wise, that you have to achieve this reduction of maternal mortality rate. You have to achieve this reduction in the dropout. So giving them these super goals kind of shifted their focus from A to B. And to some extent, of course, we from the administration side, we also had to, sometimes play a stern role, because in certain cases, when the immunization, one community person would go to immunize, the other community would give some kind of a back. So to some extent, it was kind of a carrot and stick. But largely, first, we had done our initiatives community-wise, and then we engaged in a continuous dialogue. Whenever we felt trouble brewing, we had a good intelligence network. So as and when we felt that there was some trouble brewing, we would talk to their community elders and we would try to resolve it and nip it in the bud. So this was what we had done.
Thank you for all your presentations, very inspiring presentations. We're going back, boosted up and with a Philip. And thank you for your participation and your patient listening. Thank you.
Thank you so much for an enlightening session. And without further ado, I'd like to invite Dr. Nirmalya Bagchi on the dais to felicitate our moderator, Ma'am Hazarika. I would request you to be on the stage to be felicitated. So we'll begin with the last session of the day, and that is our panel discussion on environment and rural development. And the moderator for this session is Dr. N.V. Satyanarayana, Advisor ASCII. Dr. Satyanarayana V. Nanduri is a distinguished professional with a PhD in computer science and computer science and engineering from IIT Kharagpur. With nearly 20 years in CSIR, National Metallurgical Laboratory, Jamshedpur, Dr. Narayana led the supercomputer facility for process stimulation, modeling, and automation. Presently serving as advisor at the Administrative Staff College of India, Hyderabad, Dr. Satyanarayana actively contributes to policy development. His involvement as a member and chairman in various committees, including the National Nanotechnology Mission, DST Inspire, MSMEDI, and more, reflects his commitment to shaping strategic initiatives. His significant achievements include 2 technologies developed by his group receiving the prestigious CSIR Best Technology Awards in 2009 and 2021, along with 5 research publications earning Best Paper Awards in international conferences. Dr. Satyanarayana's academic mentorship extends to having guided over 30 PhD, MTech, MBA, BTech dissertations. Dr. Satyanarayana, I invite you on the dais to lead the last session.
Thanks for the introduction. Yeah. Well, this session, the last session, is dedicated to celebrate the innovations in environment and rural development. Okay. Now, talking of environment, we as the scientists and bureaucrats sitting over here, we generally talk of the COP summits, okay, which talk about global climate change, and then the bureaucrats would talk about how to ensure that the commitment, India's commitment of reducing the present level of fossil fuels in energy generation to about 50% by 2030. Okay, we also talk of going in for net zero carbon emissions by 2070. Okay, while at the same time you have many statisticians, many environmental activists also raise an alarm that presently the total burden or the total carbon emissions in the world are about 36 gigatons per annum. Okay. Now you can sit back and then say, what is the world doing? What is the COP doing? Well, they come out and then say that we are spending about $800 million in trying to mitigate this pollution. Okay. Well, $800 million looks to be a good sum, equal to the GDP of a very developed nation like Switzerland, but is it good enough? Okay, if you make a rough calculation of about 800 people, a billion people in total population, you would arrive at a figure which is astounding. Each one of us sitting here are actually carrying 45,000 tons of carbon dioxide on our shoulders. So what should we do? Is 800 million sufficient? Again, a conservative estimate, like with several riders, you can say that maybe you need to spend about half of the GDP of the total world, to mitigate this carbon emissions. So this puts us back to question, why did we not have this problem in the ancient India? And when ancient India was having, maybe about 50% of the world GDP, why did we not have this problem? Okay. Well, the ready answer, which is we can all accept per se, is that, well, there was no rapid industrialization. So that's the reason we did not have this problem. At the same time, you can also say, no, we had the art, we had the science, we had the technology on how to utilize the resources that we have without polluting the nature. Okay. Now, if this is what we tend to believe, and if Kurukshetra, if you all believe that Kurukshetra did happen, and the amount of metal that is actually used in Kurukshetra is about 20 million tons. Okay. So which is equivalent to about 20% of what Indian steel production. So it doesn't mean that there was no, if Kurukshetra did happen, industrialization was there without actually polluting the mother nature. So where is this knowledge gone? So it's anything that is old, we call it traditional knowledge. So where is this traditional knowledge? It's not there in the class books. It's not there in the textbooks. It is there, stored here. You don't have to go anywhere in the tribal population. Because we have done a case study where we have seen how the artisans in Jharkhand area make, these metal tools. So they don't have any fancy furnaces and all. They use, the charcoal from a particular tree, and they know how to exactly reduce the metal to the extent that they want. No pollution. Okay? So what it actually means is, if you actually try to take on board the rural population, the tribals, okay, try to embrace their technology, then you're not causing any harm. And that's precisely the reason why Cips, the director of Dr. Valli, has very consciously clubbed these two innovations together. That is innovations and rural development. So always remember, anything that is any innovation that comes out of the rural folk or the tribals will never be harming the pollution, harming the environment, because they have the respect for the mother nature. So with the back again, Mr. Shiv Kumar, Shete Lohe. Is the pronunciation okay? Lohe Saab, thank you. And Anuranjan Singh. I think we follow the model which Dr. Anjali Hazarika has done. So that will give us more space and time to ponder, on the innovations that they have done. At the same time, also gives us an opportunity to learn what they have done, so that the whole idea is to see that it is replicated elsewhere. Okay? So what I do is, each one of you will come here, and because I was told that the Chief Minister will be coming a little early, so we need to close the session by 4:30. Okay? So each one of you kindly take about 5 minutes. Okay? Introduce yourself and the innovation. And maybe you can also cover whether this can be replicated. Okay? That will make it more interesting. So let me first call Mr. Prasad on the DS.
Namaskar. Respected moderator of the panel discussion, and all other esteemed panelists, and all other esteemed guests and speakers of this today's program. Let me introduce myself. I am Prasad Rao, 2010 batch Indian Forest Service officer from Tripura cadre. And at the outset, let me convey my sincere thanks and gratitude to the Cips and Administrative Staff College of India for promoting for recognizing and promoting such type of innovations to replicate elsewhere also. It is a good initiative, and we're all given a good opportunity to highlight our initiatives so that it will be a motivation for all of us. And we would like to request also the Cips to continue this program in the future years also. It should be continued, so that all the initiatives will be, so many initiatives which they are not coming into the limelight, they will come out, and it will be replicated elsewhere. And title of my innovation, as Sir has told, if unless the innovation will not generate any employment opportunity, or will not generate any revenue or income to the state or country, so that will not be of that much attractive and useful. Not of course always, but mostly. So with that approach, we have developed an innovation in Tripura, particularly at my personal interest, we have innovated. This is broom refill with eco-friendly bamboo handle to sweep not only premises, but also plastic and poverty. So this is the noble concept we have designed. Of course, it may appear how this simple one innovation, how it is recognized here for this award. It may appear, but at the end of my discussion, my appraisal, I think you will all appreciate. Why it is conceptualized? We are having a lot of environmental policies. We are having a lot of, every year we are imposing a lot of restrictions on single-use plastic. But always I believe a philosophy, until and unless we will not show any alternative, sustainable alternative for any of the single-use plastics, though we will put any restrictions, we will enforce any sort of restrictions or regulations, it won't be adopted by the people or public or industries. And I also believe a philosophy, of course, we can, if we will put our thought and mind, definitely we can develop such type of alternative, sustainable alternatives. Because I believe the concept or philosophy, necessity is the mother of invention. If we feel that alternative, sustainable alternative is very much required and should be developed, then automatically innovation will come. So with that thought process, we have developed a concept like this. Sustainable alternative, sustainable in origin nahi hona chahiye. It also should be economically cheaper also to the existing practices, and scalability and availability to all the in all the corners of the country or state. When all these, in terms of all these aspects, sustainability is not there, again it will be a failure. So for that, why I have selected a broom? Because we are having almost 130-140 crores of population at the rate of minimum 6 per family. If you will take, we are almost having having around 25 crores of families, and each family every year minimum 5 brooms we are using in our home. And I have calculated the weight of each broom handle which we are using is plastic. Actually, we are using almost in every house. It is inevitable we are using broom, and it is all having with a plastic only. If we measure the weight of that broom, it is almost 40 grams per each handle. When we are calculating 25 crores families at the rate of 5 brooms per year, and each broom handle is having 40 grams of plastic, we cannot believe in India alone, every year, only through this broom alone, we are generating 40,000 metric tons of plastic waste, which is going simply as a landfills, as a waste, plastic waste, and it is generating a lot of plastic pollution, and hardly this plastic material will be picked up and will be used for the recycling. So that has motivated. Of course, I am from Indian Forest Service. Whenever we are working, always we'll keep in our subconscious mind how my innovation will save our environment, save our forest, and at the same time, how this innovation can be linked up with the forest dwelling communities, so that it will create an alternative, it will create an employment opportunity also. So with that subconscious mind, this concept has developed. So before developing this concept in Tripura, the scenario of the Tripura is almost all the northeastern states, we are blessed with very good natural resources, especially minor forest produce. One among them is broom grass, hill broom grass. And I think more than 80% of the broom grass required for the entire country is originated from northeastern states, and it is all going to the mainland states as a raw form only. Hardly it will be value added. Though we have a lot of potential to value added it, and so that we can create a lot of employment opportunity, but hardly we are doing. And these are all going to the mainland states, particularly UP, Bihar, where some cheap labor is available. Then it is getting value added, and our states are getting deprived of this valuation and employment generation. So that is one scenario. In the not only in Tripura particularly 1,000 metric tons of plastic, 1,000 metric tons of broom grass we are collecting. And in the entire northeastern states, I think almost all the states will be having the same potential. Particularly Meghalaya is also having very good area under this broom grass. And we are having 22 number of very good bamboo species, which are very well can be used as an alternative to steel, alternative to plastic, alternative to timber, and which is light in weight. It is as strong as steel also. And but of course, because of lack of development of any innovative things to use those bamboos, we are not able to use these bamboo species, and they're all literally, I can say, वो पूरा हमारा जंगल में सड़ रहा है. वो एक scenario है. It is not only to Tripura, it is for all the northeastern states. And at the same time, we are having beautiful traditional bamboo handicraft artisans. They can do any sort of wonders with they are having, but they are not having the idea how their artisanal skills can be utilized to prepare certain products, utility products, industrial products, so that they can be an alternative to plastic sort of thing. So these skills are there. So taking these three as a opportunity, these three skill sets are resources as opportunity, we have conceptualized this product. उसमें हम लोग क्या किया था? So we have first identified among 22 number of other different bamboo species, one bamboo species first we have identified, which is light in weight, at the same time should be harder. If somebody will throw it also after using the broom, it should not break. So that is number one. And bamboo का species को use किया है, then select किया है. उसके बाद, if we want to promote this product in the market, it should be at lower price than the present brooms which are marketed through this plastic handles. अगर उसको करना है तो if we want to use.
Rogaru, can you summarize? We'll come back to you again. Okay. You can just summarize.
So just I will show so that I think simple innovation how it will be impactful and how it can be promoted and how it will save a lot of plastic for the country. Because
one can take this as a souvenir, right?
So this is the each broom के साथ हम लोग जब landfill में कर रहा है तो this much plastic waste we are adding to the soil. So these two, and this is from a prominent company, 555 or Menki. It is one of the major branded company which is producing almost 1,000 brooms per day, and one more company is Gala. So all these corporate companies have not having any social responsibility. They're all using this much plastic as a plastic with the brooms, and they're generating, but it is not of their fault because they don't have the alternatives. So for that, we have designed these two type of this is simple bamboo piece. इसका जो एक versatile property of bamboo जो है, it is flexible like a it is flexible also. It is having elastic property also. उसका जो elastic property जो है, यहाँ पे आप जो देख रहा है, ये elastic property जो है, ये property को मैंने मतलब ये use किया गया है. If it will be cut it like this and इसका elastic nature of property जो है उसको हम लोग use करेंगे. And this sort of refills. This is a hill broom grass which we are having naturally in our forest. This we have prepared as a refill, and we'll put it here. And we are having a tag here, lockable and delockable sort of tag. Once we will put it here and we will lock it, it won't come. We can use it. Once it will be spoiled, it will be taken out and another one can be used. Once it will be purchased by any family, hardly they require this one every time. Only this roof hills. So इससे क्या होगा? Families के लिए भी, households के लिए भी सस्ता में ये material मिल जाएगा. And plastic we can prevent. And
I think
our
Prasad
Northeast-
Rao, your innovation needs an applause, kind applause, please.
Our-
That's really great.
Our Northeast
Uh,
people, और हमारे यहाँ पे जो bamboo सड़ रहा है, उसका valuation आ जाएगा. And by making this one, our people will get an employment opportunity in Northeast, and they will get employment even during the lean season. Only 3 months, this collection season will be there. During that period, only they are getting employment opportunity. If they will do this one, throughout the year, they can do this one, and throughout the year, they can get the employment opportunity. That way, my innovation have generated revenue and generated employment opportunity, livelihood opportunity, and of course, it has the potential. It has the potential to prevent 40,000 metric tons of plastic every year in India alone.
Yeah, thank you so much. We'll next have Mr. Shetel Lohe. He's actually into promoting kiwi fruit as an organic drink.
Good afternoon, everyone. I won't be wasting my time because we don't have limited time, so I'll directly head to the innovation of which I have did in the last many years. Firstly, I thank you so much for giving me this opportunity. The first thing, when I talk about kiwi, what comes into your mind? Kiwi is a very good vitamin when it comes to like different types of fruits, if you compare. So when we first started this kiwi cultivation, it first comes into our state, Nagaland, in the year around like 2008-9. Through horticulture department, to which some of the farmers, they have taken this initiative and started planting of this kiwi. And after some 3-4 years time, it started bearing fruits. So their production was, at the initial stages of their production was such that it was not able to consume by our local people itself. Why? Because that thing is, this kiwi fruit is quite new to our state, and the people in our state has not cultivated the habit of eating these fruits on a daily basis. Because of that reason, lots of kiwi fruits have been damaged and could not able to market properly. That is one of the reasons. So when I look back at the history of our states, since Nagaland, we don't have any big companies which can export any type of raw materials or any type of products outside states. Maybe because that's one of the reasons why we are very lacking behind when it comes to exporting of any type of goods from our state. Yeah, so we come together. At first, I thought like, okay, fine. First I have to search for the market channel. That is one of the first priority, first innovation, which I have thought of before doing the innovation. Secondly, I have to bring all the farmers together in a cluster format so that we can able to cultivate into such that we can have the potential of exporting to each and every states of our country. That's what I thought of at the initial stage. So it was not easy at all, because me being an individual entrepreneur, like without any financial assistance, working alone was not that easy. It was a very challenging task, I should say. These friends who has already shared about their innovations, they are from the very high government department, or say like very well settled people, comparing to what the situation I have came across since the last many years. So for me, I have experienced such that like when I call people for any type of gatherings or meetings in order to highlight about the importance of coming together, I have experienced such like could not able to afford even the lunch, to provide lunch to the fellow participants. That is the reality. Trust me, that is the reality. So those type of things I have experienced. So we still able to manage, try to contact the village chairmen, village GBs, village gamburas, and so on, in order to form cluster format and build the trust between me and between my farmers. That's how we have started. So initially, it was not that easy, but slowly we happened to
teach the farmers the importance of kiwis and how it can be exported outside our state. Those type of things we have started. So see, when we talk about Nagaland, we have around like 70% of farmers who still depends on agriculture. Just imagine, 70% of the population, to which in our state, we practice only shifting cultivation or either paddy cultivation or terrace cultivation, right? So shifting cultivation destroys a lot of environment in our state. Like after 2-3 years, we have to shift to another place again, cut all the trees again, start a new plantation again. That's what we have been practicing. But when we talk about kiwi, in case even if you cut down 1 hectare of land in order for plantations of kiwis, that kiwi farm once started, it can last till 40-50 years. Trust me. That's the difference between shifting cultivation and planting of kiwis. So when we talk about protecting the environment, it plays a very important role out here as well. So you see, kiwi, in one way, it also destroys the environment for sure. That is, we have pros and cons. But when we look properly, it has lots of benefits because in some point of time, we can even help the farmers in the rural areas to generate their income. That's how the important it is. So those type of things are there. And now our company stands in such that we can able to produce about like 400 to 500 metric ton of kiwis every year. And some of our top farmers can earn about like 7 to 8 lakhs rupees annually. That is the impact which we have contributed in the farmer's life. So even this year, last year, if we have to look about the data, like we have provided about like 50 to 60,000 of saplings to almost all the districts in our state, as well as some of the neighboring states like Manipur, to Senapati and Ukhrul district, because out there they have the potential as well as the weather condition is quite good and favorable. So they're also practicing and replicating the ideas of ours. And those are some of the few things which I would like to share with you all today. Thank you so much. And if you have any questions, please let me know. Thank you.
When we talk of the northeastern states, we generally talk about the forest resources that it has. Okay, but then what we very conveniently forget is the human resource that you have. But then the main challenge there is to how to convert this resource that you have and then try to make them as harbingers of change. So this is what, Shiv Prasad Upadhyay would be doing, Shiv Kumar Upadhyay would be doing. Please kindly.
Good afternoon to all. I am Dr. S.K. Upadhyay. I am Deputy Project Director working in World Bank aided watershed project. It's the Uttarakhand Decentralized Watershed Development Project. And I am along with Mr. Deepak Shah. He is our horticulture officer. And basically in Uttarakhand, we are having 13 districts, and out of which mainly 10 districts, these are hilly districts. And to talk about this one, since it's also a Himalayan state, but it's an irony that despite of being a Himalayan state, Himalaya is viewed as a tower house of water for Asia. But the condition is that we are having around 90 to 92% of arable land that is rain-fed. So I come from a district, Almora, where the arable land is 92% is rain-fed. And the cultivation means the agriculture is the main profession there. And it's been cultivated in fragmented land holding, in inaccessible terrains, with very small land holdings. And mostly the water which is available for irrigation, it's very meager. And whatever meager amount it is available in the downstream. And the habitation as well as the arable land, it's on the upstream. So it's like that to use that particular water for irrigation, it has to be pumped up. So the places, the streams, basically they are at the places where it's not accessible for electricity, and diesel as well as petrol pump, it's very costly and it's not eco-friendly. So our intervention was that we have used 5 horsepower solar submersible pump for pumping water to a height of, it's a vertical height of 118 meter. And we have irrigated around 100 and, we have irrigated 6 hectare of land. We have, it was converted into assured irrigation. The intervention was important, but more important was the modus operandi, means how what actually the approach is. So basically, we have gone for a 3-pronged approach. The first being the social mobilization and participatory planning. So as my friend from Nagaland, he was telling that the most difficult part is, according to me, is the selection of the right beneficiary. And the second thing is the social mobilization part. So since it was a World Bank project, so we were having the ease of experimenting. So what actually were the drivers of change as far as social mobilization is considered? So I will be talking just for 3-4 minutes, just 2 to 3 minutes with regard to social mobilization. First of all, since it's a decentralized watershed project, it was essentially a Panchayati Raj institution, which was the general body meeting was deciding what exactly would be the intervention, who would be the beneficiary, where that particular intervention would be done. This was the first part. Secondly, so it seems quite bookish that everything lies with the society itself. But how it was implemented? The second part was very interesting. In our state, the gender inequality is there. Mostly the agriculture part, it's being done by the female counterpart. And when it comes to the agribusiness part, means post-harvest part, the handling part where the money comes, it's being handled by men. So everything is being done by the female, and lastly, it goes in the hand of men. So basically, the financial control was as such that to ensure the gender equity, the project fund, means every Gram Panchayat was given a fund, it was earmarked, and the Gram Pradhan, along with female ward member, they were made the co-signatory. So here, to ensure gender equity, that female ward member, we have tried that the democratically elected system, it has to be brought into place. We don't want to elect someone else from SHG or elsewhere, because what we have seen in our last project, that it generally doesn't propels. So it's better that we back the Panchayati Raj institution, the democratically elected system, since it's being elected by the people itself. And this system worked. Thirdly, only giving the financial part to the society, it won't work. What we have done, that we have selected an account assistant, which might be BCom, either BCom, first priority is BCom, then BSc or BA. If there is no person from bachelor degree, then we would be moving for someone who is having 12th pass in commerce. So they would be, it's an account assistant who would be given 4,000 rupees per month for record keeping. Just it's a 3 or 4 days to maintain the records and all that. And secondly, in every revenue village, we have selected one motivator from that revenue village itself. So that motivator has to be female to convey the to and fro feedback of the project. Means what projects, the support which it wants, and the feedback, the training part, where to conduct it. This to and fro movement of the information is being done by the motivator. And she is given around 2,000 rupees per month. So basically with these things, these are the small interventions which brought the transparency as well as confidence in them. Apart from this, basically we are from, we government people, we are very good technically. But when it comes for social mobilization part or for agribusiness part of agribusiness point of view, then the NGOs, they are better equipped for doing this, because we are not meant for doing business or that social, because that's not our forte, that's not our strength. So we have employed NGOs, and for social mobilization, the whole staff, right from coordinator till the field staff, it has essentially to be the female part, because they have to deal with the female. So these were the drivers for social mobilization and planning. And essentially everything was done through PR exercise, the prioritization part and all that. And this was done. The second prone approach was the technical part. It was to ensure the water security. So first thing is to ensure water security. The water management was done in holistic manner. The streams, we don't want to just to pull water from the downstream to upstream. First of all, it has to be recharged. So the recharge part was done in spring shed approach. Spring shed map was made through that spring shed approach. And secondly, all the interventions were planned like water recharge intervention, water harvesting intervention, and thirdly, the water conveyance intervention. These three were, it was the holistic approach. We won't be pulling water unless and until the water recharge activities like dugout pond, trenches, and all that has been set up. Then after that, the water harvesting in the command area, so that the geomembrane tank, this LDP tanks, roof water harvesting tank, it was made. And thirdly, the conveyance part, that to increase the water use efficiency, the pipes as well as the pumps, they were installed, and the water was pulled to 118 meter upside. And in the command area, there were 19 LDP tanks, small tanks, which were which were ensuring the irrigation there. So that was the second intervention. After doing this, the third part was, when the irrigation was assured, then we have turned to cash crops. We have changed to the rain-fed agriculture. It was changed to the off-season vegetable. We have gone to spices like turmeric and ginger, so that the man-animal conflict with respect to the wild boar as well as monkey menace, it can be controlled. And moreover, the medicinal plant like Agnesia purpurea, it's a very good diuretic one. It was tried, and even even floriculture was promoted. So this was everything. It came into place, and the third approach was for sustainability. Means the first one was for social mobilization. Second part was for water security, and third was to for the sustenance part. There was provision of users group. Users groups were made, and we are having, the community was having corpus fund or to the tune of around 3.2 lakhs at present, because we have left in 2022 March, the project has been closed. Now they are having a corpus of 3.2. Apart from that, the skill development with respect to the plumber part, the training to the plumber, the operation part of the pump, that was being undertaken, and the this one bookkeeping training was imparted to the villager itself. So now they are
can you complete?
Yeah. So then now they are maintaining this one, and the impact was that there was an increase in crop intensity of 48%. Initially, it was 116%. Now it has increased to 166%. And the farmer income, it has increased to the level of 2.83%, 2.83 times to what that was initial. So I think that's from my side.
Thank you. Okay. Now we all agree that the resources that we have, either human or the forest resources, okay, they're all there for you to harness. Okay, but then you also need to build an entrepreneurship ecosystem to sustain this. Okay, to talk about it, we have Anuranjan Singh. Okay, speaking about it, his innovation.
Thank you so much, sir, for giving me time. Respected Dr. Manikam, Dr. Bagchi, and CIPS team, thank you so much for having me here. My name is Anuranjan Singh. I am a skill development officer from Bukha district of Nagaland. I will be talking about how we turn this policy saturation to implementing satisfaction. There's a time when we joined Okha district of Nagaland. We have seen like everybody working in their own. Like there was a very big problem of bureaucratic silos. Every department working their own. in district, we have around 40 plus department, they're working their own. That was leading to duplications, lack of convergence, lack of coordinations. We sat together, me and my district collector, we sat together, we thought of breaking these silos. We thought of making such a place, making such a holistic support where anybody can come in a place and get their support or avail their schemes from across the district. So we'll end up with making of a committee, making of a kind of group named that Entrepreneurship Task Force. We make it short form GTF, and we nominated all the officers from line departments to come into this and join us to give us one holistic support at one platform. Either it's skill development, entrepreneurship, livelihood, any kind of support anybody looking for. They don't have to worry about whom to approach, how to approach, where to go. So we thought of making one place, making one, say like, one department or one committee where anyone come and get the support. The most, I talk also the difficult part is breaking the silos. This was the most important part to show the department. How can someone trust us also? Being a department is very difficult to tell them to come and converge with us. So we showed them success stories. We aware them and we give them a chance to come with us. This is the result we are giving. This is the platform we are giving. We also we were serving for common people, common goal. But only thing was we're doing by our own. We are doing differently. So we clubbed together and somehow we were able to succeed and we are able to target 20% of our population. There was also problem of bank lethargy. Despite of obligation, despite central government, so many rules, regulation, they're not able to support fully. There are all obligations they will have obligations to extend loan support, credit support, but they're having their own lethargies, so they said, instead of giving loan, better I will pay penalty. So this was the situation in Okha district of Nagaland. Somehow we managed that situation, somehow challenged that situation, and somehow we succeeded. Talking about that our ecosystem that we develop currently in Okha district, we are implementing our 38 plus schemes. We are converging at one place, including CSSS and state schemes. As I say earlier, it's very easy to saturate the policy. It's very easy to saturate the schemes, but there's very much difficulties to having a last mile satisfaction, last mile delivery of any schemes and any services. That's it from my side. If anybody have any question, I would love to answer. Thank you.
Yeah, thank you so much. Well, we spoke of kiwi as a good organic drink. We have another product, coming your way. Yeah, Varnali ji. She'll talk about, the mushroom cultivation, which she is promoting as a good nutraceutical supplement.
So I'm back on the dais. I'll just take half a minute for an anecdote. So every, Shillong used to be our summer vacation place. So as a kid, every summer we used to drive up to Shillong. And the moment we used to stay in this police guest house, and the moment we reached police guest house, itna acha mausam hai, sun and cold and everything, we would sleep off. So why I mentioned this anecdote today is that in this nice cozy weather, with the food that, Cips and Taj has given us, mutton chop and butter chicken and baked fish, still all of you all are so attentive. I would like to dedicate one round of applause to all of you. So I have not seen a more attentive audience. Of course, the speakers were also very good. And since today's session is on environment and rural development, before going on to speak about mushroom, I would like to speak about another initiative. This initiative was also, in fact, shortlisted amongst this Cips, final round. And it is a PM award-winning initiative. Since the session is on environment and rural development, I will just like to talk for a minute on one initiative that we had taken up in Gwalpara district. Again, the hero of this story is Niti Aayog. Niti Aayog was after our lives. You have not been able to construct roads. You have not been able to connect habitations. These are KPIs under the aspirational district program. So again, I'm sitting with my team because at that point in time, I had just joined the district. The ADP had just been launched by Honorable Prime Minister. And our main highway, the NH, I think that was NH 15, which connects Gwalpara to the rest of the state, the bridge had broken down. So we were completely cut off from raw materials, and due to some Supreme Court order, we had to also close down all our stone quarries. So we did not have any raw material. By May and June, the contractors were coming to me that, ma'am, you take any action against us. If we don't have raw material, what do we do? How do we construct the roads? So it was at that point in time that I sat with my PWD team, and I had just been to Delhi for some program, and I had seen that some of the other states doing work on green technologies. So we decided to take up green technologies in road construction. And our PWD team, the reason for mentioning this is that if you have an active team on the ground, particularly an active technical team, you really can achieve a lot. So our PWD team was very good, and we decided to take up waste plastic for road construction. That is one green technology we took up. And so Gwalpara became the first district in the country, in the state, to use green technologies for PMGSY road construction. And after this, we took up various green technologies like ICBP, we took up cell, mixed coal cell, and so on. And initially, public were like, this is some scam, that why not normal roads? Why are you giving us these kind of roads? So they were coming to us saying that, we do not want these roads. But gradually, as they saw the performance of the green tech roads, because in terms of disaster resilience, say the concrete technology, the ICBP, the block technology was much better. Over the next, in my own tenure in Gwalpara, I could see in the next couple of years, people actually coming to us and requesting us for these green technology roads. And just for some statistics, under PMGSY from 2000 to 2018, the length of road construction was 534 kilometers, which translates to only 24 kilometers per year. But in the ADP period, with the use of green technologies, from 2018 to 2020, the length of road construction was 530 kilometers. So see the difference that one small intervention could make. So I'll end the green technology story. The next, today's award-winning initiative is in terms of one district, one product, which is mushroom. And I would like to briefly talk about why we selected mushroom. But before that, in terms of when you think about ODP, ODOP, ODOP, we generally remember Honorable Prime Minister's quote that every district in the country has the potential equal to a country. This is what Honorable Prime Minister had said. And indeed, this is true. A lot of us have come from the districts, and we know the potential. We know the vocal for local, whatever local products and produce that we have. I had been to Singapore a couple of years back, and I saw that Singapore was actually smaller than my subdivision also, So this is the potential that we have. So when I joined Kokrajhar district, the previous initiatives were all from Gwalpara district, but this initiative is from Kokrajhar district. Kokrajhar, for those of you that are aware, it has been an insurgency-prone district, a deep-seated history of insurgency, of violence, of strife. And also it is very critical, being the entry point into India's northeast, into Assam, from the Chicken's Neck, the Siliguri corridor. As you enter, we are the first district, Kokrajhar. So when I first joined the district in 2021, I found that the district did not have an ODOP. But all over the country, people were talking about ODOP, ODOP, one district, one product. But we did not have an ODOP. So I called all the departments, just before, I think, from Wokha, he was talking about departments working in silos. So I called all of them. I called all the departments. I called the academia. I called the various in universities, the colleges. And of course, it is a 6th-scheduled district. So we have to work in tandem with the Bodoland Territorial Council. I also requested the council, and we all sat together. And I realized the reason was that there was no consensus on what should be the ODOP. So we did several rounds of brainstorming. ODOP for other districts is so easy that ek select ho gaya, it just emerges. For us, we had to do several rounds of brainstorming, trying to figure out which product would be suitable to all and which product would have a high degree of economic benefits. So we talked to the academia, we talked to various departments, and mushroom was selected because of a number of reasons. Mushroom, actually, ODOP for this session on environment and rural development, is actually spot on, because mushroom is a zero waste product. Assam has the agro waste generated in Assam per year is about 2.74 million.
Can you summarize? So we'll have another round of questions.
Okay. So the agro waste is 2.74 million. Mushroom is a zero waste because this agro waste can be used as a mushroom substrate, and post growth of the mushroom, what remains can be used for vermicomposting and biogas. A, this was the thing. B, in terms of women entrepreneurs, mushroom for women entrepreneurs is a very good product. It is easy to handle. So taking all these in mind, we had taken a mushroom as the ODOC. And just 2 points I would like to highlight. One, in terms of how we could use the women SHGs. Kokrajhar mainly is a Boro-dominated area, and we saw that the women were very forthcoming, upcoming. So with CSR support, we started giving each SHG one mushroom hut. And from this mushroom hut per season, now the income is about 3 lakhs for one season and 6 lakhs if they can do 2 seasons, which is easily an income of 30,000 per SHG member just for, 1 or 2 hours of work. And the other is that we started introducing mushroom as midday meal. And generally, children don't like mushroom. Those of us who have small children will know that they don't like that, that slimy texture. So we got in touch with Boroland University, and we developed a range of 13 mushroom products, which increase the shelf life. And also these products are very good to the palate. Mushroom powder, mushroom soup, mushroom cookies, mushroom pickles, and so on. So these were 2 innovations. There are many more, but I think we are running short of time. So I'll end with this. Thank you so much.
Thank you. Thank you. Dr. Shivkumar, you spoke about, various interventions and trying to reclaim or rejuvenate the water bodies. What's your take on, making use of the technology, say the global satellite communications, satellite imaging and others? Your reflections?
Yeah, basically, just prior to this, since I am from watershed department, our approach was the watershed approach, which is essentially a ridge to valley approach. And then we have shifted to, because that is quite vague one. It's not the precise one. The spring which we want to recharge, it may or may not depend, because it doesn't take into consideration the geology part, to be very precise. So when we are going for that spring shed approach, we are taking that DEM part, that digital elevation model and all that. So that part we have taken for that spring shed mapping and all that. Though that ground truthing part, it has to be done. So that has given us the right kind of recharge which we were anticipating. So that was the main the main crux which brought the innovation, the desired result.
Yeah. Next is Mr. Anranjan's saying. Okay, I was just wondering, when you're trying to promote entrepreneurship, these days, people have been talking of incubators. Okay, so any initiative from your side to have an incubation center?
Sir, like when you talk about Okha district of Nagaland, we have very small population, only 1.6 lakh. It's very difficult to establish that incubation center in that area. But what we did, we do have an ICR incubation center, and we have multiple incubation across the India, across the globe. They are willing to connect and converse with multiple department at district level. So what we did, we called the ICR, we called the other incubation center, that we will give you a platform, we'll give you people, and you serve our people. That's how we serve, saturate the incubations in our districts.
So you're going for a conventional model
Yeah.
where you're also trying to rope in the resources of the other labs that are available. So that's a great thing. Okay. Now the next, couple of queries to the other 3 innovators, in common. One thing is, what are your views or what are your initiatives towards adapting the Korean model for either for kiwi fruit or for broom cultivation or mushroom? And a second thing is, if you want to take it on a global scale, okay, then do you want to invite the bigger houses like, ITCs, PepsiCos, okay? Because this morning, when you actually enter the hotel, we are greeted with, very nice kiwi drink, okay? But unfortunately, you don't find them on the shelves of, when you try to go and buy outside. So your initiatives on trying to adapt Korean model, second thing is, are you looking at inviting these bigger houses? Yeah, maybe.
Sir, regarding this broom promotion, sir, there are 2 companies in India. One is Gala and another one is Monkey, 555 brand. In fact, when we have initially started these products and started to promote through social media, they themselves have consulted And they're also told, sir, it is a good initiative. We are going to adopt it. And on sample basis, they have taken, and they are going to come and approach us. And we are going to have a MOU sort of arrangement. We'll transfer the technology to them. And certain part of evaluation, we'll insist to do it in our originating states itself. So that way, we are going to tie up with the bigger companies. And regarding valuation promotion in the state itself, now I am holding for this Tripura Rural Livelihood Mission also. We are having a lot of cluster level federations, then village level organizations, SHGs. Using that mechanism, we'll be going to train them, and we'll be going to produce all these things, and we'll be having a marketing tie-up with all these, even with Amazon and Flipkart also. Easily from producer to customer, we can easily promote all these products because it is very much needed product to every household. So that sort of strategy we are doing for brooms.
Yes, sir. When I talks about this kiwi, even me, I'm planning to export even outside India. But for now, since we don't have that much production, and moreover, when I talks about kiwis, like it comes in different varieties, to which we have to even understand those things before exporting. These Hayward and Ellison are one of the most demanded kiwi varieties here in our country, to which their production is not up to the extent of demands. So because of that reason, for now, it is quite sufficient for me to export to the neighboring states. The highest buyers of our kiwis are thankfully from Delhi and UP. I have been exporting there since about the last 4 or 5 years. And yeah, we have a very good connection for now. So later on, in case if the production increases, for sure, we will plan for exporting outside India. And moreover, when I talks about this making kiwi wine and so on, for once I thought of it. It needs a lot of investment in order to start a kiwi wine factory. I did started with the paperwork and so on, but since Nagaland is a dry state, Nagaland Liquor Total Prohibition Act is there. So because of that reason, I have to withdraw my idea for like installing the kiwi wine factory. But in future, I'm planning to waiting for the right moment. Thank you so much.
Korean model, to the extent that we are already having cooperatives, it is a very grassroots level model. It is not vertically a very high model. It is horizontally proliferated. So to that extent, ultimately getting cooperatives to do the task, we have already started this, but we are not thinking of any kind of MNCs because we want to first exhaust the local demand. The local demand itself is so much because mycophagy is there in tribal populations. And as we progress, I feel that mushroom being the highest producer of food per square kilometer should be brought into the food habits of all of us. So we do not actually want to go into any kind of bigger MNCs, and we would like to have the grassroots farmers cooperatives doing the task, in terms of local product exhaustion. B, we are also doing exports already to Bhutan and to certain other countries. And C, as an organic, because this is completely an organic produce, so as an organic produce even to Guwahati and the metros nearby.
Promotion. One concern we have sent to Bangladesh also. There was some demand arrived from Bangladesh, and there is a good response for this product in Bangladesh. It seems they are very environment conscious. So whichever the country, whichever the organization, whichever the MNC who are environment consciousness, they will definitely promote, and with that strategy will be going ahead.
Yeah. Thank you, distinguished panelists. I'm sorry, I'm not opening the round for the audience. We are running short of time. But the reason why I brought out, these the second part of my query is we have, Nirmala Bagchiji sitting here. So you can take help of ASCII either in any capacity building work or, making a project proposal, hand holding, and see that the funds will actually come to you, even if it's an incubation center that you want to have, or any other intervention from ISRO for satellite mapping. So Nirmala Bagchi will be there to assist you. And that's the reason I brought out these questions. Okay. So thank you one and all for a wonderful session here. Okay. And let me congratulate on behalf of all of you, the awardees. Thank you so much.
Thank you to all the panelists. So without further ado, I'd like to invite Dr. Bagchi on the stage to felicitate our moderator. Thank you. Now we shall take a very short tea break of about 10 minutes and come back to the hall. Yeah, we'll be here by 4:45. 4:40.
Pan your left, then right. You can walk in short. Walk in short. Pan left to right. Bring it to go outside. Pan, pan to
I request everyone to kindly settle down. We'll start with the award ceremony in a minute. May I request everyone to be seated? Very good evening, everyone. I extend a warm and cordial welcome to every one of you once again as we gather here for the prestigious award ceremony by the Center for Innovations in Public Systems. Before we go ahead with the program, I'd like to invite the dignitaries to take their seats on the dais. I'd like to invite Dr. Nirmalya Bagchi, Dr. Anjali Hazarika, Sri Sampath Kumar, Dr. P.V. Ramesh, Dr. Vinod K. Paul, and Dr. Valli Manikkam to kindly come up on the stage and take their seats on the dais. So our morning session was all about to inspire people and be inspired. And our next session is all about celebrations. So let's kick off the celebration with a warm address from Dr. Nirmalya Bagchi, the chairman of the steering committee at Cips and director general of the Administrative Staff College of India, Hyderabad. Dr. Bagchi, the podium is yours.
Thank you very much. What a wonderful day this has been. Such great learning experience for all of us. And in a sense, a dream come true for all of us in Cips and ASCII, because we have been, as I said in the morning, we have been dreaming about this initiative for a long time, and finally it's here. This is the first iteration, so as I said, more to come, and but morning shows the day. The first initiative has been a grand success. Thanks to all of you, all of your efforts. Just for those of you who do not know about the Administrative Staff College, or Cips for that matter, just wanted to tell you just a little bit about Staff College. We were set up in 1956. So this is the oldest management institution of the country, set up by the government of India in partnership with industry. So in a sense, it was also one of the first PPP projects as a society. Okay. Second unique point about Administrative Staff College of India is that from 1983 onwards, voluntarily, we have stopped taking funds from the government of India. We are on our own. All the expenditure that we do has to be earned by the faculty. So it's a great burden on all of us, but it's a great opportunity also. So the faculty focuses on delivering quality work, because that leads to further work for us. So at every stage, the faculty is always on the lookout to deliver some kind of value for either the government or PSUs, multilateral organizations, or private sector. We are organized, first of all, a little different from how a typical B school is organized, like I am. While IIMs and other B schools are organized on functional areas, like there will be a department of finance, there will be a department of marketing, there will be a department of HR. We are organized sectorally, which basically means we have a department of energy, we have a department of health, we have a department of urban affairs, land reforms, da. There are 12 such departments at ASCII. Each department has its own profile, works on its own agenda. The faculty is completely free to chalk out an agenda for itself and deliver. 13th Finance Commission, in a sense, incubated one center at ASCII, which is the Center for Innovation in Public Systems, Cips, with a 20 crore rupees grant. And the idea was that in our vast country, a lot of innovations are happening, but as soon as the innovator moves away from the chair, unless that innovation reaches a particular critical mass, more often than not, scaling up doesn't happen. So the idea was that Cips will take up those innovations and replicate it across the country. Cips till date has 583 case studies and replication documents, all available on its website. Anybody can just simply, and it's not just a case study in a form that it's an academic work. It's all, an entire process document is available. So Cips has done that. There was a review committee, and the review committee has said that Cips should now do a little bit deeper work, not just documenting practices and hoping that somebody will take it up and replicate it. Now at Cips, we are also utilizing our funds to show proof of concept, which basically means if there's an innovation, you can partner with Cips and you can actually run a pilot scale study in one of the blocks or one of the districts. And we have already done 3 such pilot studies. Once the proof of concept is shown, of course, we don't have unlimited funds. Till the pilot study, the Cips will fund it from its own finances. After the proof of concept is shown, we are hoping that either the state government will take it up or the central government will take it up. Which basically means it's one step further that Cips is going in trying to see to it that those innovations don't just die off in its infancy, but taken to the next stage. So I request all of you, if you have an idea and you would like to engage Cips in taking it to a pilot level, please do write to Dr. Valli or to me, and we'll be more than happy to partner with you and taking it to the next level. And there are no, it's a body set up by the 13th Finance Commission, so there are no commercial interests involved. We are only interested in seeing to it that at the end, some citizens get benefited. As far as the award scheme goes, Dr. Hazarika is going to elaborate on that in a bit of time. But from all of us at ASCII and Cips, this has been a dream come true. We have been trying to do it. And as I said in the morning, it's a beginning. We are going to do it every year, but we are going to do it in the same geography. We are going to do it in the Northeast and the hilly states. Why? Because we feel that this region has got unique challenges, which doing it in the plains perhaps is easier than doing it in the hills. And the deliberations of today's discussions have, I think, proved that working in the hills has its own unique challenges, which requires a complete set of new set of motivational tools. This is just a very small way of us as an institution trying to create a framework in which people who do good work get recognized, and that good work can then be replicated across other states. So when I was listening to Dr. Teka, when she was talking about the mushroom initiative, why can't it be replicated at least in the Northeast, every district? So these are certain things that perhaps from this award scheme will come about, hopefully. But we are there with you. The staff college is also an institution set up by the government, and we'd be very happy to partner with all of you in this endeavor of bringing development to the hills. Thank you very much for having us here. My heartfelt thanks to the Government Innovation Lab, Government of Meghalaya, for partnering with us. Really thankful. My thanks to Shri V.K. Paul for agreeing to grace this occasion. It means a lot for us with your kind presence, sir. My thanks to the Chief Minister for agreeing to grace the occasion. It gives us that additional motivation, all of us, and all the awardees, basically. From my own team, in the morning I mentioned Dr. Ramesh as a steadfast source of support for us. I need not tell you again the kind of help that he has extended to the entire team. Dr. Valli, who has spent sleepless nights because these award schemes, even though, you know, this is an award ceremony, but many things don't happen on time, things go wrong, and her team have done a fabulous job. I congratulate her, and thank you, and over to the MC for the next course of action.
Thank you, Dr. Bakshi. Ladies and gentlemen, our next speaker brings with her a wealth of expertise and a commendable commitment to fostering excellence, especially in women's leadership. It is with great honor that I invite to the podium Dr. Anjali Hazarika, who will enlighten us on the genesis of the Cips Award Scheme.
Friends, today marks a significant milestone in the evolution of Cips. And as you all know, we are all gathered here to honor outstanding innovations in public systems. When we see that a creative idea has been transformed into an innovative practice for larger good, it's a reason for celebration. When we see that various stakeholders of the innovation ecosystem, like the innovators, visionaries, leaders at the state level, policymakers, change agents, come together to showcase their innovations, there is a reason for celebration. And therefore, I would like to call this that this is nothing short of a festival of innovation. And we are celebrating a festival of innovation together here in Shillong. The award ceremony of the center has brought us all together here. It would be only proper that I give you a brief genesis of this award scheme. The 13th Finance Commission, which was set up during 2010 to 2015, conducted a survey of states in India to find out the innovation index or innovative practices prevalent in the states. It was at the backdrop of the fact that 2010 to 2020 was declared as a decade of innovation. What the survey found out, that while there are no dearth of ideas being employed in the states for improving the quality of governance, some areas needed systematic attention. Number one, there was no database available of the innovative practices in different sectors at different levels in the state. There was no cross-fertilization of ideas taking place in different government departments. There was no systematic effort done to cull out the conceptual and operational lessons that came out of these new experiments or novel policies. Specific attention was not given to the innovators, and they also therefore lack the visibility they needed to create a source of change. And there was no effort done to build leadership that can champion the innovation cause. So in order to address this gap, the Finance Commission recommended a creation of Center for Innovation in Public Systems to identify, promote, recognize, and replicate innovation in public systems. So it was then very natural to develop an award scheme which would help us to create a hospitable environment for innovation and which could honor the spirit of innovation in the public systems. So we studied the existing award schemes at the state and national levels, and we found out that there was an abundant scope to create an award scheme which would focus on innovation completely. So as you know, the awards are segregated in 4 categories: health, education, e-governance or information technology, and rural development and environment. This segregation was done on a regional basis. Research tells us that each region has a unique culture and a work ethos to deal with the unique challenges they have in that state. And therefore, it will be easier for replication on a regional basis when they find similar cultural milieu or similar social milieu. It was also felt that this would provide equal opportunity to states as well. So after this award scheme was made, as Dr. Bagchi said, it was hibernating for a while, and we have been working to implement it. And the fact that we have seen today where it is coming into the light of the day is a matter of great pride for all of us who's worked on it. So incentivization and inclusiveness is a key to crafting a new dimension of innovative competitiveness. I'm very glad that this first award ceremony is happening in Shillong because the Northeast in general and Meghalaya in particular is extremely rich in biodiversity and natural resources. This holds limitless potential. And the fact that the Honorable Chief Minister has consented to award the scheme is also an icing on the cake because his multifaceted leadership will resonate with our innovators and it will provide a source of encouragement and motivation to them. So while we wait for his arrival, I would like to thank you for you being here with us. And I would like to say in the end that our individual journeys have led us to this moment, this space, and this purpose. Like in all great journeys, the outcome is unknown, but it is ripe with promise. So bonded with celebration and dedication, we will move this vision of making India a robust, innovative ecosystem to reality. Thank you very much.
Thank you, Dr. Hazarika. Now, continuing our journey, we have the privilege of hearing from Shri Sampath Kumar IAS, Principal Secretary of the Government of Meghalaya. His discourse will shed light on utilizing state capability enhancement to drive policy and innovation in solving complex development problems. Sir, I request you to come up here and share your insights.
Dr. V.K. Paul, Honorable Member Niti Aayog, and our guest of honor, and Mr. P.V. Ramesh, our former IAS officer, and also who's the chair of this entire Cips Innovations Awards Committee. And I also wanted to thank Dr. Bagchi, Dr. Wali, and Dr. Hajarika, ma'am. So all of you, and also all the participants, especially in fact, I can see a lot of colleagues from different states of Northeastern India, Mr. Shantanu, Barnali, and all of you. I think I can't name all of you. So everyone, each one of you who have participated in this entire process, and also all the participants who are here, mostly from the northeastern states and especially from Meghalaya. My colleagues are there, Mr. Ram Kumar and everyone. So today I wanted to, in fact, you must have seen, this is a Government Innovation Lab Meghalaya. So what is that? I think maybe there's some, you might be curious to know. So this is an institution that we have set up after, a lot of practice. We did a lot of experiments, and that experiments, we call them as a state capability enhancement, experiments. So how actually we can build the state capability. What is the state capability idea? So I wanted to say state capability building means state has immense capacity. This is our faith. I think it is the only state has the immense capacity. Again, I'm reiterating, has the capacity to, bring transformative development. Yes, private sector can bring development, but the state has immense capacity to bring the transformative development. In fact, this is the new theory which is coming up very, very seriously. If you have read Mission Economy by Mariano Mazzucato, also they say that like whatever we are seeing, these iPhones to everything has come because of Mission Moon project by John F. Kennedy. So basically a vision that like we wanted to go to moon, that led to different building of different technologies and ideas and innovations that led to, today what we are seeing, that entire transformation in the technology. So state has that kind of a capacity. So we thinking that one for last over 6 to 7 years, we have been actually experimenting sector by sector. I like what Dr. Bakshi said. ASCII also works in sector wise. So initially we started by the rural development sector, and then we started actually experimenting how actually we can bring that, improve that entire rural and agricultural development of the state. So there is a lot of, the idea is that we have, we state do have immense resources in terms of the 45% to 50% of the state budget on the human resources. So that itself is a huge capacity. So what we invested is that like to bring the sense of purpose among the human resources of the state. We call it a public service motivation. So we started with that particular idea and started actually, bringing that entire, mobilizing the entire government workforce at a different levels, especially at the cutting edge level. We call the frontline functionaries, frontline officials, those the district teams, block teams, and the village teams. So that intense mobilization of this exercise led to the rural development outcomes by 6 times in 5 years, in the sense of financial outcomes. Like, for example, this is the X is the budget. Now in 6 years, it has the, 6X kind of a thing. So so we could see that kind of a progress by taking that, the example. Then we started focusing upon the human development indicators, starting with health sector. So again, we have a lot of challenges in terms of our health, as rightly said, most of our hill states and and especially northeastern states have unique challenges. So to provide, to really improve those indicators, we have different ways to look at it. So there again, we understood that there are few things that we have employed, like I'll tell you. And while doing this entire, especially health sector work, we have started using a 5-pillar framework. So that again, if anyone has time, you can see this one here. It's a 5-pillar framework. First, actually, what is that like? How to build that local leadership by problem solving. So what we did, we asked the MOs, how can we, this is the maternal death. So, these are the high-risk mothers. How can you actually save these mothers? Then the innovations have come from them. They said, no. So why these mothers are dying? Because these are the challenges. These are the, economic barriers. These are the cultural barriers. These are the social barriers. So one by one, we started actually working on them. So while doing that, when, we also, we could see the change that is coming up. In fact, so that one is that like building that, very motivated cadre of like medical officers, supported by the other departmental officials. Like that's like a core function is done by the health department, but support function is done by the social welfare department and CDPOs, and and these especially CNRD department, community and rural development department. So this entire collaborative efforts and building that local leadership at the grassroots level has resulted today. We could see like a 50% reduction in the maternal deaths in the last 3 years. In 3 years, we could see that there is a drop, and that's our vision is like to make it like a single digit. So that's one part I would like to say. That's one pillar. Second is that we also felt there is a need to strengthen the citizen-state relationships. That's another framework what we started strongly believing in by experimenting in the COVID and everything I mentioned earlier. It's a building the citizen-state relationship. So we are very actively, building the community institutions. Building community institution is building state capability. This is like something that is the biggest insight that we are getting. Just invest in the community institution building. So that's something we brought a elected health local bodies in the state called village health councils. That's something, an innovation that we brought in. In fact, as part of this, award is also one of those activities that what we did. This is a second pillar. Third one is that effective use of data and research. This is something research. I want to tell you, in fact, Dr. V.K. Paul sir is here. We understood, in fact, we don't have many resources like many states. We are landlocked state. So how to actually, what we have is the human resources. Everyone used to say that like we have a huge total fertility rate, but, we have also cultural issues. We can't address the total fertility rate that easily. So we wanted to say that how actually whatever the human, the children are born, how to unleash their full potential. So we have taken the research of science of early childhood. In fact, we work closely with Harvard Center for Developing Child, and also with the Niti Aayog under the guidance of Dr. V.K. Paul sir. So we actually designed a program to build cognitive capital of the country. So that's the idea. So basically, I've been listening to some of your. So if you invest on the children, once they become adults, they will be more productive. They're economic capital. They're not like, it's not ECD. We are seeing early childhood development investment. That way we started seeing is like maybe our idea is that next 15 to 20 years we wanted to have that kind of a cognitive capital in Meghalaya. Then the fourth one is the systemic barriers have to be removed to bring any transformative development. So one of the things what we have been working is the gender. Everyone thinks that Meghalaya has matrilineal society, but women are not actively involved in the public affairs. So we brought some kind of a mechanism, like especially self-help group movement. 91% of the households are covered, and we also actually brought women's reservation in the village employment councils, which are very, very important councils headed by the traditional headmen. So where today we have about close to 60% of the leadership of the village employment councils is headed by the women. So basically, in Meghalaya, in these councils, in alternate elections, only women can contest. So in alternate elections, only women can contest. So that actually has given a biggest impetus, to address some systemic barriers. Now their participation is going to help us in terms of improving the human development outcomes and also economic outcomes. Then the fifth one is actually what we have been actually doing, in fact, is that a lot of building the political supportability to sustain these interventions. So very consciously, a lot of in fact, interventions, we engage the legislators, we engage the cabinet ministers, engage, in fact, our chief minister very proactively lead a lot of efforts. So a lot of this wins of human development interventions, for example, when we were lowest in the immunization in the country in 2019, we lost 25 crores from the NHM grant. So then 2020, we made again a kind of a challenge. We have taken it as a challenge, and we became number 2 in the country. So then our chief minister was very happy. Okay, we can solve these problems. So then we started getting more and more investments from the state. Today, Meghalaya actually is number 1 state in terms of percentage of budget expenditure on healthcare. It's almost close to 9%. So I wanted to say this is a kind of a framework we've developed. To implement the framework, we also come out with a very simplistic thing, and you all aware, but I'm just putting it in a word so that it's easy. So we require only 3 people to we see in the state level, three actors have to be nurtured. The first actor is like authorizer. Authorizer can be the chief ministers, cabinet ministers, or the senior government officials. So we need to really identify the authorizers, and if the authorizer like gives a challenge to you, you can deliver it. So there are a lot of champions are there. Identify the champions, you nurture the champions. And for these authorizers and champions, you need to put some development facilitators, and facilitators you require. If you have the facilitators, then the facilitators will actually, provide the data, research. In fact, we engage a lot of, this research, data, analytics, and also a lot of convening these meetings, making people to reflect on what is happening, what is not happening. In fact, so I told in the morning that like our problem for maternal mortality rate is, lack of birth spacing. I think this kind of thinking comes when you have this kind of a iterative approach. That's like a problem-driven iterative adaptation approach. So these are the things that we have been following, and so this Government Innovation Lab is very happy to associate with Cips, because we found like there is a common thinking in like the way they are thinking. So we would like to, and we are very happy to host all of you. And we all have to work like a team, I would say, because this is in fact, as Dr. V.K. Pulsar, when he met some Maharashtra people, they are here actually for doing some formative research and helping us in ECD. He's saying Team India. So okay, so it's like a team, especially the northeastern states, hill states, and difficult, challenging states. Not many people understand this one, but like we all have to work like a team, and then that's something. In fact, there is a great value in this knowledge exchange. We learned a lot from some of your experiments. In fact, our team are noting down a lot of things. We will come back to all these awardees that like you to take your inputs also on those initiatives that you have taken up. So with this, I again thank each one of you for participating in this program, and for giving us the opportunity to host all of you. Of course, thanks to ASCII and Cips, they have come forward actually. In fact, we are very grateful to you to have this one, and we would like to have very long-term engagement with you. Thank you so much.
Thank you, Sri Sampath Kumar. Well, sometimes when you're in a room full of wise people and brilliant speakers, what happens is that sometimes the letters on your sheet start dancing and your throat runs dry. And that's exactly what had happened to me earlier, so I apologize for it. And ladies and gentlemen, now I'm delighted to introduce our esteemed guest of honor, Dr. Vinod K. Paul, member of Niti Aayog, Government of India. Dr. Paul is a globally recognized medical scientist and public health exponent who has played a pivotal role in shaping healthcare initiatives in the country. Dr. Paul's illustrious career includes serving as the head of the pediatrics department at AIIMS, New Delhi, and as the chairman of the Board of Governors of the Medical Council of India. He has been instrumental in key initiatives like Ayushman Bharat, PMJAY, and Poshan Abhiyan, currently leading the health, nutrition, and HRD verticals at Niti Aayog. Dr. Paul is a core member of the Union government's response to the COVID-19 pandemic. With over 400 scientific publications and global recognition for his contributions, Dr. Paul brings a wealth of expertise to our event. Ladies and gentlemen, please join me in welcoming Dr. Vinod K. Paul to share his insights on national strategies and innovations in comprehensive primary healthcare and well-being.
Good evening, namaste. Respected Sampath Kumar ji, respected Nirmalya Bagchi sahab, Dr. P.V. Ramesh ji, Madam Valli Manickam ji, Madam Anjali Hazarika ji, distinguished friends, colleagues, administrators from northeastern states, hill states, very warm welcome.
I extend my cordial welcome to our chief guest, the Chief Minister of Meghalaya, Shri Conrad K. Sangma. A big round of applause for him. Thank you, sir, for being here with us. And we had our guest of honor, Dr. Vinod K. Paul, who was about to deliver his address, and you made it right on time.
Thank you. And once again, namaste, good afternoon, good evening. Most respected and honorable Chief Minister of Government of Meghalaya, Shri Conrad K. Sangma sir, respected Shri Sampath Kumarji, Principal Secretary, Government of Meghalaya, respected Dr. P.V. Ramesh, Chairperson of the Awards Selection Committee, as well as Advisory Council of Cips, Dr. Anjali Hazarika ji, Dr. Nirmala Bakshi Sahab, Madam Vali Manikam ji, and distinguished administrators, colleagues from northeastern states, the hill states of India, friends. I'm truly honored to be here in the presence of so many of you, and in particular, in the presence of the Honorable Chief Minister. I represent the Niti Aayog. The official mandate of Niti Aayog includes two specific elements, among others. One relates to promoting cooperative federalism, promoting for the nation a journey for development and welfare by working together, cooperative federalism, facilitating the work of the states, helping the states in multiple ways, including being a friend of the state in the union government, the capital, and also helping the states to develop the agenda. And Honorable Sir, that becomes very important in the context of our shared journey for the Viksit Bharat at 2047. We have to start thinking about how to move forward, and Niti offers its role in that regard. The second key word of the mandate is competitive federalism. So that we compete with each other, we excel. And if everybody tries to excel as a nation, we reach higher heights, higher orbits, higher achievements. So today, I'm part of presence here, both for cooperative federalism and for competitive federalism. This meeting is about more of, I would say, competitiveness, but then I had a wonderful opportunity of visiting the health parts, a few glimpses of, seeing a few glimpses of the health sector, and was involved in speaking to the team at the grassroots level, and also Secretary Health, to be able to think about ways of how we can work together to take a few ideas further. So for me, it's a great day in fulfilling the mandate of Niti Aayog in Meghalaya, competitive federalism and cooperative federalism. Sir, I had the opportunity to understand the work of the Administrative Staff College of India, and also the Center for Innovations in Public System, incubated by the center. So I'm going to begin there. First, to appreciate the good work that you've been doing, appreciate the responsibilities that you have taken to promote governance in the nation, in the country, and in particular, the present initiative, Madam Vali, under your chairpersonship, of promoting innovations in the public space and the public systems. Truly needed, and we believe this idea of the Finance Commission, 13th Finance Commission, is really a catalyst for doing better in the service of people of India. I have a couple of asks now. One, we are moving in the direction of strengthening of the health system, then stronger health systems. A lot has happened in recent times. Meghalaya's journey, I'll come to specifically, but all of the entire nation has seen a transformation and a resolve to transform further the health sector. Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, which the government of Meghalaya has extended universally for its citizens, for its residents. The Ayushman Bharat Health and Wellness Scheme, creating more than 160,000 Ayushman Arogya Mandirs, centers, is transformative, building a primary healthcare bedrock of our nation, which will serve in a very, very big way. Just it's a platform, and lot will be done through this. The medical colleges, the government medical colleges have doubled, PG seats have doubled, undergraduate seats have more than doubled. And we have seen progress also in social determinants of health with Swachh Bharat, more than 10 crore toilets, Ujjwala connections, getting clean air and reducing drudgery. And every second, a new water connection is being delivered in the rural heartland of India. Suffices to say that in this journey, there will be challenges of governance. And the one that I would like college to think about is how do we run our medical college hospitals, public medical college hospitals and district hospitals professionally? It's a gap. What we try to do is, somebody becomes in charge, somebody is medical superintendent, training, often not there, experience not there. We just pass on these jobs. In the country, the discipline of hospital administration as a postgraduate degree is really not very popular, very limited seats. We should increase those seats. That's one part. But then moving forward, our hospitals have to run the way they should be run, in the best possible manner. How do we create that system apart from training in a formal way, the degree holders in this area? And even that, how can that be done better? Because district hospitals and CSCs for that matter, and the medical college hospitals of the public health system pillars are really not so efficiently done. Supply chains, patient satisfaction, use of digital systems and so on. So the short point I'm requesting is, can we create a paradigm for running the hospitals in the public sector efficiently to the satisfaction of the people, using the best principles of management? So that's one ask I have, and I'm sure we will contribute to build innovations in that area. Second, I like us to see that for Cips in particular, innovations through the lens of SDGs. You apply that lens. You in any case are doing it. But can we be focused? Because for the journey toward the goal, the aspirational goal of Viksit Bharat at 2047 lies the 2030 commitments of the nation. How can we particularly encourage SDG related innovations? And here, my concern, well, first I should say in any case in the health sector, which we're doing, but in the education sector. You may have seen one report recently, it was on the headlines yesterday. The learning outcomes of our children in government schools are pathetic, to say the least. Does not behove, a great nation that we are and we aspire to be. Can we look at how education-related innovations and education-related progress is expedited? There are many issues around education, fragmentation of schools, generally speaking, not being specific to any state. Too many, 34% of the schools have less than 50 students, for example, I'm told. Single teacher schools. How can single teacher teach everything, every class? This has to change. This is about human capital, Sampad, that you are talking about, and you talked about the other part. I'll come to that. So I wonder, let's prioritize in a certain way awards and encouragement and pathways to innovation through the filter of SDGs in general. But my plea would be in particular in the education sector, apart from health and nutrition, which you are very much doing. I like to, Honorable Sir, compliment the good work that an extremely good work, very impressive, inspiring work that your health team has implemented under your leadership, sir. I spent the day visiting several facilities, health and wellness centers, as I said, in particular CHC, etc. I'm very impressed on some of these initiatives, and I want to name them, sir. Firstly, institution of village health councils. This was a missing link, sir, in a way. Much needed. This is a master key, sir, that you have created, because this will transform the health in a very significant way. I found them charged. It's also early stage of implementation, so there is more josh, more involvement, and the pathways that you have created for their interaction and to support health system will be very important. The Honorable Prime Minister always reminds us for every sector, in particular health sector, to have Jan Andolan, to promote the behaviors, accountability of the health system, delivery of the services to saturation levels. That's why, very respectfully, sir, congratulate you, sir, and compliment you for this decision. Sir, your CM's Safe Motherhood Scheme is showing result. I'm very pleasantly, in a way, surprised, but in a way I expected with the team that you have. You have shown a significant decline in maternal mortality, which has been a very naughty problem for this state. There is a distinct change. Some strategy have been highlighted by Sampatji just now, so I'm not repeating them, but those are working, and we are seeing an impact. Solarization to ensure cold chain stability around the clock, as well as delivery care in particular around the clock, is also very, very innovative. I guess I would like to give an award on that if I was on the panel. Drone delivery, fascinating developments I've heard, sir. I think drones will be extremely useful for hilly regions like yours and other hill regions that a lot of you represent. You have shown it almost a working model of ensuring. See, people expect generous availability and seamless 24/7 availability of medicines and diagnostics in public sector facilities. We have not been able to do it. And that's why the trust is not there. Faith is not there. Footfalls are low. Even when we are sitting in very sincere manner. Drugs are also, medicines and the diagnostics are the major reason for out-of-pocket expenditure and poverty that it leads to. So ensuring medicines 24/7, seamlessly, enough inventory in every place, computerized system, linked to that delivery to be done through means that trespass, that do not go through the roads necessarily, is extremely, extremely important. And sir, the initiative, which is close to your heart and mind too, sir, is the early childhood development. We have been talking about it, sir. I'm seeing that's being rolled out. And intellectual capital, the intelligence capital of Meghalaya needs to be harnessed. And here, friends, what I wish to highlight is their focus on 0 to 3. 3 to 6 child comes to the Anganwadi, and we promote childhood development through activities for food, related work, and so on. That's fine. And it flows well into the school. But remember, it's in many ways too late. By 3 years, 85% of the brain is already done. Connections are already made. Earlier the period, I'm a pediatrician, doctor. Earlier the period, fetal life included, more important is that day for child in terms of the learning. Connections are being made in lakhs. Millions of connections are being made in seconds and minutes. And they have to be made use of. So a comprehensive ECD program that the Honorable Chief Minister has guided and organized. I want you all to look at this, please. Don't wait for a central government scheme. We will do our part. It's there in a way. But to really take it to scale, please invest in this. That's really about the intellectual capital. If you work hard from the beginning, much of the faster speed of learning cognitive skills, language skills, social skills is the first year. Then the second year, the first month. So once we lose this time on scale, it's not going to come back at all. We can only do crude word, patchwork, whatever best you can as an afterword. So please don't lose 0 to 3. And 0 to 3 is about families being empowered, supported by the health system, supported by Anganwadi worker, supported by technology. You see, you learn, you speak. There's a methodology, and I'm honored, I'm very humbled to know and say that the government of Meghalaya has given the right priority, and more importantly, they brought the right design of the program, and they're designing the right tools. I like you to see this innovation on a scale which is being rolled out here with a very passionate team, and I would like you to really pay attention to this. Very briefly, I also like to compliment and alert you to the primary healthcare system that the nation is building, that you all are building. The Ayushman Bharat Health and Wellness Center mission is not like any scheme or a single scheme. Lymphatic filariasis elimination, even anemia control, even dialysis scheme or something. No, we are building through this the bedrock of India's health system. Health and wellness centers, Ayushman Arogya Mandirs as they're called now, are the platform on which a lot of care has to be loaded. Non-communicable diseases, we can only address through primary care by detecting early, preventing with good practices and good lifestyle, but then detecting in time. I'm sure in this audience, 40% of you would have hypertension, but you have a normal blood pressure because you control it. So hypertension, even if it occurs, good that we can prevent. If it occurs, can be controlled. It doesn't damage the heart. Diabetes, 10% of you would have diabetes, but you are controlled. Your system is not, your diabetes is not harming the kidneys. But if the poor person's diabetes remains undetected, I don't even know I have it. I end up for dialysis and kidney transplant at the age of 47. My children are not yet married. They're in the school. So prevention pathway runs through primary health care. That's the vision. It is the seat of health promotion. It is a seat for primary prevention, secondary prevention, rehabilitation. We are yet to build the mental health primary care paradigm. We have yet to build a paradigm for oral care, dental care. I had some discussion with your team. We can go faster than even waiting for the central government to launch these. We have to start looking after the elderly in this game. So this scheme, please, may look modest even in money terms, perhaps, but is the foundation of India's health system. National Health Policy 27 talks about spending almost 2/3 of government spending on primary health care. So this is a special one. I want you to go back and think about how you are implementing this. Are the packages being loaded? We have the CHO, we have the telemedicine, but seamless supply of drugs, the diagnostics, building trust with the people. So this is something that's very close to my mind that I would urge you to please pay special attention to this. This is again a master key for the healthcare of the people of India. Sir, in the last point, I compliment the 5 pillars of health that Sampath has shown, but I also want to thank you, sir, for being in the top category of states for spending on health, sir. So you have excelled 9% of the budget. Please, other states, you all are at 5 and 6%. Learn from Meghalaya, 9%. The National Health Policy 2017, as well as 15th Finance Commission, have recommended 8% spending. Puducherry, Goa, Delhi, and Meghalaya are the only ones who are 8 or above, and you are 9, sir, which is remarkable. That shows your commitment, that shows where your heart is. And I'm very proud to say that your team is delivering on the promises and on the value usage or creating value for the health system, and those changes I have referred to. Very, very proud to be here. I would like to see now hear more about the awards, and I look forward to the guidance on the Honorable Chief Minister, sir, we are there at Niti Aayog to be to be to be a catalyst, to be a friend, to be able to promote your work, your development agenda, your visionary agenda, and I will take back that message to my leadership. Thank you very much. Jai Hind.
Thank you, sir, for addressing important issues pertaining to health, child development, education, and so on and so forth. In the afternoon, one of the speakers had said something, and it's etched in my memory. She had said that the impact of education is not immediate. Yes, it's true. The impact of education is not immediate, but the impact of education is timeless. And it is because of the innovators and leaders like you that the impact of education will remain timeless. So big round of applause for each one of you. Now I'd like to invite Dr. P.V. Ramesh, a distinguished IAS bureaucrat with 4 decades of experience who will share insights on innovations and the way forward.
Honorable Chief Minister of Meghalaya, Dr. V.K. Paul, Mr. Dr. Bakshi, Sampath Kumar ji, Madam Hazarika and Madam Valli, and friends, all those who are gathered here today, sir. I'll be very brief. I know how stretched you are for time. So I will just briefly outline some of the key issues. I mean, today we are celebrating with your august presence, the first award function for the public servants who have innovated in the northeastern states and the hill states across the country. We have people here from Leh Ladakh, Jammu Kashmir, to all states of Northeast who have done public service out of passion, which we've spent the day trying to learn from each other and carry back, particularly from your state. And your state has a distinction of perhaps leading the way in this direction. I'll just take 2 minutes to introduce once again the Administrative Staff College of India, for which Mr. Bakshi is the Director General, and I happen to be one of the Board of Governors, and that's what brings me here. Though I've retired from the IAS, I belong to the 85 batch. And the Administrative Staff College, Mr. Chief Minister, was set up in 1956, much before the IAMs were set up. I mean, the whole idea was to build the capacity of the senior civil servants, industry, the public sector undertakings to lead India into the new century. And it has 16 different sectoral focus, and it covers a whole range, works with the state government, central government, private sector, public sector undertakings in building the capacity and bringing them together. The Center for Innovation in Public Systems was established in 2010. This was the idea that came collectively from the Finance Commission, 13th Finance Commission, which felt that there's so much innovation that's going on in the public services, but it's neither documented nor shared. And very little is learned and very little information is available. And that's how it came into existence. And by virtue of being a finance secretary of Andhra Pradesh, it used to be streamed through me. So that's how I got associated fairly early, way back in 2012. And we continue to work with the Center for Innovation in Public Systems. So the whole idea is to bring knowledge, experiences, good practices, and also learn what are the practices, initiatives that have not worked. That is the main purpose, sir. Now, this is the first award function, and we specially chose Northeast India and the hill states, considering the unique challenges that one faces, but the commonality that exists between these different states and the knowledge that can be shared and learned from each other. And then we are very inspired by your own state and your experience and your leadership. And the way that you have given a vision and a drive and an institutional backup. And particularly in the days we are relearning that the old neoliberal Washington consensus is being rewritten in Washington itself, that the state has a major role to play in transformation, in creating a level playing field, in where there's a market failure, the state has an important role. And then I see that happening in your state, sir. And the way that you created an integrated and comprehensive strategy, adopting a life cycle approach and focusing on the human development indices, sustainable development goals, and investment in future. I think these are the areas which we have chosen for the award function today. Health, education, rural development and environment, and digital application in governance. These are the 4 areas in which there are 18 innovations that the public servants, and this is an opportunity to inspire the public servants to greater dedication, and particularly these days when public servants are looking at the private sector and for better opportunities. I think this is really an opportunity. So my request to you, sir, and as somebody who's worked in Northeast for a long time, though not directly, I've been associated in 1997 when I was working for International Fund for Agriculture Development. We designed the first Northeast resource management project. And with Mr. Frank Roy's inspiration, those days, Mr. Ashok Saikia inspiration, and your own father's leadership. And that led us to the state. And I used to come here every 3 months, and between 97 and 2000. And later as REC chairman, sir, I met you a couple of times, and we helped to electrify the state. So I have a passionate personal commitment, and I'm very inspired to see the work that you're doing, and your colleague, your officer, Dr. Sampath Kumar. I mean, the sense of commitment and the sense of vision and the sense of energy and drive, and which you have infused into your official team. I think this is the opportunity to celebrate that innovation, and then inspire people and also to lead. So, sir, what I would like to request is that both the Cips and ASCII is essentially created to be a catalyzer, a crucible, a platform. And so we could work together, and you could lead us in that direction, and we could network, because there's so many of you here who have done wonderful job. And many a time, my own experience had been that civil servants see themselves, sir, I mean, unless there's a political backing, you innovate, you work very hard, you dedicate yourself. When you move on, everything is done away with. And we rarely have realized that civil service is a long chain. There are many people before us. There would be many people after us. But every link in the chain is as strong. The chain is as strong as every single link. And if there is a continuity, and that continuity can only come from a political leadership and the community ownership and the grassroots mobilization, the institutional structure and the capacity to make it happen. And I think you really are showing the way. I would like to believe we really set up this function here and thank you for your support. And Mr. Sampath had really extended all the conceivable support to us. And we set it up here because we thought this is a platform in which we would take inspiration from you, and then we would carry it back. And it's not just go back, but actually stay engaged and continue to build on what we have learned today during the course of the past 8-9 hours, during which we've been deliberating and the awardees have been presenting their own work. And this is important. So this acknowledgement when you are laboring alone in remote areas. And I myself have spent 10 years working in the tribal areas of Andhra Pradesh, way back in 80s and 90s, when Naxalism was at its peak. And I know how hard it was. There was no support, neither political nor administrative. We used to labor on our own because we believed in public service. We believed in doing something for the society. And I think there are any number of people, young people who are here, who have that faith, that belief, and they must feel supported. They must feel recognized. They must feel encouraged. And we look up to you, sir, to lead this process in Northeast and Hill states. And it's a glorious opportunity, and I'm privileged to be speaking to the audience who are so distinguished. Thank you very much, sir.
Thank you, sir. So now our moment of celebration awaits us as we move on to a very significant agenda item. I'm pleased to announce the release of the book, Celebrating Inclusive Innovations. This publication not only signifies the culmination of noteworthy efforts, but also encapsulates the spirit of inclusivity in innovation. To do the honors, I'd invite our chief guest, Shri Conrad K. Sangma, to release the book. Can we please have a big round of applause? Here you have Celebrating Inclusive Innovations. Thank you. Our next speaker is a dynamic leader who has been instrumental in shaping the innovative landscape of Meghalaya. His visionary leadership has not only brought positive changes in the state, but has also inspired many. By now, you must have guessed it. Please join me in welcoming Chief Minister Conrad K. Sangma to share his insights.
Guest of honor for today's program, person I have known for quite some time, and a person who shares equal passion, as he said, on many, many issues that I also truly am passionate and believe in. I should say a dear friend of mine, Dr. Vinod K. Paul, who is a member of the Niti Aayog. We are also joined by my colleague in the cabinet, our Honorable Minister for Sports and Youth Affairs, Basha Clear Wajuri, Dr. P.V. Ramesh, the chairperson of the award committee, all the other dignitaries who are present on the dais, and all the other guests who are here from different parts of the country today, and especially the Northeast. I've had a very long day, and we had everything from NEC plenary session to the NESAC meeting to a just concluded cabinet meeting. And in the last few days also, we had the Honorable President being here for 3 days. And we had the Meghalaya Games inauguration, and my brother-in-law got married. So I've been quite busy in the last few days. But I saw the program and I was just going to tell you all of this only to realize that you have been equally busy. So you started off at 9 a.m. in the morning. So I really cannot complain, number one. But I do apologize for being late, number one. And I do apologize because I really was not able to spend a lot of time with all of you. And I really could not go through all the aspects of this program because of the visit of the President and Mr. Amit Shah and all the other things that I just mentioned to you. So in short, I really don't have much to say, but I do have a lot to say at the same time. As you know that when I heard everybody speak and I was listening to the individual speakers just before me, I could sense the kind of passion and the kind of issues and the purpose with which we are all here. I don't want to go too much into details, but first of all, of course, I would really like to congratulate the Center for Innovation and Public Systems for organizing this program, and of course, the knowledge partner, which is the Administrative Staff College of India, and all the other officials who have been involved in making sure that we are able to make this program a success. And as was just being mentioned by Mr. Dr. P.V. Ramesh, that it is a recognition for the kind of work that all of you have been putting in and the public service that all of you have been involved in. I just want to share with you my own experiences, and I think that would be the best way to really take this discussion forward and to share how the last 5.5, 6 years has been for me as the Chief Minister of the state. And the first thing I want to tell you is that I really did not do anything in the last 5.5 years. And that's really a fact. And the reason I tell you that is because I believe that political leadership should give the goals and the targets that you have, should lay down the vision, and should put a time frame as to when you want the results to be there, by when the work should be complete, and what is it that we want. And then we should allow the system to work, to be able to innovate if necessary, and to be able to work in an independent manner with least political interference. And I strongly feel that may be the best way to actually, at the end of the day, achieve the goals. Now, I'm saying it so simply because it sounds very simple, and maybe it is a very good way to move forward, but it's not always the easiest. I had a 6-party coalition in the last 5 years. And of course, I have the same coalition partners this year also, though we contested in the elections against each other. But I was very clear with my coalition partners that I believe in trust, I believe in a teamwork. And even though our numbers went up as a political party, I increased my seats by almost 25%, but I stuck to my word of ensuring that I would be with my coalition partners. And the example is right here. He is from our coalition partner. And we still work together. And that team spirit, we continued. And I based my coalition work in the last 5 years based on principles. And when you work on principles, then it applies to everybody. So nobody can complain that you're being good to him and not being bad to her. But so that's how we have worked in the last 5 years, 5.5, almost 6 years now. And we have actually been able to make and move things forward. I would be quite confident in saying, and I think Ram, Sampath, and my other team members would agree, that I do give them a lot of freedom to work. Because I believe that they will do the right thing. And I have always told people that in leadership, if you, number one thing you need to do is to get the right person and then allow that right person to do the right thing. And if you're able to do that, I think half or more than half the work is done. So therefore, in the last 5 years, as I said, my team has innovated. I have not innovated as much as you may think. I think I was given too much of credit by Mr. Ramesh and by Dr. Paul. I gave the vision. I said, I want the numbers to come down. You show me how it can be done. And when the presentations were said, I said, this is what we do, this is what we do, and this is what we move forward. So hence, just to cut short my entire discussion and talk on this entire issue of allowing people to work, I think that is one of the biggest challenges we face in the country, is what I'm trying to say. And I've seen this, not to complain about other states, but I've seen that the political side is sometimes a hurdle to innovation. And we've seen that in many areas, we have that kind of a problem. And if we have lesser political interference and just a sense of vision and direction, I feel that there will be much more scope of us moving forward in terms of actually innovating and getting things done. So when I tell you that, I just want to give a point to all of you also, that when we are allowing the decentralized approach to be there, you need to do the same thing. And I was explaining today, I was in the NEC meeting and I was explaining to the entire NEC, the Northeast Council, and respected Home Minister was there. And I mentioned to them that we have basically got an allotment of about 750 crores or something in the last 5 years. And we've been able to utilize only half that amount. And I explained to Honorable HM, who is the chairman of the NEC, that in another scheme of Government of India, which is under the Finance Department, which is a capital assistant on special assistance on capital investment, Meghalaya has or is going to be taking an amount of almost 1,800 crores this year alone in 1 year. Whereas our normative allotment is about 700 crores, we are going to go 1,000 crores more because our capacity to absorb and to implement is much higher. Similarly, in Jal Jeevan Mission, we'll be implementing projects worth about 1,400 crores this year, whereas our budget provision was only about 400, 500 or 600 crores. And whereas in NEC, though our budget allocation was 700 crores in 5 years, we could only implement 300 crores. So I was saying, why is this? It's because there are too many rules. There are too many guidelines. You explain to us and you tell us that, okay, these funds are there, but you can't use it for tourism, you can't use it for administrative building, you can't use it for roads, you can't use it for this and that. So what do you use it for? Because we need roads, we need block offices, we need administrative buildings. Northeast states and other smaller states don't have their own taxes as high as other states. So hence the rules and the provisions that are there in different departments are sometimes not as friendly, and sometimes rules actually become a problem for us to be able to move in an innovative manner, as you said. So what I am trying to tell all of you is that whenever you get a chance in a position that you'll be able to work in the future, can we and kindly do look at ways in which you'll be able to reduce the process, reduce the rules, decentralize, allow the states, allow the districts, allow the blocks to be able to, work in the way they feel best. Monitor it all the while. Have a good technology and system in place, but you need to trust and you need to allow the people to work, and that is how things happen. When we are allowing our team to work, the team has to allow their subordinates to also work. So I hope that all of you, while going away from here, my first and foremost suggestion to all of you is that, the way you would like to be treated, please do treat others the same way. The way you would like the system to work, make sure the system under you also works in the same way. And sometimes we get stuck up with the rules and policies so much that we are not able to move forward. And we actually, no matter what innovation you do, you'll not be able to succeed. So that's my first point that I would like to make to you. My second point that I would like to say is that innovation is great because obviously it allows you to really look at things in a different way, whether it's a process innovation, it's a product innovation, whatever you want to do, policy innovation. The point being that any innovation that you have is only as good as it is able to achieve or help you achieve the goals that you want to achieve. So you may have the best technology and best innovation and the best practice that is there in some other part of the country or some other part of the world, but the conditions that are there in, say, Meghalaya or Manipur or Nagaland or any other Ladakh or Kashmir is completely different. So therefore, one has to know what really the problem is. Our issue is, which I keep telling my team, is that we look at the result and we say that is the problem. Whereas that is not the problem. It is a result of the problem. If there's a maternal mortality rate in our state which is high, that is not the problem. It is a result of the problem. The problem is that the institutional deliveries were was low. The problem is we had too many high-risk mothers. The problem is that we were not able to take the mothers to the hospitals in time. The problem is that there was a lesser gap between the birth of 2 children. And hence, as officials, as a government, as politicians, it is very, very necessary for us to really know what the problem is. We sometimes, as I said, don't realize the problem and we keep focusing on the issue and the result. Like I keep talking in a very, very passionate way about Northeast and I say about insurgency. People say insurgency is the problem. Insurgency is the result of the problem. The problem is socioeconomic issues that are very, very deeply rooted in our region for multiple, multiple reasons. And hence, you should be able to look at a problem and be able to diagnose it and say that this is the reason why this is happening, and then apply the right technology, innovation, or policy and adapt them according to the changes and the needs of your own state, your own district, your own block, or whichever department that you're in. So therefore, this is the second point that I would like to make. One should be able to analyze, break down the problems into micro problems, and then find the solution piece by piece. What Dr. Paul was just mentioning about the maternal mortality rate, and we learned it through process. So when we started looking at maternal mortality rate, I said, well, what is the problem? They said, sir, we need to increase the institutional deliveries. I said, great, let's go. So we started doing that. But then as we went on and on and on, we realized that the high-risk mothers are too high. There's a problem because the pregnancy, or I should say the fertility rate, was very high in our state. We had certain mothers who were 24 years old and they were giving birth to their 5th child. So I said, something is wrong in the system. Why are the gaps between the births so less? And then we realized that unless we don't economically engage our mothers and the women in our society, we may not be able to actually in a long term find a more sustainable solution to this problem. And then we started off by doing a self-help group movement. So a lot of people think doing a self-help group movement was just a part of our strategy. Absolutely not. It's linked to the larger problem in our society, where we realize that unless we are able to economically engage our women, we will not be able to resolve it. And hence started a new journey for us. And I think all of you know that Meghalaya may be one of the few states in the country today that has almost 95% of the women in rural areas are part of a self-help group. And therefore, we have almost close to touching now 5.5 lakh women who are, that means almost from one household in rural areas, one woman is part of a self-help group, and they are economically really now engaging. And we are seeing the results of that aspect also coming into the picture. So my second point being that we need to realize that there is a difference between results or the cause and the effect. And if you're able to do that, I think you'll be able to touch the right and press the right buttons and be able to move forward. My third point is really about the innovation only. As I said, innovation is only as good as it helps you achieve the goals. So therefore, sometimes we think that we need to be very highly innovative to get things done. Sometimes it's not so complicated. Sometimes you just need to do the simple things, and the simple things will allow you to get the results that are there. So sometimes in innovation, it also means to simplify the processes that are there in our system and to be able to really make things work in our system. And I've realized that in the last 5.5, 6 years now, that is also one of the major problems that we have. We have just too many complicated systems that are there, which just needs to be streamlined, needs to be made easier, lesser processes, lesser rules, simple goals to be given, decentralization, and I think that's the way to move forward. Third, and my fourth and my last suggestion to everybody is that I've also realized, again, this is to all of you who is out here, that, and I talk to myself also when I say this, is that sometimes we really think that we know everything and we can do everything. And I think that is a really bad thing to do. So, we are, we're very intelligent people, but there's always somebody who's better than you in something or the other. And being able to recognize that and allowing a system then to work, or the person to work in that system, I think is going to give you the results in a much more economical and a much more faster way. Now, why I say that is because I am a kind of a political leader, and I work with public, and I'm not very good at DPRs, and I'm not very good at technical studies and all these aspects. So we need professionals. And I think in today's world, utilizing two things. Number one is the use of professionals. I don't want to go into details of all the aspects, but I'll tell you just a small thing that under the World Bank, under the externally aided projects, I think you will be quite surprised to know that Meghalaya had pitched in and we had almost got clearance for about 12,500 crores. In the last 5 years, we had gone up in externally aided projects from 2,500 to 12,500 crores. So that's almost 10,000 crores in 5 years. We managed to get some level of approval from center, from the agencies, from DEA and others. And then we got noticed. And then madam called me and said that you're taking too much, and so therefore we have to cut you down. I said, madam, you're penalizing us for doing good work. She said, whatever you may say, but we can't give you so much of liberty. So we were able to come up to the level of even the largest states. The externally aided projects in larger states is at 15,000, 20,000 crores. So for a state like Meghalaya to be able to touch that 12,500 crores was a big thing. Now, why it's important to tell you that is because the same proposals which used to take us 2 years, 3 years, 5, 6 years back, today takes us 24 hours. I can get a DPR made on anything in a week's time. The simpler ones, maybe even 24 hours, is because we have a solid team that works behind us, that works behind the scenes. We get everything done as per the rules, requirements, and procedures of larger organizations like World Bank. And I think those of you who work with World Bank, you know how complicated they are, that even to pluck a fruit or a leaf, they will ask 100 million questions. So that also we're ready for, So we're prepared in such aggressive manner. So all I'm saying is, number one, work with good people. Get good teams, get good professionals. If they are not part of your team also, if they are not, in the system, well, get them from outside the system. But get them, because ultimately we have to achieve the goal. That's what's important. Nothing else is important. Achieve the goal, achieve the target. Keep your eye, as I said, always tell my team, keep the eye on the ball. I don't care what you do, but I want that thing to be done. So human resource, good team is important. And number two, equally today, the technology that is coming up in today's world is just out of this world. I think you all know that. I was just watching the launch of the Samsung phone. I'm like a kind of a mobile guy. So mobile means not mobile guy, but a mobile phone guy. I'm mobile also. I've been traveling 7 hours yesterday, day before yesterday, 7 hours, going to Tura, coming back to Shillong. Again, tomorrow I'm back to Tura, day after tomorrow back to Shillong. So yes, I'm a mobile guy also, but I was just watching the Samsung launch. And I was looking at the new S24 Ultra. So it's got the AI where if you talk on the phone in English and the other person across is Korean, he or she will hear Korean. Just on a Samsung phone. Can you imagine? I mean, it's scary when you think about it. That means they are, taking all the voice from your phone and they're actually going to record all of it and keep it with them. And you're going to give access to that. But I'm just saying that how technology today, that you're going to speak here in English and in Bengali, somebody suppose you can't speak Bengali, the other person will hear Bengali. It's amazing. Just on a mobile phone is available. Today, we were having a meeting of NESAC, and I told the NESAC chairman and of ISRO and the Secretary of Space, I was mentioning to them that all this data that we're collecting with the satellite, how can we have these different verticals now start talking to each other in a horizontal manner, and interdepartmental information can be superimposed on each other. And if the information that's coming from, say, for example, the water that we're trying to preserve and where the catchment areas are going down, how is that going to affect the tree plantation in the future through the satellite data we're collecting? And if we can create a predictability model and saying that if we are going to increase the plantation in these areas, then we will see the rainfall go up, or water level or stream level go up in the future. Technology can do that for us today. And if we are able to use that, I think it will be a great, great blessing in terms of policy making for all of us sitting out here, and especially for a person like me who has to take quick decisions sometimes based on whatever limited information that we get. So hence, all of these factors are there. I'm sorry, I told you in the beginning I have nothing to say, but then I told you I have a lot to say. So I'm going to conclude very soon. But as I said, governance is a very exciting subject for me. I can't tell you how passionate I am about this. I'm sure you could get some feel about how passionate I am. And I can just tell you this one thing, which I repeat hundreds of times, is that whenever you do something, you have to have the drive in you. If the drive is not going to be there, you will never enjoy it. And you have to enjoy everything you do. And I'll tell you what clicks me and what keeps me going and what makes me passionate about what I do is one simple thing. I just look at an individual, I look at people, I look at organizations and just tell myself, well, how can I help? How can I just make things better? How can I help and make a life, a person smile, who's been waiting outside my house for 5 hours, 6 hours. Even though I reach at 3 a.m. in the morning, if I see somebody sitting, I'll tell this to everybody. I make sure I meet the person. Not that I tell myself that, oh God, I'm tired, even 3 a.m., they're still here. But then I look at that person and tell myself, well, how long has she been waiting for me? And maybe I can do a small thing that is going to actually help her and change her life. Because I have, by God's blessing, I have a position where I can do it. And I think if this sense of passion that comes inside you, I think you'll be able to achieve many, many things in life. There will be a lot of challenges. Our governance process is very complicated. Politicians make it complicated. Bureaucrats make it even more complicated. Sorry to say that. But we complicate each other, basically. And it's a mess, So we have to really work on how we can figure this out. And to some extent, I should say, in Meghalaya, we have been able to figure to some extent, not perfect, but I think better than others. Not to say that others are not doing good, but all I'm saying is that, whenever they come and they tell me, sir, this is not possible. I said, boss, the MLAs will get upset. Sir, please handle them. Sir, but will you achieve the goal? Sir, we'll achieve it. Okay, I'll handle the MLAs. So that's how we work. So this is important also. And this actually is the biggest problem. I think all of you know it. You will admit that the biggest problem, forget innovation, forget everything, is really the understanding between the people and the team that is actually working, because each one has got their own responsibilities, their own people to take care of, so many complications that sometimes you don't see eye to eye. I think if you can bring the team together and you're able to put your passion and your focus together and work as a team, I think we will be able to really achieve wonders. And as per the Prime Minister's desire and his vision to make India a developed nation by 2047, it'll be very important for us to look into that line. So my closing remarks to all of you is, be nice to the politicians. Just say yes, but get things done the way you think is right. Don't say, sir, the rule doesn't allow, sir, no, we can't do this. That's when things start going wrong. Yes, suppose you say, nahi karna hai ye. Then you say, ha, sir, karna hai. Then you go back and you do what you have to do. I'm telling you very frankly. But take them on board. Take them on board. No, I'm telling you very, very, very candidly, I'm telling you that this is really the problem. So that's number one. Be nice to the politicians and be careful in how you're implementing things. While you do that, implement things. And my second suggestion, as I said, which I told you earlier also, is that the rules, procedures, we need to really streamline them. Things are so complicated. I just gave you an example of two schemes. NEC versus Special Assistance on Capital Investment. 1,800 crores Meghalaya is spending this year, whereas 5 years I could not spend 700 crores from NEC, simply because the rules are so many. I need to change one aspect. Sorry, Dr. Paul is here, but I have to say it. One aspect I have to change. Saying, what is the change? The change is, sir, the building was here, now we're going to turn it like this. Oh, you have to go to Niti Aayog, get their NOC. Oh, you have to go to the line department, get their NOC. Arey baba, yaar, building hi wahi hai. Ye se change karna hai bas. How do you work like that? You can't work like this. So whenever you're in a position to ensure that you can streamline that, please do it. The lesser the rules, the easier it is to work. And last, and which again I'm repeating, is that treat others, especially as subordinates, like you would want your seniors to treat you. If you can have that simple human touch, I'll tell you, everything will be better. And it starts with a simple human touch. It starts with a good heart. It starts with a smile on your face. Sometimes you want to look tough, and so you don't smile. But I don't think that helps. Smile is always good. I think firmness is important, and being, firm with your decision is important. But it's not, I think, important to be tough. I don't think that's the right way to look at things. So treat your subordinates as you would like to be treated, and be a good human being. And I think that's really my suggestion. I know I've gone beyond the topic today, and I'm sure all of you are waiting for the awards, but my idea was to keep you away from the awards for some time. So once again, I congratulate all of you. I really wish you all the best. This is a great initiative. I hope that you continue it in the future because everybody deserves a pat on the back. And just a small pat on the back sometimes can make a world of difference. Because I'm saying it because we never get it. That's why. So we always criticize for everything. So somebody was telling me it's raining, they say it's Conrad's fault. Then somebody says it's not raining, it's Conrad's fault. So that's how we live our life. So it's great. And I assure you that whatever support that we can give in the future, we'll be happy to support and work and work as a team in order to ensure that we can send a positive message to our officials working in different state governments, and obviously as a whole look at the overall development of the different states and the country as a whole. So thank you so much, and I wish you all the very best, and may God bless each and every one. Thank you so much.
Thank you, sir, for putting forward your inspiring words through humor and a lot of impact. And I would like to say that uneasy lies the head that wears the crown. And yet, time and again, you have proved to be one of the most humble chief ministers in the country, because no chief minister would come and stand here and say, my government has not done anything in the past 5 years. Well, as a Meghalayan, I would like to differ because you've done a lot and you've brought in innovative and progressive changes, be it in health sector, education, entrepreneurship, sports. And speaking of sports, I'd like to take this opportunity to congratulate again our Chief Minister, Shri Conrad K. Sangma, and our Sports Minister, Shri Shakliya Wajri, for successful 5th edition of Meghalaya Games, which is currently underway in Tura, and I think it will culminate tomorrow. All right, so now we have come to the pinnacle of the event, that is the awards ceremony. This is the moment to honor and celebrate the outstanding contributions and innovations in public systems. These awards will again be presented by another adjective added to our Chief Minister, mobile. So our dynamic Chief Minister will again present the awards to our awardees. So as I call upon the name, the awardee will take the entrance through the right side of the stage, collect the award from the Chief Minister, and exit from the left side. Our first awardee is Shri Sampath Kumar.
My team, sir.
Man of rules. Our next awardee is Dr. Punchog Norbu. I would request the camera persons to kindly give way to our awardees. No, this way. Yes, definitely. Here we have Dr. Punchog Norbu with his team. Our next awardee is Shri Ram Kumar S. Now I'd like to invite our next awardee, Shri A. Arun Prince Milton. I'd like to call upon our next awardee, Shri Shantanu Gotmare. Our next awardee is Shri Mukesh Repaswal. The award is being collected by Shri Anil Samwal. Next, I'd like to call upon Shri Krishna Kumar. Next awardee is Shri Isaac Zothanpoya. Now we have two awardees, Shri Pallav Gopal Jha and Ms. Panchami Chaudhary. I like how you start clapping with a lot of enthusiasm and it goes down. Let that not happen. Our next awardee is Shri Shyamvir. I'd now like to call upon Srimati Varnali Deka. Now I'd like to call upon Ms. Purva Garg, and the award will be collected by Srimati Ravinder Kaur. Next awardee is, again, Srimati Varnali Deka. May I now call upon Shri Devraj Dhiman. Next, we again have a joint awardee, Dr. Shivkumar Upadhyay and Shri Deepak Shah. Our next awardee is Sri Prasada Rao Vadarapu. Our next awardee is Sri Ajit Kumar Ranjan. To be collected by Mr. Anuranjan Singh. Now we have come to the last, but not the least. Last awardee is Sri Shete Lohe. Now I'd like to request Dr. Nirmalya Bakshi to felicitate our guest of honor, Dr. V.K. Paul. Now I'd request Dr. Bakshi to felicitate our sports minister, Ms. Sri Shakya Wajri. Finally, I'd request Dr. Bakshi yet again to felicitate the chief guest, the Chief Minister of Meghalaya, Sri Conrad K. Sangma. Okay. I'd request all the awardees to come and assemble in front of the stage with their awards. Awardees, I would request to come up on the stage. And the dignitaries can...
I think that is right.
Yeah, please come on the stage.
Oh.
1 minute dance outside. You say that there's a tradition.
I would request you all to assemble outside. There'll be a traditional dance followed by high tea. Uh, there's a slight change. I would request you to please sit down for 2 minutes because the traditional dance will be performed here. So before they perform, I'd like to say a bit about the dance because many of you may not know about it. So this dance is usually performed in the prominent festival of the Khasis, Kashatsok Minsem. It is performed in the spring season, a kind of a Thanksgiving dance where the Khasis express their gratitude towards their creator. Khasis believe that it is the creator who have blessed him with good health and prosperity. As a token of gratitude, the female dancers observe it in a gentle and dainty manner, while the male dancers, on the other hand, are vigorous, dancing in the rhythm of traditional music, waving the white whisk on one hand and the sword on the other. This signifies that a Khasi is a peace-loving, yet he's also protective towards his children, women, and country, and is courageous enough to protect them. I request the dancers to kindly come up on the stage.
เป็นbagus rumah kan mengenai kan nama kan video dan kam audio.
Hello. Hello. No audio.
I'll just call.
Friends, let me take the pleasure of formally closing this event. Congratulations to all the award winners, and we hope to see you all soon in the replication of these innovations that have won the awards. And I hope that all of you have had an enriching day. This entire day has been very enriching for us at Cips and at ASCII. We have learned a lot, and this learning journey is something that we would carry forward and probably implement in the second round of awards that we would be doing and announcing shortly. Of course, I would like to thank the Honorable Chief Minister of Meghalaya for having made it despite his busy schedule. Thanks to Dr. V.K. Paul, who had come in specifically for this event to meet all of you all and to deliver his special address. Thanks to Dr. P.V. Ramesh, who has been guiding us through this entire event and through the entire process. Dr. Anjali Hazarika Madam has been a source of inspiration for us, and we really thank her. As she had mentioned, the genesis of this awards, the framework and the modalities followed were actually framed by her. And today we are seeing that actually the culmination of the awards in such a celebration that we have also seen the local culture. Apart from this, I would be feeling in my duty if I don't thank Honorable Chairman ASCII and Chairman of the Advisory Board of Cips, Shri Padmanabhaya Garu. He has always been instrumental in inspiring us to take new initiatives, to take new challenges. And probably had it not been for his guidance, we would not have even ventured into this entire awards function. Secondly, my colleague, the Director General of ASCI, Dr. Nirmalia Bagchi, good friend of mine, but I should thank him for the tremendous support that he has given us throughout the journey of activities, not just the awards, but also the entire activities that Cips has taken up over the years. The support that we have received from Dr. Nirmalia has been tremendous. I would request Dr. Nirmalia to come onto the dais. We'll present a small memento to you, though late. Of course. Box would have. I request Dr. Anjali Madam to please present the memento. Was Dr. Subodh and Dr. Satyanarayana, who have actually helped us put through this event. It would not have been possible without their guidance and their support. And I would request you all to give a big hand of applause to my entire team. I think Yashashwini, Rajesh, Mr. Venkanna, who are here, but there are many others who are who have been working at the back end to make this event possible. I think a big round of applause to the entire Cips team for having delivered a flawless awards. Once again, many congratulations to all the award winners, and best of luck to those who have not made it to this event. Hopefully next time we will see many more here in this event. I'd like to thank the government of Meghalaya, Sampath Kumarji. I don't see him here, but I think we owe our thanks to him for having made this event so bright and so successful. We would not have been able to pull it off without their collaboration and partnership. Thank you all. Tea is waiting outside. We can break for a cup of tea. Thank you.